Annam Parabrahma Swarupam.
Food is God's gift to us, reflecting the richness of its diet.
Respected dignitaries, delegates, ladies and gentlemen, we're going to start our first session of day 2 in another couple of minutes. Requesting all of you to please take your seats. Requesting all the volunteers and the liaison officers to get all the delegates into the auditorium. Please be seated. All of you who are in the auditorium are requested to please be seated. Grab the chairs wherever you find them. All the liaison officers from FSSAI, please get the delegates in.
Good morning. Good morning, ladies and gentlemen. On behalf of Food Safety Standards Authority of India, I have the pleasure to welcome all national and international delegates on the second day of Global Food Safety Summit. On the first day of the summit, we all witnessed the holistic approach towards food ecosystem by all the renowned dignitaries in the inaugural session, followed by scientific discussions in the technical sessions with a combination of Indian cultural program and enlightenment by Sadhguruji. So today, we start with the third and another important session on best practices on robust standard setting framework. We all know the importance of standards in our life. It starts with washing off the fruits and vegetables in the kitchen, to cooking them under hygienic conditions, to storing them at the right temperature. Even when we visit the market to buy these food products, we look at the label for the nutrition, the ingredients, how much of salt, sugar contents in it on the label. So this all comes with the standards. Today, on the second day in this session, as all food regulators are here, it's the right platform where we can exchange the knowledge of expertise on standard making framework. In the session yesterday, it was rightly explained by Gopalakrishnan sir how the standards are being framed at FSSAI. We have a team of scientific panel, 21 panels we have, with the expertise of food scientists, microbiologists, veterinarians, medical doctors, toxicologists, to name a few. They give recommendations to the scientific committee, followed by the food authority. As regulators, we are all working to ensure safe and quality food to the consumers and enhancing international trade. So without wasting much time, I would like to call upon stage the first speaker on the dais, who is Dr. Chris Cabell. He is the Chief Food Safety Officer for the Ministry for Primary Industry, New Zealand, and Primary Industries at the New Zealand Ministry of Foreign Affairs and Trade. He started his career with the Ministry of Agriculture and Forestry as a veterinarian, and further he extended his professional horizons by serving in the head office of New Zealand Food Safety Authority. He had been a veterinary counselor to the European Union, Director of Verification Services, Agricultural Counselor in New Zealand High Commission, London, and today he is Chief Food Safety Officer in the New Zealand Food Safety. I welcome you, sir, on the dais. Okay. Yeah. Sir, I request you to, Sir, I request you to be seated on the dais, sir. Thank you, sir. I would like to invite the next speaker, who is Ms. Anita Praveen. Madam, she is IS from 1989 batch, Secretary, Ministry of Food Processing Industries. Her extensive experience in the government sector and her deep understanding of the food processing industry have made her a key driving force behind initiatives aimed at enhancing food safety, promoting food exports, and fostering innovation in the sector. Welcome, ma'am. The next speaker on the dais would be Dr. Vaidya Rajesh Kotecha. I request you to come on the dais. A Padma Shri awardee, he is an Ayurvedic doctor who has been serving as Secretary of Ministry of Ayush in the Government of India. He has bagged many laurels and distinction, including the Global Ayurveda Physician Award in 2007, Ayurveda Ratna Award in 2008, and Padma Shri Award for Medicine in 2015, to name a few. He has authored 2 books on Ayurveda and has played a crucial role in integrating Ayush practices into mainstream healthcare, fostering research and innovation, and promoting international collaboration. I welcome you, sir. The fourth speaker will be having a special address, that is an AV message, which will be placed in the end. So to start with the session, I would request Dr. Chris Cable to give the plenary session address.
Good morning. Feels somewhat familiar. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Nā mai, haere mai, namaste. Good morning, delegates, distinguished guests, and colleagues. Ladies and gentlemen, it is a privilege to be here today at the Food Safety Regulators Summit. Today I stand before you to open an important session on establishing best practice and robust standard setting frameworks in the design, development, management, and ongoing evolution of a national food control system. Yesterday, we talked about the importance of harmonising standards, and I cannot agree more strongly with this perspective. In my career, I graduated as a veterinarian after a couple of years in private practice, and then I was lucky enough to join the New Zealand Food Safety Authority at the start of a transition period from an outdated prescriptive regulatory framework to the development of a modern science, evidence, and risk-based New Zealand food safety control system that aligns and indeed has strongly influenced international standards and country national food control systems. This experience has given me broad perspective and strong conviction that key to food safety is a well-designed, well-articulated, and implemented national food control system that aligns and harmonises with international best practices, international standards, and guidelines. Yesterday, I listened intently to the conversation about standards, and it struck me. We all talk about standards, sometimes low versus high, and at other times the need to harmonise. I firmly believe any conversation about standards should always start with the importance of implementing a cohesive and coherent national food control system that incorporates the necessary components that in themselves align with international best practice and international standards and guidance. To me, international standards and guidance should be seen as the common international language of food safety. They facilitate the needed dialogue, mutual understanding, and they build the trust and confidence and ultimately lay the foundation for food safety, but recognition of systems and the facilitation of trade. Food safety, however, unfortunately continues to be a significant challenge for many countries, causing serious harm, economic burdens, and even loss of human life. With globalisation and an increasingly interconnected world, global food supply chains have become complex and challenging. New sources of protein and methods of production will only serve to further challenge regulators and the regulatory systems globally. Therefore, food safety standards must also evolve to be fit for purpose and be able to accommodate the diverse range of production systems, international trade, and the innovative practices without compromising consumer safety. A well-designed and implemented national food safety control system based on internationally accepted best practice is the solution to the challenge, serving to optimise risk management while also supporting a reduction to barriers of domestic and international trade in safe food. The setting of robust food safety controls based upon international standards, or further justified on the basis of sound science, evidence, and the principles of risk analysis, are the bedrock for ensuring an optimised food safety control system. Robust food safety risk management frameworks are the engine room of a high-performing national food control system. In New Zealand, food safety is led by the branded business unit of the Ministry for Primary Industries, New Zealand Food Safety. New Zealand is a small trading nation that exports over 90% of its products worldwide to 150 discerning markets. We have a long trading history and significant experience meeting importing country requirements and expectations, including dealing with the challenges of non-harmonised and non-risk-based standards. Our trading history is relatively young, with trade only really developing during the late 1800s, with a key focus on exports to England, given our diaspora of the time. However, trade for New Zealand began to flourish after the invention of refrigerated transport and significantly the development of trade with the United States. But our pre-1990s food control system was historically based upon a traditional, old-school style of approach. This included the use of prescriptive, non-science and non-evidence-based standards and a focus on the production environment. To a great extent, they reflected historical global understanding about how food safety should be managed. With the further expansion of trade to include the EU, USA and other markets, New Zealand soon found itself facing the challenge of trying to meet the expectations of different trading partners and their specific requirements. They did not always fit the New Zealand context, and trying to negotiate alternative arrangements based on an outdated regulatory framework was impossible. This resulted in significant tension with domestic and international stakeholders, and more often, New Zealand having to implement different importing country requirements that simply added cost and significant barriers to trade. New Zealand quickly realised there was a clear need to move toward the implementation of an outcome-based regulatory framework and the adoption of international best practice. Another fundamental change that happened in New Zealand was the recognition of the need to take a systematic approach to the leadership and management and oversight of the regulatory system and the New Zealand food control system. We concluded if large fast food chains can deliver consistent assurances to customers, no matter where they were in the world and no matter what they purchased, they got the same product, then a similar approach could be taken to our own food safety assurance national food control system. We learnt about the importance of taking a holistic and systematic approach, seeing all components of the national food control system as working collectively together to deliver the high levels of assurance, the sum of the collective parts being more powerful than any individual component. The changes also saw New Zealand moving rapidly to using science, evidence and risk analysis to justify New Zealand's food control system and its components, and to challenge the traditional perspectives and expectations of our major trading partners. As a result of these experiences, New Zealand has become a leading voice, along with other like-minded countries, during the WTO negotiation rounds, advocating for the advancement and recognition of international standards, and critically the importance of the Sanitary and Phytosanitary Agreement, which cemented the principles of science, evidence and risk-based standards. With the SPS agreement signed, New Zealand quickly shifted the food-related regulatory frameworks to align with the modern risk-based approach and began operationalising the international recognition of New Zealand's food control system for the purpose of trade. To support this shift, leadership of the New Zealand Food Safety Authority purposefully confirmed core operating principles and concluded the high-level design aspirations for the national food control system. To guide New Zealand's food standards development process, we also documented a food safety risk management framework and culturally embedded the philosophy and understanding of risk management across the organisation, and have applied this routinely to our regulatory frameworks. We have also further articulated an operational regulatory model which clarifies accountabilities, roles and responsibilities of the participants operating within the food safety regulatory control system. This has proved powerful and brought clarity to participants and understanding about the respective role of government in setting standards, and for business owners understanding that they are accountable for food safety and the application of appropriate quality control and oversight of production and processing. The results of these changes have been powerful. First and foremost, it has fostered strong collaboration and cooperation between stakeholders at all levels, both internationally and domestically, including at international standard setting fora such as Codex Alimentarius. Importantly, the changes we have made have delivered clarity to domestic and international stakeholders about how the New Zealand food safety control system operates. It has removed the black box mystery often associated with food safety systems. It has provided for transparency and broad-based understanding of a clear and cohesive food safety risk management story. We've continued to share our experience internationally, and most recently we were delighted to host representatives from India's own Food Safety and Standards Authority, walking them through the way we lead and manage the New Zealand food control system. As a trading nation, the implementation of a systematic approach to development of food safety standards underpinned by clear overarching trade and food safety policies and organisational operating principles has also proved powerful in negotiating favourable market access expectations. For New Zealand, this has enabled a movement toward higher level and enlightened conversations with counterpart competent authorities. It has moved the conversation to be about the outcomes required by the different national food safety systems, rather than what the standards are being applied by each party at the working level. This has enabled conversations to focus more on the design principles of the control system and the acceptance of the risk-based approach. Importantly, this has provided for flexibility in regulatory systems design, application of standards, which ultimately delivers a high level of assurance of food safety. Taking into account, of course, local hazards, risk profiles, and the need for the system to be in a position to respond to changing circumstances, emerging pathogens, and new technologies. The approach in the end has led to higher level understanding and recognition of the New Zealand system, which has included mutual recognition with countries, treaty-level agreements of the system-based approach, and the further reduction of barriers to trade. New Zealand's food control system and regulatory frameworks have, as a result, evolved to be internationally highly regarded and trusted by our trading partners. Ultimately, the benefits of implementing best practice food safety standard setting frameworks are immense. They safeguard public health, reduce incidence of food-borne illness, and the associated medical costs. They enhance stakeholder confidence and enable consumers to make informed choices. The frameworks also facilitate international trade as harmonised approaches to the development of national food control systems and the underlying standards promote global understanding, market access, and support fair trade. By safeguarding the integrity of our food supply chains, we also protect the livelihoods of farmers, producers, and also those involved in the food industry. Trade in food products is also becoming increasingly important to tackle many countries' pending and current food security issues. In conclusion, robust standard-setting frameworks are essential for ensuring the safety, quality, and integrity of our food supply. By embracing transparency, international best practice, science, flexibility, enforcement, and education, we can establish and maintain effective systems and standards that protect public health and foster trust amongst consumers. There is, however, another key component for the advancement of a national food control system and those internationally, and that is the need to come together to collaborate and to share experiences if we are to ultimately be a global success. And thanks to the Indian government and Food Safety and Standards Authority, we are here at this important conference for this purpose. In the end, however, success is dependent on one more critical ingredient, and this is best expressed in New Zealand Māori language, te reo Māori. He tangata, he tangata, he tangata. It is people, it is people, it is people. Let us commit ourselves to implementing and promoting best practice in the development of national food control systems for a future where safe and nutritious food is accessible to all, no matter where they live in the world. Kia ora, thank you.
Thank you so much, sir, for the knowledgeable insight on international standards and guidance and the challenges you are facing of food safety in New Zealand. I would like all of you to join me in welcoming Shri S.P. Singh Baghel, sir, Minister of State, with a big round of applause. Welcome, sir. I would like to invite Anita Praveen ma'am for the contest setting address.
Good morning and namaskar. Honorable MOS Shri Baghel, dignitaries on the dais, distinguished delegates. I am no expert on the subject that I have been asked to speak on. So today what you get from me is probably a generalist's view of what should be the best practice for a robust regulatory standard setting. And as I always maintain, probably the generalist and a government practitioner gives you the most practical and commonsensical approach to things, which are what we need to work on today and tomorrow and in future to come to make India one of the best ones as far as regulatory standard settings are concerned. India's food processing industry sector has seen a rapid growth in the recent years, riding on vast and diverse agricultural resources. We have had high production in agriculture, dairy, marine sector, and all allied sectors. And the industry has been receiving adequate raw material for high levels of processing. There is also a tailwind given by changing consumer preferences, and that is true for all countries that are moving from being less developed towards being developed, and that's a very good indicator to show that consumer needs more time to probably work in offices, produce more in terms of monetary gains rather than cooking. That is a job that now has been taken over by the industry in a large segment. There is an inevitable positive movement in this direction for higher consumption of processed food by domestic consumers as well as for exports, which will push India's growth in this direction. The Indian food processing market is estimated to grow at a compounded annual growth of 15.2% in the ensuing years, and we see the growth fueled by strong regulatory framework for the sector that will help unfettered access to the global market also. Let us recall the days when I recall my school days when I could drink water straight from the tap without bothering to see whether it was clean, whether it was fit for consumption. We ate whatever was offered and we never looked at labels. That world is a bygone world now. Today, we need standards, we need better quality foods for various reasons. The reason, probably the base reason, the fundamental reason is humans, which decided to pollute all resources that are available to us on this planet, whether it's land, water, air. These are our basic sources for food, and soon we realized that if we need safe food, we need to set standards and control points. Food and feed have to be safe for human consumption and for keeping health hazards at bay. The entire food chain has to remain safe for our bodies and to be free from any adverse impact that it might have on our health. Moreover, food has also now transformed from being a product of local farm and kitchen. We now have large agricultural farms to feed more mouths with higher production, and factories have stepped in for making packaged food which have longer shelf life. This brought in pesticides, chemical fertilizers, and preservatives. These are inevitable part of the packaged food system. These are not meant to be pumped into the physiological processes of a body and are bound to have adverse impact if consumed as part of food. Even the containers, the storage space, or handling processes of food can leave traces in the food, which can cause damage. It is not just food and consumable liquids that need to be safe, but anything and everything that touches our food needs to be made safe and clean so that the end product is safe and healthy for everyone's consumption. Safety of food, its handling processes, and also medicines cannot be compromised and have to be made safe for human consumption, for adults or infants or animals which are part of our food chain. This has to be a robust regulatory framework which makes the producers, be it farmers, animal rearers, or industry, including food processors or pesticide, fertilizer, preservatives, or additive producers, to be accountable and to bring all under the ambit of a regulation. So why do we need a robust regulatory system? We probably may have discussed it all through the day yesterday, and we will be doing it as much today as also, but it's worth recounting it. Protection of consumers from health risk cannot be compromised with, and he should be able to make an informed choice, and for that, strict compliance of guidelines for handling, processing, and labeling of food products is a must. Public health is the responsibility of the governments, and there can be no shortcuts in this area. For conducting international trade, we have realized that merely having local standards are not enough. There are regions to which we are interested in exporting which have way higher standards, and we need to match them. So in order to be eligible to export to these regions, there is no choice but to comply to strict standards. I must also add here that what I have observed as the food processing secretary in this country, that the industry has risen to the requirements and have shown higher compliances for these regions, and it reveals that they can adhere to higher standards if need arises. And that is proven by the high exports that India has been making to the world in the recent years. In this area, there is an angle of difficulty also. When developed countries tend to set very high standards, sometimes to create a trade barrier. Lower local standards can lull the industry to lesser compliance levels. This is not the reason why the standards have to be. This is one of the major reasons why we need to have very strong standards to be complied to, adhere to, even for local production, rather than having a dual standard that is convenient to the local industry, but becomes a barrier tomorrow when you want to access the international market. A strong framework needs to be capable of harmonizing with standards and regulations across countries to ensure fair competition and market access to exporters. In a global food market, this is an essential requirement. Standards also need to help smooth entry of innovation into food market. There is an essential requirement for nimble-footed creation of standards by regulatory authorities, so that the innovation and product reaches the market to grab an opportunity, which may be missed if there is a delayed creation of standard. This will sustain innovation as well as product development in the long run. We can identify Codex Alimentarius as a robust standard food code setting body with wide acceptance. It has established itself as a science-based food regulatory system which provides a basis for international trade and facilitates harmonization of standards amongst countries, and has an established food safety management system with risk assessment, risk management, and risk communication. It promotes fair trade practices in the global food trade arena. Harmonization with this standard by countries ensures a level playing field and eliminates technical barrier to trade. The scientific rigor followed by this system makes it reliable, credible, and instills confidence in products and countries that follow it. It also provides a platform for stakeholders, collaboration, consultation, consensus building among stakeholders. The Food Safety and Standard Authority of India, which is FSSAI, has been Indian side of the regulatory body, which has had an excellent track record of creation of standards and its enforcement. It is inching towards being another force to reckon with. So what should be a robust regulatory framework that we should be following to make our products safe and acceptable to the world without raising any red flags if a package from our side arrives in a country which has very high standards? Well, we should continue to create standards based on the best available scientific evidence and risk assessment. A science-based approach ensures that standards are objective, reliable, and focused on protecting consumer health and safety. Transparency is the next crucial element in the standard setting process. It is important to engage a diverse range of stakeholders, including government agencies, industry representatives, consumer groups, and scientific experts. By involving all relevant parties, transparency and inclusivity can be fostered, and the resulting standards are more likely to be accepted and effective. Collaboration and harmonization among countries, being key for achieving consistency and facilitating international trade, is an important area. Collaboration allows for the sharing of knowledge, expertise, and resources, while harmonization helps avoid unnecessary duplication of efforts and reduce trade barriers. There is a need for robust risk analysis process to be in place, including risk assessment, risk management, and risk communication, which should be integrated into a standard setting process. Risk assessments help identify and evaluate potential hazards and their associated risks, while risk management involves implementing measures to control or mitigate these risks. Standards should be reviewed and updated periodically to incorporate new scientific knowledge, emerging risks, technological advancements, and changes in consumer preferences. Regular review processes help ensure that standards remain relevant, up to date, and aligned with evolving needs and expectations. Well, standards are only effective if they are followed and enforced. It is important to establish mechanisms for compliance, monitoring, verification, and enforcement to ensure that businesses adhere to these standards. Strong enforcement measures deter non-compliance and promote a culture of accountability. Merely setting standards will be job half done. Following such framework can be a challenge if not understood well. So creation of capacities for all stakeholders is another measure that would be an essential ingredient in this entire process and will ensure better understanding and compliance by all. So as I understand, and I tried to see what all FSSAI does, and I found that on many parameters, they have been doing excellent work. The stakeholder involvement, the scientific community's engagement, all these things are being done. But while a lot has been achieved by us in India, there are many more miles to go before we become leaders in standard setting. But with concerted effort, this is not an unachievable target. Thank you. Namaskar.
Thank you so much, ma'am, for giving such beautiful insights on the transition of Indian food processing market earlier and today, the precautions that we need to take for the entire food supply chain, and how do we enhance our standards with collaboration with Codex to enhance our exports. Thank you so much. I would like to invite the next speaker on stage, Dr. Vaidya Rajesh Koteja, a Padma Shri awardee. He's an Ayurvedic doctor who is being serving as Secretary of the Ministry of Ayush in the Government of India for the special address.
Respected Honorable Minister Sri S.P. Singh Ji, CEO FSSAI, Joint Secretary, Senior Advisor, the officials of FSSAI, the delegates from across the globe, and dear respected brothers and sisters. I am from the different area where, botanicals are being used in the traditional Indian system of medicines, and the perspective of botanicals and role of botanicals in human health, while looking at the standards also. So in India, we have very beautiful system that I want to explain. Before I detail about this beautiful system, I want to raise a question also, like some food for thoughts in our minds. The food for thoughts is that when we look at the botanicals as human health, there are a lot of confusion, and it starts from whether it is a medicine or food, whether botanicals can be considered as a medicine for treating different clinical conditions, and if it is medicine, how they qualify as a medicine. Because in our minds, medicine should have a molecule, and it is standardized, it should be targeting something, and then it becomes qualified for a medicine. And botanicals are largely having multiple molecules, and is sometimes multi-ingredient, and in the terms of the strict scientific parlance, it do not qualify as a medicine. But in most of the countries, the botanicals are being used as a medicine since centuries, since generations. And I will not burden you with lot of data and statistics, but we all know that in most of countries, the primary source of entry-level health services or self-help health is largely dependent on botanicals, either as a food or remedies available in our kitchens or around us, or high-end standardized botanicals available on the shelf. So the problem statement is that whether we should look at the other perspective of botanicals as a medicine or providing health and solution for our different diseases. Yes, there are a lot of possibilities. In recent years, after having this understanding of network pharmacology, multi-target medicines, and microbiome, we now understand that botanicals also can be considered as a multi-target medicine, and there are a lot of researches has already happened. With this statement of mine, I would like to explain so many things which is happening in India and can be considered as, as a new opportunity, new area in the standard setting of botanicals and then botanicals for the health. For example, recently FSSAI has notified Ayurveda Ahar as a separate regulation, and this regulation still Indian industry is also trying to understand what is it. But I want to mention that this Ayurveda Ahar regulation has a big potential because it states about how the recipes of traditional India being practiced since centuries in our homes can be standardized, can be packed in a packaged manner and can be sold. And there is a huge potential of commerce into this area, not only domestic but globally, because there is a huge demand. This is one thing. The other thing is that in India we have separate Ministry of Ayush, that is a traditional medicine, and it is working with the Health Ministry, working with the FSSAI together for different standards. Like if a botanical is considered as a food, there should be subtherapeutic doses or no claim, and if it is considered as a medicine, then there should be therapeutic doses with indications and lot of other things. So in Ayush side, we have standards of pharmacopoeia standards in our country. We have Pharmacopoeia Commission. Then we also are working with different pharmacopoeias of the world, like we have association with American Herbal Pharmacopoeia. We also are working with WHO. WHO is now creating World Herbal Pharmacopoeia, and we have already sent an expert at P5 level position, especially to work into the World Herbal Pharmacopoeia. Why I am mentioning this, that pharmacopoeias of the botanicals is also very much important to look at the different standards and for the safety of the people. Recently, there are so many new evidences came into the different botanicals. I would like to cite some. For example, ashwagandha. So ashwagandha is one of the botanical which is now one of the top 3 supplement in US, being sold across the US and being marketed at a almost with the competition of the best botanicals from the other parts of the world. Ashwagandha is one of the example where ashwagandha is also being studied as a medicine for long COVID in UK. So Ministry of Ayush has collaboration with London School of Traditional Medicine and Hygiene, and in UK population there is a study going on, a double-blind placebo-controlled trial for long COVID and effect of ashwagandha. So this is one very good example how ashwagandha can be a food supplement or also can be a medicine. The other example is about guduchi, that is Tinospora cordifolia. In India it was studied extensively, and it has helped during COVID for improving host defense mechanism, and there are a lot of studies. So whatever I am mentioning is having a lot of robust scientific evidences and publications also. The another example is about some leads or some development in the area of Ayush. For example, we have a multi-ingredient medicine which was repurposed based on botanicals, named as Ayush 64, and this was a repurposed medicine invented into 80s for malaria, and then later it was repurposed for inflammatory lung disorder, and then it was extensively studied during COVID, and it was in India. It came into National Clinical Management Protocol and have helped save a lot of life, and there are a lot of publications about that. So this is some very good example about how these botanicals are working. There is another example about a plant known as amlaki or amla. We all know that amla, whoever is from India, they all know that amla is one of the main ingredient or base of Chyawanprash, which is a very popular for preparation in our country. Almost everybody takes Chyawanprash during winters to keep their health optimal. So for amla in Ayurveda, it is mentioned that it is a Vayahasthapana. Vayahasthapana in Sanskrit means it restores aging. So there are a lot of studies we have conducted and different types of studies, right, from mechanistic aspects of studies to clinical studies, and we found that actually Amla works for these aspects. So I would like to cite one very good example about what we did on Amla. So there was when I was Vice Chancellor in Gujarat Ayurveda University in between 2013 and 2016, we did a PhD study on Amla to look at the Vayasthapana or preventing aging property of Amla, and we had this Drosophilus model, and on this Drosophilus model we know that Drosophilus, life of Drosophilus is from 18 to 21 days, and in the controlled environment all these control group Drosophilus died by the 21 days average, and this Amla group who the Drosophilus given Amla, Amlaki, they survived average 110 days. So these kind of evidences we have, and that opens up a lot of potential. Another aspect is that botanicals of course is in high demand, and there is a huge potential of commerce across the globe. It is already growing. Largely insurance sector is not supporting. People are ready to spend from their pockets, but they use it in a very big manner. Our ashwagandha export from our country it became 6 times in last 3 years. This is one of the example. Another example is that Ayush market size, it was only $3 billion in 2014, and it became $18 billion in 2020. And now as per the projection, it is already 24 billion. So in 9 years, it is more than 8 times. This is a kind of demand which is not only domestically but globally, because export also has happened proportionately very high. So what I am trying to mention is that there is a need of, like I echo the statement of my colleague Anita Praveendji, that we have to follow the standards, of world benchmark we have to follow. So there should not be two standards for, domestic standards and international standards for the export purpose. So industry also, and in our experience also, the same experience what we are experiencing in Ayush sector, that our industry is very much willing to comply with world standards, and that is why their exports are skyrocketing. The other thing is that recently our Honorable Prime Minister has launched the Ayush Export Promotion Council. So this council is also helping the business of Ayush sector, particularly botanicals, to facilitate them for the exports. And lot of countries we have bilateral agreements, and then we have lot of approvals, regulatory recognition of Ayush systems across the country, including Ayurveda and other systems of medicine. So to conclude, I want to mention these 3-4 things which I want to summarize these 3-4 things which I mentioned. First is that botanical is in our life. That is already in high demand. We allied people probably do not know how much is it in demand, but people use it. And botanicals are food, as a part of food, as a part of people use it for their health in a self-help manner or in a traditional medicine practice manner. The other is that botanicals are already in market and people are buying it, so we need to look at standards. Government of India is also having these robust standards of botanicals as a food also, because there is a nutraceutical regulation, there is a Ayurveda regulation in FSSAI. At the same time, if it is a medicine, there is a pharmacopoeia standards, etc. And I forgot to mention that through Bureau of Indian Standards, we are creating the Indian standards of the services and products and botanicals of our country. And then we have already taken up the request of India from BIS, because BIS is representing ISO into the ISO International Standards Organization, and there is an Ayush vertical in BIS, already published 50+ standards of Indian standards, and now we have requested ISO to have a sectional committee on Ayush botanicals, so that these Ayush botanicals have ISO standards. Thank you so much. Namaskar.
Thank you so much, sir, for enlightening us with our ancient botanicals, the beautiful insights on the robust standard setting framework in the Ministry of Ayush. Thank you, sir. Our next speaker is Mr. Bertrand Lombard, who is a senior scientist at the French Agency for Food, Environmental and Occupational Health and Safety. His work majorly encompasses the harmonization of laboratory practices, and he has been involved in various projects with the European Union on food safety. He'll be sharing a live interaction with us. Welcome, sir.
Good morning. Can you hear me?
Yes, sir. You're audible, sir.
Good. So, good morning to all. It's early morning in France currently. I'm indeed Dr. Bertrand Lombard, working at ANSES, the French Agency for Food, Environmental, Occupational Health and Safety, at the headquarters near Paris. ANSES is a public agency tasked by the French government to conduct assessment of the risk related to food, in particular, as a scientific basis for risk management conducted in France. ANSES also leads research, reference and monitoring activities in its 9 laboratories in the fields of food safety, but also animal health and plant health. I am pleased and honored to give online a special address for the session Best Practices on Robust Standard Setting Framework. I regret not being with you in New Delhi for this great summit, given my close links with FSSAI and India. In a session dedicated to setting robust standards with a global summit, I think that ISO plays a major role, as it has been already mentioned earlier, in particular by the former speaker, since it is the worldwide organization in charge of developing international standards in many fields, in particular food products, within its large technical committee 34. With a microbial food safety perspective, I'd like to introduce you the ISO committee dealing with food chain microbiology that I currently chair. So the committee is named ISO TC 3489, that is Subcommittee 9 Microbiology of Technical Committee 34 Food Products of ISO. It is placed under the responsibility of France, as I told you I chair it, and the committee manager is Laurent Constantino at AFNOR, the French standardization organization. We have 64 countries as members, with an active participation of India in particular that I much welcome. We have also 13 international organizations in liaison, including Codex Alimentarius that has been mentioned regularly in the summit, World Health Organization, World Organization for Animal Health, and the European Commission. We are conducting a very large work program implemented by 30 active working groups reporting to us in charge of developing one or a set of standards. We prepare both reference methods and general standards, and if you want to have more information, you can refer to the SC9 website. So I will say a few words about the reference method that we prepare. The targets are the foodborne microorganisms present in the food chain, that is mostly bacteria and their toxins, but also yeast and molds, viruses and parasites. Most methods are applicable to the food chain, that is, they have a broad scope, beginning in some cases with samples from the primary production, and mainly, I would say, all foods where the microorganism can be present, and samples from the environment of food processing, handling, and storage. Their measuring principles are still today mainly based on conventional microbiology, in the cases for bacteria, since it ensures the largest consensus and applicability at international level. But we seek to find a balance between this large consensus applicability and the state of the art, as well as analytical objective. Thus, in some cases, modern technologies have been introduced in these standards. The first example can be real-time PCR for the detection of Shiga toxin-producing Escherichia coli, the analysis of viruses, and the detection of botulinum neurotoxin-producing Clostridia. Second example can be found in chemistry, analytical chemistry with liquid chromatography coupled with mass spectrometry for the quantification of Bacillus cereus emetic toxin. The reference methods that we have prepared on pathogenic microorganisms have been validated, fully validated by inter-laboratory studies, and others are to be validated in the coming years. I would say so, as a conclusion, thanks to this ISO committee, the alignment of reference method in food chain microbiology at worldwide level is a reality. The standard methods that have been fully validated and characterized enable to reduce sources of variation in microbiological analysis that is known to be particularly large, in particular compared to chemical analysis. They facilitate recognition of test results and controls between the supplier and its customer. And in international trade, that has been already addressed before, the analysis performed by the exporting country can be recognized by the importing country, avoiding duplication of analysis and resulting delay in trade. For official controls, analysis using reliable methods enable to ensure food safety for the consumers. These standard methods are also the basis of ISO 17025 laboratory accreditation in the field of food microbiology. These methods serve also as reference methods for the validation of alternative commercial methods. These alternative methods are compared to the reference method to show that they give at least equivalent results. And taking the viewpoint of regulatory microbiological criteria, the use of ISO reference methods enables testing products for conformity to regulatory limits in an harmonized way, allowing mutual recognition of analysis between official control authorities and food business operators, in particular food manufacturers. Today, 11 of our ISO methods have been referenced in 7 Codex Alimentarius documents, mainly prepared by the Codex Committee on Food Hygiene, but also by other committees. In other words, our committee is supporting risk management at national, regional, in particular Europe, and international within Codex Alimentarius to set and to implement regulations by providing reliable microbiological methods of analysis for official controls and own checks conducted by food business operators. In the area of microbiological food safety, another subcommittee of this ISO Technical Committee 34 on food is also active. That is the subcommittee 17 on management systems for food safety. It is placed under the responsibility of Denmark. You can have more details on the website of this committee. And this committee is in charge of the well-known standard family ISO 22000, which is in particular the basis for the certification of food safety management systems of the food industry. Thank you for your attention and have a successful summit.
Thank you. Thank you so much, Mr. Lombard, for the beautiful insights, the newer insights on the microbiological food safety, which is an important criteria for framing the standards, and also the details about the committee, the ISO committee who you are chairing for testing method and analysis, for reference of testing and analysis. Thank you so much. I would like to invite, thank you sir. I would like to invite on stage Shri S.P. Bhagel sir to felicitate the dignitaries on the dais. Thank you, sir. Thank you so much. Yeah. Now we go to the next session, the next panel discussion session. And for that, I will like to invite Dr. Kavita Ramaswamy to please take over.
A very good morning to all the dignitaries, delegates, ladies and gentlemen. We are enlightened with a very thoughtful capsule of information. It made us realize how complex the food systems are and how it requires an integrated and holistic approach by all the stakeholders and across multiple fronts. Ensuring food safety and gaining consumers' confidence is one of the important tasks entrusted to governments since antiquity. Moving forward to the panel discussion on health and nutraceutical, we all know it is a hybrid of nutrition and pharmaceutical, and this ecosystem is omnipresent and growing at a vibrant pace. The demand for health supplement and functional foods has soared past the COVID-19 pandemic. This field also faces several challenges like regulatory complexity, lack of harmonized standards, assurance of integrity of the botanicals, etc., which all need to be assured, addressed to ensure the safe and effective use of these products. Collaboration among stakeholders, including the regulators, industry players, healthcare professionals, researchers, and consumer advocacy group is crucial to devise strategies to overcome the challenges. With this context, it's a pleasure to welcome the moderator and panelist of this session. It's an honor to welcome Dr. Shashank R. Joshi. He is an internationally acclaimed endocrinologist and president of Indian Academy of Diabetes. He has received numerous awards and recognitions including the Padma Shri by the Government of India in his recognition of his contribution to medicine. Dr. Joshi has published over 1,000 research articles and 100 plus books and monograms related to endocrinology and diabetology. Sir, I request you to be on this dais. Thank you. Now I welcome Ms. Lingping Zhang. She has been serving as a food safety officer at the Food and Agriculture Organization, Rome, for 10 years. She has a major supportive role to various horizontal and commodities committees of Codex and the FAO-WHO Coordinating Committee for Asia. Welcome, please. I welcome Dr. Sirimawo Nair, Professor, Department of Food and Nutrition at the MS University of Baroda, Gujarat. She has over 30 years of transdisciplinary and international teaching, research and leadership experience, integrating the natural sciences, basic sciences, social and public health sciences using program settings in humanities. Welcome, ma'am. I welcome Dr. Alka Rao, Principal Scientist, CSIR Institute of Microbial Technology, Chandigarh. She has a research background of 12 plus years with measurable outcomes in the form of patents, copyrights, and international publications in the field of protein science, protein engineering, and directed evolution of protein. I welcome Dr. Sridevi Annapurna Singh, an accomplished food technologist and active researcher, is presently the director, CSIR, CFTRI, Mysore, India. In her career spanning over 3 decades, she worked extensively on both basic and applied aspects of food science. Dr. Sridevi has published over 50 manuscripts in peer-reviewed journals and holds a total of 11 patents to her credit. I welcome Dr. C. Vasudevappa. He is a retired Vice Chancellor of NIFTM India, is an astute professional with 47 years of experience in research, administration, and teaching. He visited several countries to develop interinstitutional collaborations and research partnership. Welcome you, sir. I welcome Dr. Joban Kishore Moda. He is a Deputy Director at the Institute of Teaching and Research in Ayurveda at Gujarat. He is an academician and Ayurveda physician and holds a broad spectrum of experience ranging from drug standardization, experimental and clinical research. I welcome Dr. Khalid Mubarak Al-Zuhabi as the Head of Research, Studies and Statistics Section in the Food Safety and Quality Center, Sultanate of Oman. He started his career as a biology teacher and has also worked as a health educator in the Ministry of Education in Oman. His major area of research includes Omani traditional foods and gender differences in the development of overweight and obesity in Oman. With this, I leave the floor to you, sir, Dr. Joshi, to carry on with the deliberation. Thank you.
Thank you, Kavitaji. I welcome, namaskar everybody. I welcome everybody to today's panel discussion on health supplements and nutraceuticals. We all know that supplements and nutraceuticals and botanicals have thrived through ages with a global footprint, but really the momentum has accelerated in the last few years, particularly the last decade, and COVID was like an amplifier of the same. In 2023, the global market insight nutraceutical market size is now significantly poised to grow at a CAGR of 4.5% from 2023 to 2032, because there is an explosion of metabolic disorders worldwide. And we have also seen that immunity took center stage in the COVID pandemic. We had a very nice talk by Rajeshji, and he said that the consumers are relying more and more on products like supplements, nutraceuticals, botanical, and therefore the demands of these products and complementary therapies have really exponentially shot up. in various health conditions. And we know that FSSAI needs to be congratulated and complimented because they started the FSS Act in 2006, but by 2016 they regulated the products, and therefore this growth trajectory has seen a lot of advances. And this session is really a platform of sharing of knowledge, discussing advancements to explore the potential of health supplements, nutraceuticals, to promote health and well-being. We have a very, very elegant panel here on both my sides, and they are experts from Codex, CSR, CFTRI and IMT, and the NIFTEM, and we have global visitors with us, and of course from MS University we have Ayurveda Acharya with us. So we really are going to try to see how best we are going to educate ourselves through this insights. I would request each panelist to be brief and quick because we know that we have a large agenda. So I'm going to start with our Vice Chancellor of the retired Vice Chancellor, Dr. Chindi Vasudevappa. Professor Vasudevappa, you know that health supplements and nutraceutical sector is still evolving in India. And can you share with us your perspective on the gaps or the areas of uncertainties which you really feel need some redressal and addressal both?
Thank you very much, sir. Hello. Yeah. Thank you very much, sir, for this opportunity given to share some of my views, especially on the status and the issues concerned with the nutraceuticals, food supplements. You call anything, maybe even I would say the food for special dietary use or food for medicinal use, things like that, even the therapeutics, all these come under the nutraceuticals banner, maybe the functional foods and all that. So the issues concerned with this are plenty, I would say, in the sense, I know nutraceuticals we always take as a food supplement, more as a food supplement than as a pharma utility or a curative effect. So that being the scenario, we need to look at very clearly what is its impact in terms of food, or in terms of nutrition, or in terms of development, or in terms of changing the physiological setup of the body of the animal or a human being, and things like that. And of course, the impact on the health. These are some things which are very, very important when we talk about these issues. But all the same, we have been talking about NRVs also. That is, the nutrition reference values for different foods. It is rather very difficult here to address these issues because it has a dual purpose of achieving the human health. So that means one, maybe it is giving a nutritional support, and the other is to improve the human health in terms of therapeutic effect. So that's where I think it is, I would say, coming to a harmonization of the standards or methods and things like become very, very difficult. And that is how I think we need to look at the various issues concerned, because I know it varies, the requirement of these things varies with the physiological status of the human beings. Maybe the age, maybe the sex, and maybe the physiological status itself or the health status and things like that. That means it is not easy to classify them as either the food supplements, or I would say the food supporting things, or on the other side, the impact on the pharma effect. I think these are some things which are very, very important. Of course, there are some issues which are really bothering us, especially when we look at the inadequacy of the regulatory framework. I know regulations are essential, I would say that, because we need to come up with good regulations which are maybe harmonized with other countries as well. That means harmonization of these regulations become very, very important. We will not be able to say that this is the product which has a particular food value like this, or maybe the impact on the health is like this. So this is where I think we have been talking about the probiotics, prebiotics, and the medicinal use foods and all that. These things really matter us to look into how actually we can come up with the nutritional, I would say, the inadequate, the regulatory framework. I think this is one thing which is very, very important.
Thank you so much, sir. So I think we have brevity of time, so I'm really grateful to you for all your insights. I think your take-home message is very clear, balancing it right, generating some good science and evidence is very important. We have with us, ma'am, Linping Zhang. Thank you so much. She's from Codex, Rome. In fact, I think we must congratulate Government of India for getting this meeting. This used to be a Rome conference. For the first time, we are meeting outside of Rome. Ma'am, Professor Vasudappa referred to a very tricky word called NRV, nutrient reference values. And Codex has been the lead partner globally with a footprint. So, ma'am, can you just elaborate how Codex is working on the NRVs for children or kids between 6 and 36 months? And what's your view on applicability on health supplements for creating a better consumer awareness, ma'am?
Thank you, Chair. I know our time is very limited, but before answering the question, I would like to express my gratitude for the meeting to invite me to be here. It is really a great honor. Yesterday, I sent lots of photos to my colleagues in Roma. They are all jealous of me. Now, before answering the question, I would like to provide some background information. Yes, just like Professor, I don't know how to pronounce the name. Yes, sorry for my poor English. Yes, I cannot agree more. This is a really complicated issue. I would like to provide some background information in this subject. Currently, in Codex, we don't have any definition for the term food supplements. Although many countries have established specific regulations on these products, I know India is in the process of developing the regulation on this product. Meanwhile, in Codex, we have another term that is food supplements. This has been used in the guideline for vitamin and mineral food supplements, which means food supplements in Codex only include vitamins and minerals. And in the general standard for food additives, there is a specific food category, food supplements. They already regulate what type of food additive can be used in food supplements and what are the maximum use level for this product. And this is one aspect. Another aspect that in Codex, we have the guideline for nutrition and health claims, and they specifically regulate what type of claim belong to health claim, and also give specific examples how health claims can be done on the food products. And talking about NRV, I would like to introduce in Codex, we have another guidelines, another set of guidelines on nutrition labeling, and this provide a detailed explanation of how NRV are development and the purpose of NRV. These guidelines apply to nutrition labeling of all foods. So in other words, if in future food supplements, health supplements, I think belong to food, that means NRV should be applicable to health supplements. That I mean in future, I'm not sure how Codex will develop. You know, Codex, as has been mentioned by many delegations, Codex is a member-driven organization. It's up to members to make the final decision what health supplements means. And now Codex is indeed in the process of developing NRVs for persons aged at 6 to 36 months. And the proposed draft guideline for NRV in the target group will be considered at the forthcoming Codex Commission meeting, which will be held in, at the end of this year. This will be, they develop a general guideline for preliminary adoption. And after, as for which type of food these NRVs for the specific target group should cover, there are lots of discussion at the Codex Committee, relevant Codex Committee, which is the Codex Committee for Foods for Special Diet Use. You also joined lots of discussion. I would like to report to the meeting the latest decision of that committee. That means the NRV for these special age group can only be applicable to the 4 special standards developed by this committee. That is standard for cereal-based food, standard for canned food, standard for infant formula, and the standard for follow-up formula. That is the latest discussion after latest decision after lots of discussion. I think this what I want to emphasize is that this general guidance guideline is still in the process of discussion. If members have a different view, you are welcome to bring it to the Codex Committee for special diet use. We may first discuss it on the application of which type of food product the NRV should be applied to. Thank you, Mr. Chair. I think I'm a little bit long. Thank you.
No problem. Thank you so much, ma'am, and we would welcome you again and again and all your colleagues here. And I think we are looking forward to this very sensitive issue of the guidelines which are going to come up from your side, from the Codex, particularly in cereals, canned foods, infant formulas, because it's a very hot topic, and I think it's a need of the hour. So I move gears now from Codex and regulations to ma'am Sridevi Annapurna Singh. Thank you so much for being here, ma'am. As we know that nanotechnology has already embraced industrial sectors, and how do you think, you are at the lead institute, I would say on planet Earth in Mysore, in CFTRI, how would you really think that you can integrate the area of natural bioactives, and you think nanotechnology can be leveraged to improve the delivery of nutraceutical or health supplements to enhance the bioavailability? Ma'am.
Thank you so much for the question, and I also express my thanks to FSSAI for the kind invite to be a part of this panel. So coming to the question, there is sufficient amount of literature to say that if you break down the particle size, the absorption will be better. And for any nutrient or nutraceutical to be absorbed, it is important that you have a smaller particle size. So nanotechnology that way is helpful, because you are going to have very small particles and the oral bioavailability will be improved. Having said that, I think there need to be studies to really understand that if too much is absorbed also, what would be the effect, whether on the food matrix, on the other nutrients, as well as any kind of toxicological implications. But yes, nanotechnology can be a good way to, as a delivery mechanism of nutraceuticals. And that is important, like you very rightly said, diet and disease is intricately related, and many of our lifestyle related diseases, we have seen that these nutraceuticals do play a preventive or even a management role. And so I think that is a great way of delivering them.
So, ma'am, thank you so much. Actually, you very rightly pointed out that there's also a safety valve mechanism needed. You know, it's not just excess bioavailability, but sometimes we need some vigilance too. So I think that, thank you for pointing that. Ma'am Alka Rao is at the Institute of Microbiological in Chandigarh. Ma'am, there's been a lot of hot news. Recently, WHO came out with the non-sugar sweeteners and provided some conditional recommendations. In India, we know that a lot of non-sugar substitutes or sweeteners have been used in health supplement and nutraceuticals. What's your last word on that?
Right. Thank you, Dr. Shashank. Indeed, it's a matter of high relevance to us as a country, also for the FSSAI, also for the consumers. We have as many as in 86 different food categories, the non-nutritive sweeteners have been permitted, including aspartame. So both the reports that have come from WHO concerns these. We also value these reports because these are based on scientific evidence. Therefore, the 3 action points that have emerged, the first and foremost is, there is at the outside there is no case of panic. However, we need to deliberate upon these from the point of view any hidden, perceived, or any futuristic implications on the standards. So that exercise is going on already, and Another action point that emerges is for not only for the regulators, but also for the R&D institutions across India, also for the food business operators. There is a clear-cut need to initiate studies which are well-designed and that have the scientific and technical rigor, because that has been the major limitation of the current WHO studies, and there is a definite goal ahead for all of us on that line, and it is also a very urgent need. It is not something we can postpone. Considering that these studies have labeled these NSS very much like probable category, so as carcinogens and sort of threats. So the third action point is, which is not only for the regulator side, but also at the consumer and we as a citizen. These guidelines are advisory in nature, and they actually support the ongoing Eat Right India mission movement of FSSAI. And as a national movement, this is something which needs to percolate even deeper. We need to scale it up in all possible fashion, and we have to join together as a national campaign. And this is what is the take-home message from the WHO reports. Thank you very much.
Thank you, Alka ji. I think she's made it very clear that we need to be cautious, careful, generate a lot of evidence around this area. It's a very nebulous area to still look at. Have less sugar and less sugar sweeteners probably is the order of the day. Eat right, and we congratulate FSSAI once again for having that around us. We have a global guest with us from Oman, Mr. Khalid M. Al-Juhabi. I hope I pronounce you correctly. And you have been a head of research and studies from the Food Safety and Quality Center from Sultanate of Oman. And my question to you is, you've been working extensively on the overweight Omani population, and you have been looking at various foods and replacements for weight management. So some perspectives about what you're doing in your country, how you're collaborating within different ministries, as you rightfully said just before we met recently, and then your thoughts on weight management.
Okay. First of all, I would like to thank the Global Food Regulators Summit for this invitation. And I would like to extend my thanks to the facilitator, actually, for his taking care of us, me and my colleague in the audience. Dr. Shashak, I would like to talk a bit about my workplace at the beginning to at least know what are we doing with the health supplements and nutraceutical. I am from Food Safety and Quality Center. It's a quite recently published by Royal Decree 24/2019. And this center is under the umbrella of Ministry of Agriculture, Fisheries, Wealth, and Water Resources. So this center is the governmental authority for ensuring food safety and quality in the Sultanate of Oman. This center has 5 departments: Fisheries, Fish Quality Control Center, Food Standard and Conformity Department, Risk Assessment and Crisis Management Department, Central Laboratories for Food Safety, and Food Safety Systems Department. This center has 17 mandates. I'm not going to go through all of them. Just the main important thing which is come across with the health supplements and nutraceutical is the control and inspection at port, at borders. So this is very important. Actually, health supplements and nutraceutical administratively and technically responsibility of Ministry of Health in Oman. And when I say Ministry of Health, actually it's Directorate General of Pharmacy and Drug Control, as well as Department of Nutrition. We are in collaboration with Ministry of Health in ensuring the import of health supplement in Oman by controlling and inspection the borders. Actually, we are in collaboration with them. So health supplements come across the border. We have inspection on them, and we check all the documents required from Ministry of Health, and then when the health supplements enter the Sultanate, then it will be the responsibility of Ministry of Health. So back to your question, actually there are many research talking about obesity and overweight in Oman. Yeah, that's true. And Oman, as a GCC country, actually we are in top rank of obesity in the world, to be honest. It's obvious as well. So we are being impacted by oil bloom in the GCC since 1970, and the economical status development, as well as, I would say, the lifestyle change and the urbanization and all those things actually, and come to increase the prevalence of obesity in Oman. So the question was, do you, advise any individual meal? Actually, Ministry of Health put a guideline, which is Omani Health Guideline, and it recommends all Omani to vary food groups, to take all food groups set in that guideline. And actually that guideline is very, insightful and so very easy. It has been represented at Omani plate, and that plate included 6 food groups with the serving size under each group, or the portion in each group. So Ministry of Health recommend people to eat from all food groups with a planned calories target. This is the more important thing to be also mentioned. So this is briefly the answer.
Thank you so much. Planned Omani plate, planned calorie target. I think thank you so much, and congratulations for all the wonderful work you're doing in Oman.
Thanks.
We move gears to the professor from MS University in Baroda, ma'am Sri Mawa Nair. Ma'am, there's been a lot of confusion in and a lot of concerns, because we've seen sudden deaths in celebrities, especially cardiac workout. They just, after intensive workout, they get cardiac arrest. Do you really think there's a link between dietary supplements and some role in it? You do a lot of cutting edge research in this area.
Thank you, Chair, for the question, and good morning to all of you, and expressing my gratitude to FSSAI for conducting this and inviting us over here. Yes, I would like to say that we had recent cases in India looking at this aspect. All of us are very aware of a few of the deaths which have happened in this context. And looking at this, we would like to say nutrients and nutraceuticals per se has its own ingredients and formulations very clearly. And when it comes to health supplements, there is a demarcation given very clearly how to follow that. Now, taking this over as an overdose and then claiming it was because of something of those levels, we cannot say anything without a scientific evidence on that. So it is very clear that anything which you take as an overdose is not recommended at all. Even for food, we consider like that. Honey especially is an agent which everybody consumes daily, but nobody consumes it as an overdose. So here it's a very clear demarcation which comes that we should follow the regulatory affairs and also be very consultative when we are taking those health supplements or nutraceuticals as per the law, as per the norms which have been prescribed, and especially when you're going to a gym or going to have some active exercises, this needs to be in your concern that everyone has a different body type. And according to the body type, those health supplements or the nutraceuticals will be interacting with our body, with the kind of food which we take, and has a health matrix attached to it. So we need to be very cautious following the norms. Thank you.
Ma'am, thank you for your caution and phenotyping of different body types, etc. We move to our friend and colleague Vaidya Joban Kishore Modaji. Thank you so much for being here. He's a senior a professor at the Kalpana Global Institute of Ayurveda in Jamnagar. And my question to you, sir, is that, botanicals, and Dr. Koteja ji, just before you was talking about the science of botanicals and how it's getting more and more authenticity. So, how do you assure authenticity of botanicals in supplements? A lot of challenges are being encountered. And we are seeing that, this is a big market. He just told us that from 3 billion, it's moved to 9 billion, moving upwards. So what are the methodologies we are available, and you're using some of them in Jamnagar, I'm told. You do some cutting edge science on botanicals and improving the quality of these botanicals. So can you educate us on that, sir?
Well, as our Secretary Sir rightly mentioned, that we have so many standards already set, and we are still working as collaboration makes every science more improved. For now, to assure the authenticity of botanicals, Ministry of Ayush has published the Pharmacopoeia of India for standards describing the quality, purity and strength of selected botanicals that are manufactured, distributed and sold by the licensed manufacturers in pan-India and across the globe as well. The Ayurveda Pharmacopoeia of India Part 1 has a database of more than 600 commonly used herbs and 200 plus polyherbal formulations throughout the country. There are supporting pharmacopoeial publications for thin layer chromatography, and macroscopic and microscopic guidelines of specific atlas has also been published. All these APIs have collectively specific taste for all these herbs, and they are specific for that particular herb. So we can identify and show the quality of that herb especially. And when we talk about the traditional knowledge of Ayush or botanicals, it is there in our tradition since not decades but centuries. And when we are assuring and when we are giving approval to some of the new chemical entities with, say, a group of 5,000 plus patients, where these botanicals are in practice in our tradition since, I can say, 500 plus generations. So the safety is itself, the work itself is expressing. Thank you.
Thank you so much. I think it's a rich heritage which we have. We have to put an evidence base to it, and we are putting some science around it, and we are rediscovering and repurposing what we already know. So,
and we are open for any kind of collaborative
absolutely,
work.
Absolutely. So congratulations for all the work you do, and we move gears again, and we come back to Ma'am Lingping Zhang. Ma'am, thank you so much again for that addressal to that controversial question on NRV, and we are looking forward to that guidance. But we move to another hot topic, which is probiotics. And I think Codex has been really at the forefront of setting some guidelines and standards being set up by Codex on the emerging strains of probiotics, because there's a lot of new age strains of probiotics. How can you do risk assessment of these emerging probiotics, ma'am? Can you throw some insights on this? Thank you.
Excuse me, Chair. Can I ask you, please, could you please repeat your question?
Sure, I'll be slow. Probiotics, there are a lot of views on emerging probiotics, and how do you risk assess these emerging probiotics, and are there any guidance or standards or guidelines being set up by Codex in this field of probiotics?
Thank you, Chair. There are a couple of questions. Maybe I can first answer your last question. The answer is no. Currently, Codex does not set any definition nor any guidance and standards for probiotics. But one thing I would like to emphasize that probiotics has been appeared in Codex text. Although there is no definition, in Codex there is one standard, that is the standard for DUH, which was developed by the regional coordinator, that is Near East. They already include the terminology DUH, probiotics, although we currently don't have any standards for that. This is for your last question. Other questions related to the risk assessment. As a Codex secretary, we know that when we need risk assessment, we always can ask the help from our parent organization, that are FAO and the WHO. And if we have the request, and the FAO and WHO will call on appropriate experts globally, and they will help us to conduct the risk assessments. Currently, there are some joint scientific bodies, such as for microbiology, that is GEMERA, and we also have a scientific body for nutrients, that is Ceremonial. They are conducting risk assessments. That is your second question. And sorry, I forgot what is your first question.
The emerging strains of probiotic.
Oh, yeah. Thank you. Yes, I think we all know that continuous innovation in scientific development can significantly impact our life, and we all benefit from it. This is also true for the emerging strains of probiotics. I know some articles even refer these strains as smart probiotics. But in the meantime, we know that may be more effectively, we can have more benefit from them, but ensure their safety is the most factors we need to consider before we allow it to be used in food.
Thank you, ma'am. Thank you so much for doing this clarification. We go back to Vasuji, if I can call you Vasu. We see this concept of pharmacovigilance for pharmaceuticals. But what are your thoughts that is there a need for a similar concept for nutraceuticals or health supplements? Should there be a nutri-vigilance like pharmacovigilance?
Yeah. Thanks for the question again. In fact, the pharmaceuticals and nutraceuticals are miles apart. In the sense, the nutraceuticals, we more focus on the nutrition part of it rather than on the drug part of it. But now the ancient, the practices, they have been teaching us how to use the food as a medicine. So that's where I think the demarcation happens, and probably that is the reason we find it's a complicated area where how do we assess the drug part of it is a major issue in nutraceuticals. Food, yes, NRVs can be established for food part of it, but when it comes to curative effect or the therapeutic effect and all that, that's where we get into a lot of complicated issues, and we will not be able to really assess, even quantify what is to be done and what is to be taken as a dose for an individual to, even the probiotics which we have been talking, they say 10 to the power of 8 CFU per gram of food. If it is there, probably that will help in taking care of the physiology of the animal or the human being. That is where is the issue which clearly demarcates the pharma as well as the nutraceuticals.
So thank you. I think we need to do the right symbiosis. They say that, the good human health is how symbiotic your bacteria are in your gut actually, and that's really the gut balance is more important than our bank balance.
The antagonistic effects.
Absolutely.
These things have to be understood.
Absolutely.
Otherwise, it is rather.
So we move gears, ma'am, to Sridevi, ma'am. There is no clear guidelines on combining. Again, this is a hot topic. Combining ingredients when you formulate nutraceuticals. We have multi-ingredients. So how important is to do the right scientific research with rigor in combining ingredients when we consider safety first and efficacy second?
Yeah, thank you. I think you've touched a very, very important issue. Actually, even in nutrition, depending on the age, the gender, the health status, and the kind of activity, we do define the RDA. And children cannot be given too much of fiber or too much of these polyphenols and other things because it will affect their absorption of the nutrients. Therefore, it is very, very important the delivery mechanism, what are the things that we are going to combine into this preparation. And more so, we do know in case of, say, for example, iron, the presence of vitamin C enhances the absorption. Similarly, we know that carotenoids are
passively absorbed in the presence of lipid. And many times when you're cooking it with a lot of oil, there could be more destruction and affect the bioavailability also. So we do know this with nutrients. So there is likely to be similar effects even in the case of these nutraceuticals. And we need to understand their release kinetics, because they are being given in the food. How exactly, when are they going to be released, how much is going to be released, whether they are more bioavailable, whether they are reacting with the other nutrients and forming certain other metabolites, and which could not be having the same kind of activity, and so on. So all of this definitely needs to be studied, and only then we would be able to really understand how to package them and to deliver them in the form of a functional food. And some of them could also adversely affect the nutrients in the food matrix. That also needs to be understood.
Thank you, ma'am. Thank you so much for giving those insights. We need to do a lot of isotope labeling as well and look at the mix and matches correctly. Khalid Al-Juhabi ji, we have this TUL as a concept, tolerable upper limit. So do you think this unmonitored consumption of health supplements in the long way, they often cross this TUL, tolerable upper limit? And can it have some adverse impact on the health of consumers?
So the short answer for this is yes, in the sense that some patients who take the supplements, actually, when they visit their physicians, they may not disclose this to the physician. That raised concern to me that there may be interaction between supplements and drug interaction. So it raised concern, yes, to me. And the other thing is, for referring back to the Omani health guidelines, so a well-nourished adult will not need supplements if they are verifying his dietary intake. And there is a limited evidence actually for a benefit of supplements for those well-nourished adults. Yeah, thank you.
So thank you so much. Alka ji, what do you think are the challenges in the few coming years the nutraceutical industry will face? It's a very broad question, right, with a short answer.
Yeah, the question itself is a challenge, because asking about industry and business dynamics posed to a scientist who hardly comes out of their labs. Yet as a citizen, and a citizen who's educated, I would like to take this question. There are always challenges on account of winning the market competition, IPR, regulatory challenges. They are always there in all business setups. However, in this particular scenario of nutraceuticals and health supplements, the single biggest challenge that industry is going to face is this educated, intelligent consumer. They are going to ask questions. They are going to define the demand also in days to come. So it is the time when the evidence-based exercises are to be taken with respect to nutraceuticals and health supplements. Gone are the days when consumer thought that we'll travel to the Western countries where the standards were traditionally higher for these things, and we'll buy stuff from there and use it. Now people are increasingly conscious about the money they are paying and the value they are getting and the confidence they are getting. So ensuring this trust and winning it over year by year is going to be one challenge, which probably requires that in Indian setup, the industry should start looking at the traditional recipes of health supplement and nutraceuticals, with the, backing them up with the technical evidence. In a country which is driven by faith, belief, religion, for a certain amount of time, the show can run. However, with education, these beliefs start, wavering. That is the time when the science has to come into picture on regular basis, and these are the enabling time for our country. I'm sure there has been a lot of discussion around BD Act amendments, and if as soon as the amendments come in enforcement, these are going to be the wonderful time ahead for the Ayush industry as well, because the codified knowledge is going to be the enabling scenario, and lot of information and the treasure which is hidden there in the Ayurveda and Ayush manuscripts, those can be brought into standard very fast, and business hopefully will prosper on those lines. With that, I close my.
Thank you, Alkaji. I think you make it two very nice points. One is that we need to declutter and generate evidence because we have too much of social media clutter around us, and that really is the need to generate Indian evidence and Indian science, and to put some evidence for our Indian rich Ayurvedic traditions. I think all the points are extremely well taken. So I move gears to Madam Nair, and this is another hot topic. I think there are two houses. One is the drug house and the second is the food house, and they both are housed, the regulators are housed in the same building. And I think the food building is, the floors are more than the drug floor. So, currently there is a lot of confusion among stakeholders between health supplements and drug and prescribed medicines. How do you feel the regulatory authorities should sharpen that demarcation? Because that demarcation sometimes gets blurred. So I think this is not an easy question to answer, of demarcating between health supplements and drugs.
Thank you, Chair, for the question. You yourself have posed that it's a great challenge. So first and foremost, the drugs are definitely taken care by the FDCA people. So they have a set of rules, regulations which are going on. Now moving to the differentiation between the pharma part and the nutraceutical part, we need to create more scientific evidences, systematic clinical trials with if it is combined with an RCT base, then it is really very good. And those evidences will definitely prove scientific base for clear demarcations and setting standards for the nutraceuticals. The nutraceuticals basically do have the nutraceutical claims, which already the FSSAI has laid down. And the nutrient content has to be specified as per the Schedule 4, which is mentioned over there. And there are nutrition comparative claims which are also aligned over the system. So that helps us to clearly demarcate very clearly. Only thing is that we need to catch up with the times and improve those and clearly move to the standards and improving them. With the health claims, we have nutrition functions to be laid down very clearly, and they are specifically for disease reduction and prevention as to be stated, and other functional claims which clearly demarcate, which says that it is shown or it is proven to have certain specific benefits. But either of these are not on the medicinal part of it. They are very clearly saying it is the health part of it. So we need to be very cautiously practicing this, and now we have a lot of health supplements which are in the country. We are flooded with a lot of health supplements. We are flooded with a lot of nutraceuticals. We heard about the botanicals. We heard about the Ayurveda. So one needs to be very clearly using them, associating with our daily life. And I would embark specially that the FSSAI is looking into it, and the standards needs to be set very thoroughly so that we are not on any dangerous level and we can have clear demarcations for this, because already we have laid the base for the same. Thank you so much.
Thank you, thank you. Walking on a tightrope is not easy, but nevertheless we still have to do that.
Yes.
I'm told by Kavitaji that we have brevity of time, we are running late, we are on Indian stretchable time, but we will try to finish on time, ma'am. Don't worry about that. Because we have with us Vaidya Joban Kumar Modaji, and he's getting to us a perspective which is entrenched into centuries, as he said. And it's really important to understand that Ayurvedic products are great. They are there for a very long period. The longevity is probably the longest on planet Earth, but the data needs some, delineation in safety perspective. So when it comes to safety, some people have unsupervised Ayurvedic supplements, some of them may have metals on steroids. These crop up all the time. So how do we even assure, and what are your views, if you do not do it under a Vaidya like you, and there's a collaboration between, say, an integrated system of medicine, which is what is the mission of Government of India, that integrate the best of Ayurveda, the best of allopathy, and marry them together with some rich evidence base and see how best to get it out for, because at the end of the day, our people are our consumers, and our people are our people living with diseases, and we really need to take care of them. So how do we assure safety from an Ayurvedic standard?
Coming to your question later, I'll like to add one important point that what you asked to Shri Vasuji. We have in Ayush system as well, we have pharmacovigilance centers pan-India since 2007.
Great.
And we rarely get any serious adverse ADRs, complaints or such cases. Otherwise, the Ayurvedic medicines, as medicine, they are very safe if it is taken under Vaidya's supervision. And because Vaidya knows the Prakriti, there are 8 different basic things which are examined, and then according to the patient's need, tailor-made prescription is always prepared. But when you are asking that when it is taken without any Vaidya in between the product and the consumer, it is always a question mark. Overall, Ayurvedic medicines as medicines are safer, and as we almost all of us are consuming A, B or C. For example, curcumin, haridra, the haldi, turmeric is a dietary supplement or a medicine. So such questions, when it is taken judiciary, when it is taken as per the dose prescribed by the classical text of Ayurveda, they are very much safe. But when it comes to extraction something out of, for example, from curcuma longa, we are extracting curcumin. And if that curcumin is taken, normally in our day-to-day recipes, we add just a pinch of curcumin in any dishes. But when the curcumin is extracted and it is taken, for example, 2000 milligram, then we need to study it thoroughly, and then it should be in the market. That's what my opinion is.
Thank you so much. I think so. The key is that whether you take any form of a medication or a supplement, it needs supervision, either by a specialist, which could be an Ayush specialist, or could be an alternative specialist, or could be an allopathic specialist. But supervision is the key. So I know that I'm conscious of my time, and Kavita ji, I must first thank FSSAI for hosting this meeting outside Rome and this Global Food Regulatory Summit. We have to thank Government of India, right from our Prime Minister to the Health Minister to the FSSAI CEO, Oberoi ji, who's sitting here, and everybody for allowing us to have a dialogue. And I wish that this dialogues get translated into some position statements or white papers, and we are able to enrich in the experience and the wisdom of this august guardian. And also we are able to get out some research ideas, because ultimately we are translating what we have observed as evidence based. So I think what I got from this whole panel was, from all these domain experts from different parts of the world, is that we need to generate high quality science and evidence. We need to separate the controversies and walk on the right line. But ultimately we are in Vasudevam Kutumbam, in a global village, and we have a common goal of 8 billion people on planet Earth to make their lives safer and better. And the food they consume, they need to be mindful of it. They need to do the right yogic practice. We need to integrate all forms of locally prevalent therapies, including therapies like Ayurveda, rediscover them again and put some science behind it. Thank you so much for a wonderful hearing, and thank you for this awesome crowd here. Thank you so much.
Thank you so much, sir, for this wonderful session, and all the panelists for providing a thorough insight and emphasizing the importance of major areas which need attention in this field. We desire that the extract emerged out of this discussion shall set the platform to enhance this domain. By working together, it is possible to establish robust regulatory frameworks, promote scientific research, and enhance consumer education and confidence to uplift this field. With this, now I request our former CEO, Shri Pavan Agarwal ji, to felicitate the panelists. Sir, please. Sir, kindly honor Ms. Ling Ping Zhang. Kindly honor Dr. Alka Rao. Kindly honor Dr. Joban Kishore Moda. Dr. Khalid Al-Zuhabi.
Good pronunciation.
Thank you. Kindly honor Dr. Vasudevappa. Dr. Dr. Sridevi Annapurna Singh. Dr. Serena Moore Nair. Now I request CEO FSSAI, Shri Kamalavardhana Rao ji, to felicitate Dr. Shashank Joshi. Thank you, sir. Now there will be a 15 minutes.
Can I take 2 minutes?
Yeah,
please.
please. Yeah, please.
Good afternoon, friends. You know, I'm Pavan Agarwal. I used to be CEO of the Food Authority in India from 2016 to 2020. And it is wonderful to see, the food safety community, not only in India, but global food safety community on one platform like this. I remember, on 22nd and 23rd of August 2016, when we had a major event like this in Darbar Hall of Ashoka Hotel, where we had about 1,200 participants, more than the capacity of that the biggest convention hall in Delhi at that point in time. That was in some sense the arrival of FSSAI, which was, we were commemorating 10 years of inception of the food safety law in India. Now, after another 7-8 years, we see the Food Authority India blossoming, and reaching newer heights. And I convey my sincere gratitude to the current administration of FSSAI to take it to the newer heights, and to our delegates from abroad for reposing their confidence in India's food regulatory system and coming in such large numbers for this kind of a gathering. Standard setting is only one part of the role of food safety authorities. Let me say that India's food authority has done, a credible work which is scalable in many other areas of food safety administration. And I do wish that when you are here, kindly, in addition to the robust standard setting mechanism that India has established, kindly also get a little glimpse of the other areas of work of the food authority that India is rightly proud of. Thank you very much. Thank you.
Now there will be a 15 minutes refreshment break before we start the next session. 10 minutes.
11:35 they have to come back.
Okay. Okay. I request everyone to return and be seated at
the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers,
Food Regulatory Authorities Handbook, useful for exporters, ensuring food safety for nations. FSSAI launches Sangraha, Safe Food for Nations, global. FSSAI launches Sangraha, Safe Food for Nations.
The conversation surrounding food safety and standards and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a...
आज आपकी जिंदगी में कौन जीत रहा है? दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं? नहीं, कोई नहीं, लीजिए, बस आधा चम्मच कम कर दीजिए। और कुछ दिन बाद समझ गया ना? क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है. Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीज़ों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है. बस यूं समझिए कि प्लस और माइनस का खेल है. देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए. ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा. और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस. तो प्लस है और थोड़ा कम है ना. सिंपल. ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट.
अन्नम परब्रह्म स्वरूपम.
Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा. अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन.
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with a focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना? क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है. Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीज़ों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फार्मूला है. बस यूं समझिए कि प्लस और माइनस का खेल है. देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए. ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा. और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस. तो प्लस है और थोड़ा कम है ना. सिंपल. ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट.
Annam Parabrahma Swarupam.
Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा. अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन.
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद, समझ गया ना? क्योंकि तंदुरुस्ती दिल से ज़्यादा दिमाग का खेल है. Start reducing your intake of sugar, salt and fat from today.
Ladies and gentlemen, welcome back after the refreshing tea coffee session. It's 11:45, quarter to 12. We had requested all of you to be here by 11:35. We cannot stretch it too long because delaying one session, it's like a relay race. Delay other session, delay your lunch. If you want to have a hot, sumptuous lunch, requesting all of you to grab your seats fast. Otherwise, again, the thin line between hunger and anger will become very conspicuous. All of you will get angry on me. My apologies in advance. So, requesting all the volunteers and the liaison officers of FSSAI, all of you get seated inside, please. Please be seated. Bala, you start.
Good morning, distinguished guests, ladies and gentlemen. So once again, I welcome you for this international summit. So we are going to have another important topic, contaminant residues, risk mitigation and regulatory intervention. Chemical contaminants include broad range of chemicals which may be present in food and have a potential cause to harm. Chemical contaminants may include mycotoxins, plant toxins, heavy metals, organic pollutants, and pharmacologically active substances. So there is a need to significantly minimize or prevent the presence of those contaminants and residues in foods which are hazardous to human health. Pesticides are chemicals which plays significant role in food production. However, pesticides are potentially toxic to humans and have both acute and chronic health effects. The risk assessments for contaminants and residues in food is conducted based on different scientific studies. After assessing the level of risk, ADI is established to ensure the amount of contaminants and residues. Similarly, the bacteria, fungi and virus are main biological hazards and causing acute foodborne disease. Foodborne disease can occur as an isolated case or an outbreak and sometimes spread around the world to cause pandemics. So to reduce the occurrence of these contaminants, integrated mitigation strategies should be in place, including the GMP, good manufacturing practices, and GHP, good hygiene practices. So with this, I request the panel moderator, Dr. Deprada Kanungo, to come to the dais. Dr. Kanungo is World Health Organization expert in the Joint Food and Agricultural Organization and World Health Organization Committee on Pesticide Residues, JMPR, and Joint FAO-WHO Expert Committee on Food Additives, which is JICFA. He has more than 40 years of experience in the field of regulatory toxicology and held the position of Additional Director General in Ministry of Health, Government of India. I welcome you, sir. May I request Professor Susan Jebb. Professor Jeff is the chair of Food Standard Agency in United Kingdom. She is one of the UK's leading scientists, a fellow of Academy of Medical Science and honorary fellow of Royal College of Physicians. She continues to hold a part-time appointment at the University of Oxford as a professor of diet and population health. I welcome you, madam. Now I request Dr. M.R. Sudarshan, Chairperson, Codex Committee on Spices and Culinary Herbs. He is a scientist with 32 years experience in the field of research, production, development and marketing of spices, and he has previously worked in the regional station of Indian Cardamom Research Institute. I welcome you, sir. I also request Dr. Ajit Dua. Dr. Ajit Dua is a Chief Executive Officer of Punjab Biotechnology Incubator. She associates with NABL as a lead and technical assessor in the field of testing. And Dr. Ajit Dua also chairperson of scientific panel in sweets and confectionery, including honey at FSSAI. I welcome you, ma'am. Now I request Dr. T.P. Rajendran. Dr. T.P. Rajendran is the visiting fellow at the Research and Information System for Developing Countries. He is also involved in engagement of RIS and SDG related policy research in collaboration with Niti Aayog. His work also includes policy research on harmonization of biosafety regulations and the BRICS Wellness Forum discussion. I welcome you, sir. Now I request Dr. Suresh Korpole, Senior Principal Scientist, Microbial Type Culture Collection, Division of CSIR IMTech. Dr. Suresh has a PhD in microbiology and visiting faculty to German Microbial Cultural Collection Center, which is DSMS. His research is focused on novel species establishment, microbial interaction and antimicrobial compounds. I welcome you, sir. I request Dr. Paresh Govindlal Shah. Dr. Shah is a retired as a head pesticide residue laboratory, Anand Agricultural University, Gujarat, India. He is a presently chair of scientific panel on pesticide residues at FSSAI. I welcome you, sir. The contaminants and residues in foods, the risk mitigation through regulatory intervention, it's one of the very sensitive area in the food safety ecosystem. So I request the chair of the panel, Dr. Kanungo sir, to take it further. Over to you, sir.
Thank you, Dr. Balasubramaniam. At the outset, let me congratulate Government of India, Minister of Health in general, and FSSAI in particular, with stalwarts like CEO, advisors, and others to organize this such a big event. The management, let me be on record, the management for managing this organization is superb. How it is superb? I have seen so many such events, but the unique of it is the identification of these liaison officers with the speakers. Thank you, CEO Sahab, for this idea, especially the girl, I think her name is Khushi, who is attached as liaison officers. She has made my life very simple. So welcome to this panel discussion. One thing is, I am basically from Odisha. Odisha is a state inside India. In Odia, it is one thing is told, peto pai nato. That means whatever we do, it is only for the stomach. If you go, that means food, stomach, food, and then all the things goes. It is a crucial contributor to the human health and also a major source of worry, stress, and pleasure. One of the reasons behind this stress and worry are the disease caused by or disease caused as a result of contaminated foods. A lot of statistics have been given by different speakers yesterday and today. I don't want to say how many people get sick per day, how many children under 5 years die, and what is the revenue loss. But I can say that about 1.4 billion people, they do not afford to healthy food. This thing we have to say, healthy food, I mean not only the safe foods, but also the nutrition aspect also. 200 diseases, I'll say more than 200 diseases are caused by unsafe food, ranging from simple diarrhea to cancer. WHO has recognized food contamination as a global challenge. It is clearly acknowledged by everybody that food contamination that occurs in one place may affect the health of the consumers living on the other side of the planet due to the internal food trade, which is growing day by day. What are contaminants? Already Dr. Balasubramaniam has told. It could be bacteria, it could be virus, it could be parasites, it could be natural occurring toxins like mycotoxins, it could be heavy metals like copper, lead, arsenic, mercury, and most controversial issues nowadays everywhere is the residues of pesticides and veterinary drugs. Pesticides are chemicals used for protecting the crops that may leave residues in treated commodities if not used as per the good agricultural practice, so as the case of the veterinary drugs. These are toxic in nature and can cause harm to the human health if it remains or consumed excess of that their limit. So there is a need for fixation of limits. We have a lot of challenges in the food safety. It is because of there is a change in our food production and supply. Till yesterday, we are not very much concerned about the ragi production, the millet production. Now we are concerned about the millet production. So food production, it is getting changed. Different technology are coming. Imported foods, more imported foods are there. Effect of climate change. New emerging bacteria, AMR we discussed yesterday. New emerging bacteria including the AMR. There are also challenges for the food regulators. How to mitigate the level of contamination. How to identify the legally permitted maximum residue limits. Mitigating these risks involves the combination of preventive measures, monitoring systems, including the adoption of general principles of food hygiene. There are, I think this panel discussion is having certain objective. Can you harmonize the food safety standards with codex and international agencies? Can we have effective risk assessment strategies to fix the limits, whether it is ML or MRL, of the contaminates, including the pesticide residues? Can we understand the strategies and mitigation measures to prevent biological hazards? Panelists joining with me, both on the left and right side sitting, are highly experienced experts in the field of contaminants and residues, food safety, public health policy. Their diverse background and rich experience will provide us valuable insight into the challenges we face and the strategies we can employ to combat the risk related to the incidence of contaminants and residues in food products. We are expecting a robust mechanism to set up the safety limits for contaminants, latest development of risk assessment, and effective approach to identify the mitigation measures. Throughout the panel discussion, I would request the panelists to flag the issues and shed light on challenges surrounding the incidence of contaminants and residue in food and examine its impact on consumers' health and identify potential solutions and best practices that can be implemented on a global scale that can hamper the food safety. We hope that this dialogue will inspire collaborative efforts and effective policies to mitigate the risk posed by the contaminants and residues. To start with, let me ask my friend from UK, Dr. Sushan. You are involved in a lot of research and development activities. What research and development activities are on in your area of emerging contaminants? How are the emerging contaminants identified?
Thank you very much. Thank you very much. So since leaving the European Union, the Food Standards Agency in the UK has taken on responsibility for assessing food and feed safety. And although we initially adopted all of the EU rules in relation to contaminants and brought those into UK law, of course, if new risks emerge, we will have to take our own action. So as you say, the research and development activities so that we can be ahead of the game in identifying possible areas of risk are incredibly important to us. Within the FSA itself, we don't do a great deal of our own primary research. We do collaborate with our research institutions with things like UKRI, which is the UK Research and Innovation Department, in order to do that primary research. But within the agency, our focus is on horizon scanning. So we have a dedicated horizon scanning team whose job is to keep abreast of the scientific literature and to look for new findings on emerging contaminants worldwide. So we look at the academic literature, we talk with our scientific advisory committees, we talk to stakeholders, and we also review the incident reports which come through when things are identified, whether that's at the border for import checks or whether it's on domestic food. So that is really our mechanism for trying to be ahead of the game and to see where the first signals emerge that we can get on the case. The second part of it is really about assessing people's exposure or likely exposure to these risks. So it's very important that we work closely with our colleagues in the Department of Health who do the national diet and nutrition surveys so that we can start to understand exposures, or even to do dedicated surveys if need be. And in those ways, we understand where the potential risks are, we understand the exposure, and we can see whether we need to take further action. One other area which is very important in the R&D field is the work that our national reference labs do. So if we're going to be able to address a potential new contaminant, then we need to be able to measure it, and we need reliable, accurate systems to do that. And so part of the work of our national reference labs is to develop and refine new methods. So one, just to bring this to life, one thing that we are beginning to feel concerned about is persistent organic pollutants, so what are sometimes called forever chemicals that persist in the environment. And our NRLs are currently working to develop and refine a method for determining PFAS in particular in food and obviously food packaging and food contact materials. And that, once we've got those methods developed, the NRLs will help train other people so that we build our capacity for enforcement if we should need to do that. So I think the research is really a combination of things. It's about identifying emerging risks, it's about understanding exposure, and it's about identifying the methods which we're going to be able to use to detect those contaminants.
Thank you very much. So let me go to our next panelist, Dr. M.R. Sudarshan. You are a spice specialist, so you provide us the spice. As a chair of the Codex Committee on Spices and Culinary Herbs, what are the specific challenges you have and considerations to microbiological safety in the context of global food trade? Because we export a lot of spices, and probably because of the spices only, the India was conquered by the Westerns. So what do you think concerns of the microbiological safety in the context of global food trade and import and export regulations, especially with respect to the spices?
Thank you, Chair. Good afternoon, ladies and gentlemen. First of all, I'd like to thank the organizers of this summit for inviting me to be a panelist in this session. It's true that the spices and culinary herbs form a very important part of our food systems. India is the largest producer, exporter, and consumer of the spices. On an average, we produce about 10 million tons of spices annually, and we export about 1.5 million tons. We cater to about 47% of the world market of spices. So that shows how important it is for India to be the global leader in spices sector. The safety of spices and dried culinary herbs depends on maintaining food hygiene and food hygienic practices along the food chain during the primary production, processing, packing, retail, and till the point of consumption. The production, processing, and packing of spices are very complex. They are generally produced in varied agroclimatic conditions all along the tropical and subtropical countries in small farm holdings. And once the produce comes to the market, it is aggregated, collected in different places, and after consolidation, it is taken to the processor, either for further processing and manufacturing or for exports. Typically, the primary processing, like after the harvest, the cleaning, basic cleaning, sifting, sorting, drying, is done on the farm level. And then at the processor's level, again it is cleaned. And when it goes to exporters, it is subjected to cleaning and microbial reduction techniques before it is exported. So in the process from production till it reaches the consumer, it takes a long time, and it is spread over different places. Over a period of time, the contamination could happen anywhere in the production chain. So the general understanding is that agriculture commodities, including spices and culinary herbs, cannot be produced without any defects. And even after following good agriculture practices, but these defects get drastically reduced during the processing, following good, good manufacturing practices, and implementing HACCP along the line, and also good hygienic practices. Spices and culinary herbs, though considered a food, they are not consumed per se for their caloric content or like staple food, fish, meat, cereals, pulses, but they are added to the food to impart color or increase the aroma or impart flavor. Common microbial concerns in spices and culinary herbs are the molds, yeast, bacteria, significantly salmonella. And of course, the Clostridium, Cronobacter, Staphylococcus, they have been encountered often. Historically, foodborne diseases attributed to the spices are rare. There have been some reports of foodborne illness of microbiological in nature traced back to spices used in some of the seasonings, the paprikas, and in salami, black pepper used in salami. The American Spice Trade Association guidelines on the clean spices includes 5 key recommendations for mitigation. That's minimize the risk for introduction of filth throughout the supply chain, prevent environmental contamination, cross-contamination, and post-processing contamination during the processing and storage, use validated microbial reduction techniques, perform post-treatment testing to verify the safe product, test to verify a clean and wholesome manufacturing environment. In the context of global food trade and import regulations, the use of Codex guidelines by importing and exporting countries alike should help facilitate any necessary assessment of the relevant components of the national food control systems. So we have many guidelines developed by Codex, which could be of help in addressing these challenges, like principles and guidelines for the establishment and application of microbial criteria related to foods and other guidelines. Thank you
very much. Thank you very much, Dr. Sudarshan. This production, processing, and packing of spices are very complicated, and with help of GMP, GHP, and GCPP, it is not. It is the public health contamination is not, or public health problem is not there, and foodborne diseases are very rare. Can I come to the our next panelist, Dr. Ajit Dua? What role do regulatory bodies play in setting microbiological safety standards and enforcing the compliance? How do you think the standard setting process for microbiological safety be more robust? Can you just answer me in 1 or 2 sentences?
Yeah, thank you, sir. Good afternoon, everyone. And first of all, I express my gratitude to FSSAI for inviting me as a panelist. It's an honor for me. Your first question is regarding what is the role being played by the regulatory bodies. They are playing a great role. In fact, the science-based standards are being set up by the regulatory bodies, and how they are enforcing it. For example, for microbiological standard, food safety officers draw the sample. I mean, the problem which we were facing, that there cannot be repeat analysis in case of microbiology. So the results will vary. So it was decided that 3 consecutive samples will be analyzed by 3 laboratories, and those will be considered. And regarding making robust standards, I would say that we should have risk-based standards. Sometimes there is no need of a standard in a specific country, so we should take into consideration the risk involved. And secondly, it is important to have process-based standards. Here at FSSAI, being a member of the scientific panel on biological hazards, so we converted some of the product-based standards into process-based standards. It is very important to consider water activity, acidity, and the temperature being followed, that what kind of bacteria or organism will be there, so to take care of that, and what are the groups, target groups who are consuming that food. So it is very important. Now, to conduct the risk-based standards, we need to have data. So here I would like to highlight that we have integrated disease surveillance program in which food poisoning cases are being reported. Now, these food poisoning cases, they need to be linked with the food's microbiological food safety, what kind of food poisoning we have observed and what kind of standards do we have. So there is integration of these two is very, very important. And to have risk-based data, we need to have data. One more point I would like to highlight here, because microbiological analysis is a long analysis. It takes for pathogens, for example, for Salmonella 5 to 7 days. So we need to have some fast methods in microbiology for maybe screening, because new innovations are coming up regarding methods as well as technologies also. So we need to have innovative technologies which can give us fast results, because microbiological, these food pathogens, they are the immediate concerns. Chemical contaminants, they are the slow poisons, but they affect immediately. So these are my takeaways, sir.
Thank you, Dr. Dua. In fact, this microbiological analysis is very problematic in the sense they cannot be repeated. If some analyst has done something wrong, it cannot be repeated, it cannot be challenged. And moreover, it is a long period analysis. I am coming to Dr. T.P. Rajendran. Dr. Rajendran, basically there are different standards of pesticides in different crops in different countries, depending on their good agricultural practice, climate, etc. This sometimes creates problem in our international trade. Somewhere it is somewhere it is 0.1, somewhere it is 0.3. How do you think the countries will harmonize the safety standards, especially for pesticide residues with codex, to support the international trade without compromising the food safety as well as the good agricultural practice?
Thank you. I thank FSSAI for honoring me to be here amongst you. The importance of trade in agriculture commodities is best demonstrated by our huge amount of agriculture commodity exports, particularly in edible cereals like rice, and as Dr. Sudarshan told about spices, volumes of exports are happening. Yes, in exports we have two sentiments to be appreciated. One is the domestic countries, the importing countries' standard, which they prescribe in the SPS and the trade agreements, which ultimately fructify due to negotiations. In that context, the agreements which happen between importing and exporting country is one way of handling this situation of heterogeneity in the risk assessment patterns or the risk perceived standards which each country is following. The second aspect would be, if these kind of things are not available for the importing country, they would definitely be looking for the codex standards, which we always have a contribution, as most of our countries in the world are almost 180 of them are members of the codex system, and the WTO has prescribed these standards as guidelines for international trade. The only business problem in some of these farm commodities like the meat or milk or such of those things, we have issues, and we are in the Indian standard system, FSSAI system, we have developed standards, and we are generally negotiating with them for that purpose. Default MRLs or maximum residual limits have been a way of life for compromise situations in trade negotiations. But my take on the MRL is, for international trade, is the technical barriers for trade. These kind of limitations should not be brought in. Even in codex discussions this happens, and technical barriers on trade shall not have such limits being introduced to limit the exporting countries' opportunity to enter in the international market. Although the importing countries' aspiration to secure the health of their population is appreciated. Thank you.
Thank you. Let me come to Dr. Suresh. You are from CSIR IMTech. You have got a well-established MTCC center, which is an international depository agency. Provisioning of reference culture plays a vital role in effective food testing and fulfills the requirement of laboratory accreditation. Will networking between the national and international culture collection agencies help the strengthening of the food regulatory system?
Thank you very much, Chair, and FSSAI for this opportunity. I would like to just get into your notice that the networking is very important issue, because specifically on the culture collections are supposed to share the microbial sources, so that every country actually can perform these microbial testing in their own premises, in their lab conditions. That actually increases the reproducibility. So that is where actually you can establish a global standard. However, in the recent past, because of the Biodiversity Act and as well as the revenue generations, many culture collections are not in alignment. It's a very unfortunate situation. But really, even some of the culture collections asked us to not to mention the their accession number or equivalent strains. And MTCC has about 14,000 strains, with about 3,000 strains which are actually have of international standards, and which are also available with other culture collections. So we have been involved in actually carrying out all these standard tests at our institute, and we are actually developing our own reference strains also. However, I would like to specifically point out that this culture collection networking is very important. It is essentially required, and because of this non-availability of the microbial cultures in the recent past, BIS and ISO, everybody is recommending for the culture independent techniques, right? Wherever specifically on Clostridium botulinum testings and Bacillus anthracis testing in the food, food or fodder, used for the animals and poultry. So also, I would like to ask at this forum to the global regulators to use the WDCM equivalency strain designations instead of one particular culture collection, because this is actually raising an issue that the culture collection is insisting not to use their equivalency while distributing these cultures to the industry or any other researchers. So therefore, using the WDCM, because WDCM is associated with the WFCC, that's World Federation for Culture Collections. So using WDCM numbers can actually solve the problem of the stakeholders also, right? Specifically the industry. So with this, okay.
Thank you very much. Coming to Dr. Paresh, you are the chairman of the pesticide residue scientific panel. Nowadays, because of some resistance development, the industries, manufacturing industries of pesticides are coming with different combination formulations. Sometimes one insecticide with another insecticide or insecticide with fungicide, etc. Do you have any experience or are you facing any challenge in fixing the regulatory MRL for different combination of pesticidal formulations?
Thank you, Chairman. And it's really great to be a part of this summit. I thank FSSAI for this. Coming to the question, the combination formulations. Yeah, it is, you know, the pesticide subject is dealt by two different ministries in India. Ministry of Agriculture and Ministry of Health. The data we get from the Ministry of Agriculture through good agriculture practices are processed for risk assessment by the Ministry of Health, and the MRLs are derived. Now, when we come to the mixture of formulations, sir, I have a strong doubt that last year we had this point in our discussion, and we searched the data. Unfortunately, the hazard data for the mixed formulations, either synergism or antagonistic effect, is not available. And I request the other country people, if they have these scientists, they have this data, we will be happy to share this, sir, so that risk assessment for the formulation can be made. Today, even EU or the Codex has no guideline, clear-cut guideline on this regard. EU has just started, and probably 2023, this year probably, they are going to have some kind of, you know, the mechanism to go for the risk assessment of the mixtures, maybe like organophosphate or synthetic pyrethroid. So this is, sir, I think, unfortunately, we don't have the database for this one, and we are doing a single pesticide risk analysis as on today, sir. Thank you.
Thank you. So, just before going to my next questions, I would request all the panelists just have a thought of it, and you may have to give one suggestion in one sentence before we conclude the panel discussion. Let me come to Dr. Dua. What are the emerging microbiological hazards or foodborne pathogens that we should be particularly concerned about? How can we stay ahead of these emerging threats?
Thank you, sir. Right now, we have standards for bacterial contaminants, yeast, mold, fungal contaminants. I would say that for viruses, norovirus, hepatitis A virus, there are a lot of prevalence is there. Unfortunately, we don't have much data in India, but for water, because it is waterborne and foodborne also. So in water, we have the standards. In food, I think standards are in progress. Similarly, parasites, viruses, these are the emerging concerns which need to be addressed, and our scientific panels, they are working on it. And again, sir, for laying down any standards, we need to have data. So for data generation, as Professor Jeb was sharing, that they have a network of reference laboratories. So same concept FSSAI is also having, and we have a network of reference laboratories as well as a network of research laboratories. So NetScofan is a very good example of that. So data sharing has started, and I hope very soon we will have sufficient data which will be supporting our standards and which will be helping us to take care of the emerging concerns. Thank you, sir.
Thank you. Okay, my next question is to Dr. Paresh. Today, when it comes to the consumer, and a lot of, the data, raw agricultural commodities are not available to the consumer. Most of the time, the processed foods are available, maybe orange juice, maybe atta, or maybe anything. How do you like to have the fixed MRL or fix the processing factors for fixation of MRL?
Yes, sir. This is indeed a challenging job, because almost we have in India more than 330 pesticide registers. Each pesticide, excepting microbiological of course, chemistry is different. And the commodity wise, you have to have a processing factor. Like when you are extracting a juice, then whether the pesticide present in the raw agriculture commodity is concentrated or it is reduced. So that has to be, proved by the evidences. So experiments are carrying out for processing factor. As on today, sir, what we can do, because we are lacking for many pesticides, we don't have the processing factor. So this is an area wherein a challenge is there and we are working on this. Like I will give you one example, sir, rice. Nobody eats rice raw. But if you take one particular fungicides, for that India suffered a lot about the exports of rice to EU country, tricyclazole. EU has a 0.05 ppm MRL. And the US, Japan and India has a 3 ppm. You can imagine that. And the rice is not taken raw, it is cooked. So after cooking, what is the residue? That is known as the processing factor. That is the processing commodity MRLs divided by the raw agriculture commodity. So if we have this processing factor, we can extrapolate. As on today, we don't have. So what we can do is the contributory raw agriculture commodity to that processing product we can work out, and we can have an MRL based on the weight basis. Thank you, sir.
Thank you. My next question to Professor Sushant. Basically, this ML or MRL are fixed on the basis of the risk assessment. What are the risk assessment strategies you adopt in the UK for fixing ML or MRLs of contaminants?
Thank you. So when we identify a risk, we turn to our scientific advisory committees to provide advice which informs the risk assessment. So these are independent committees of external experts, and they provide advice which informs any future risk management or other actions. That might just be guidance, or it might be a code of practice, but sometimes we will advise ministers to set some maximum levels or MRLs. Importantly, whatever we do, we try to be very open and transparent in that decision. So the committee judgments can be looked at by others and they can see the basis of our advice to ministers. If an ML is set, then we will always try to do that on the basis of being as low as is reasonably achievable. But that requires us to have a very good understanding of the occurrence in food, and also any geographical or seasonal variations. And in that way, we can set the level in a way that is going to encourage best practice. So what we want to do is to set it at a quite a stringent level so that we encourage all possible mitigation strategies in order to take as much of that contaminant out of the food chain as possible. And if businesses are unable to achieve that, then of course they will have to come out of the market. And then I think the final point which is also important is that we try to issue on some occasions advice to consumers as well, so we can help them to manage the risk. If there is any residual risk, there may be mitigation strategies which consumers can do at home. So for example, with some of the food packaging where there is leakage of chemicals, it's important that consumers don't use those plastics in a microwave or for hot or acidic foods. So on top of the MLs, there may be additional things that consumers can do which will reduce the risk even further. And all of those will feed into us doing the risk management decisions.
Thank you. Let me come to Dr. Sudarshan. Spices are often detected with mycotoxins. How the countries across the world adopt specific post-harvest technologies to prevent the mycotoxin contamination?
Thank you, Chair. Spices, especially some of the spices like chili peppers, paprika, the nutmeg, ginger, they are prone to the growth of fungi, especially the Aspergillus species, which produce aflatoxins and ochratoxins. They are generally detected. The contamination happens at the stage of harvest and post-harvest of these spices. Generally, the spices are dried to the moisture level of 8 to 10%. And if we maintain higher moisture content, the contamination happens. Or the reabsorption of moisture during storage, transportation also increases the mycotoxin producing fungi to develop. In general, like chili peppers and paprika, when they are dried and being filled into bags, the common practice is to sprinkle with water just to facilitate bagging. So this has been found to increase the moisture content in the end product and encourage the fungus to grow. And nutmegs, when they are harvested, they allow the nutmegs to fall to the ground and pick them up. So most of these fungi are soil-borne and they get infected from the beginning. So the post-harvest management practices like use of polytunnels for drying chilies and paprika and harvesting mats for the harvest of nutmegs and ginger slicing and rapid drying will reduce the incidence or chances of mycotoxin contamination by the growth of fungi. Packaging, as she was rightly mentioning, non-porous bags, containers should be used to protect spices and dried culinary herbs from contamination and introduction of moisture, insects and rodents. In particular, the reabsorption of ambient moisture should be prevented. Contamination could be prevented by use of liners where appropriate, as she was mentioning. So one more point I would like to mention, that there was no maximum limits for aflatoxins in these spices. At the initiative of India, the aflatoxin mLs have been set now. For chili peppers, nutmeg, the aflatoxin levels have been set at, the mLs have been set at 20 micrograms per kilogram. So this was the Indian initiative. It took a long time to get into, but the recent committee, Codex Committee on Contaminants in Foods, has adopted this and approved, and it is going to be the...
Thank you, Dr. Sudarshan. In fact, we have a time is a constraint, and I am having only 3 minutes. I don't want to really sum up the things, but I would request all the panelists just give one sentence which will be take away message of the audience, starting from one sentence.
Yeah, the one sentence what I would like to say is, as a microbiological person, better you go for the culture independent techniques to use in these regulatory aspects. That's it.
Okay. Thank you, Dr. Dua.
Say risk-based microbiological standards and some innovative quick methods for microbiological analysis.
Thank you. Sushan, Sujit.
Mine would be invest in science. We really need the best quality evidence if we're going to identify emerging contaminants, if we're going to understand exposure levels, and if we're going to be able to measure what's going on, which is going to be crucial for enforcement. So invest in science.
Thank you.
Follow scientific hygienic practices throughout, avoid contamination instead of mitigating it later. Thank you.
Dr.
Thank you. Pesticides and toxicants in agrochemical system of farming is unavoidable evil for getting productivity and commodity production and quality, and we need to respect the farming practices as prescribed in the GAP of the label and the containers. What's important is the standard setting system.
One sentence.
Yeah, the standard setting system should respect the fact that all these chemicals have degradation throughout its life cycle of the commodity. Let us understand this. Thank you.
Dr. Pares.
Sir, today the pesticide residue is the greatest barrier as far as trade is concerned. So my humble appeal to this G20 countries, let's have codex standards as a common MRL, and we can think on this line because this is considered the worst case scenario. So I think this would justify the
Thank you very
trade.
much. I think I thank all my panelists for wonderful discussion and thank FSSAI giving me opportunity to moderate this particular session. Thank you very much.
Thank you, sir. Thank you so much for the a lot of insights in the important topic on contaminants, residues in foods, risk mitigation through regulatory intervention. So now I request the Dr. Kannungo to felicitate the panel members. I request Dr. P.S. Shah to be felicitated, so kindly honor Dr. Shah, sir. Now I request Dr. Rajendran, sir. Now I request to felicitate Dr. Sudarshan. May I request Professor Susan Jeb to come? Kindly have the honor, madam. Now I request Dr. Ajit Dua, madam. Now I request Dr. Kannungo sir to felicitate the Dr. Suresh. I request our respected CEO sir to felicitate Dr. Kannungo sir. Thank you, sir.
Good afternoon, ladies and gentlemen, distinguished guests, and esteemed participants. Welcome to the Organic Production Discussion, Food Panel Discussion. We are privileged to have you here today to delve into the realm of organic production system, which not only just talks about the production of healthier food, but also about protecting the environment, the soil, and promoting the diversity and local communities. I am Sweetie Behera, Director FSSAI Quality Assurance. I have the honor to host this event for today. Before we begin our panel discussion, I would like to take some moment to recognize our exceptional individuals who will be guiding our conversations and share their invaluable insights. Please join me in extending a warm round of applause as we welcome our esteemed moderator, Shri Abhishek Dev, Chairman of Agriculture and Processed Food Products Export Development Authority. He is IAS AG MUT 2007 batch. Now let us meet our distinguished panelists as well, each of whom brings a unique perspective and expertise to the organic food production system. Please join me in extending a warm welcome to Ms. Dekain Choki. She is the Deputy Chief Regulatory and Quarantine Officer with the Bhutan Food and Drug Regulatory Authority under the Ministry of Health, Government of Bhutan. She holds an experience of about 13 years in the area of food safety and is currently looking after the certification of food and agricultural products. Our next panelist is Ms. Carla Menezes. She is the head of Department of the Laboratory and Biosecurity at National Directorate of Agricultural Health under the Ministry of Agriculture and Rural Development at Mozambique. She is also the country's focal point for Codex Alimentarius Committee on Veterinary Drug Residues in Food and Global Health Safety Agenda. Dr. S.C. Khurana is currently the team leader of the Evaluation Committee for Evaluation of Certification Bodies under the National Program for Organic Production being implemented by Agriculture and Processed Food Products Export Development Authority. He has worked for 36 years with EGMARC and 7 years with FSSAI. Dr. Gagnesh Sharma is a distinguished professional serving as the director of the National Center for Organic and Natural Farming. His expertise lies in developing and implementing strategies to enhance soil health, minimize chemical inputs, and promote environmentally friendly farming practices. Dr. A.K. Yadav is the Chief Consultant, Integrated Nutrient Management Division, Ministry of Agriculture and Farmers Welfare, and has also served as Director at National Center for Organic Farming, Ghaziabad, and as Regional Director at Regional Centers for Organic Farming. Ms. Mawate Mulenge is the Councillor Agriculture, Trade Commissioner Agriculture and Processed Foods, Fish and Seafood, Market Access, High Commission of Canada. She has been working for food system transformation as a technical specialist from the High Commission of Canada. She has a significant contribution to develop bilateral cooperation in various areas of food and agriculture. Ms. Mariano Bejerin is the Agricultural Attaché, Embassy of Argentina. He is actively involved in the issues pertaining to the agriculture trade across India, Argentina, and investment potential in agriculture. He has been part of various important delegations and stressed upon the need of sustainable growth of agriculture for self-reliant India. Dr. Shivakumar S. Harati is an associate professor at the Department of Swasthabhrita, All India Institute of Ayurveda, New Delhi. He has an academic experience of about 20 years and has many peer-reviewed publications in the field of Ayurveda. Sir, over to you.
Ladies and gentlemen, a very good afternoon. Welcome to today's panel discussion on organic foods. Organic agriculture is a production system that sustains the health of soils, ecosystems, and people. It relies on ecological processes, biodiversity, and cycles adapted to local conditions, rather than the use of inputs with adverse effects. Organic products are grown under a system of agriculture without the use of chemical fertilizers and pesticides, with an environmentally and socially responsible approach. According to the latest International Federation of Organic Agricultural Movements survey on organic regulations, 72 countries had fully implemented organic regulations as of 2020. Apart from that, some countries are in the process of framing organic regulations. Some are in the process of amendment of their existing regulations. So far as India is concerned, India is practicing organic agriculture from ancient times. To provide a focused and well-directed development of organic agriculture and quality products, the Ministry of Commerce and Industry, Government of India, implemented the National Program on Organic Production, notified in 2001 under the Foreign Trade and Development Act, FTDR Act, for exports. Further, the Participatory Guarantee System, PGS, is implemented by the Ministry of Agriculture and Farmers' Welfare for organic food products. The Food Safety and Standards Organic Food Regulations 2017 were notified in December 2017 and enforced from July 2018. These regulations require organic food to comply with the provisions of National Program for Organic Production or the Participatory Guarantee System in the domestic market. For export of organic products from India and import of organic products into India, the applicable standard is the National Program for Organic Production, the NPOP. Friends, the panelists who have joined us today are experts in the field of organic regulators, of organic system in their countries, and policy makers. Their knowledge and expertise will give us an insight on the organic certification system followed in different countries, with the common goal of achieving a safer and healthy ecosystem. With this short introduction, we will begin the panel discussion. I would request all the esteemed panelists to be a bit brief in their responses because of the constraint of time. And without any further ado, my first question is to Ms. Dechin Choki from Bhutan. My question is, how is the certification of organic foods carried out in Bhutan? Whether it is based on self-certification by farmer groups, or is it a third-party certification?
Thank you, Chair, for the question. At the outset, I would like to convey the best wishes of the Royal Government of Bhutan, and in particular the Bhutan Food and Drug Authority, to the Food Safety and Standards Authority of India, and all the participants who are present here for this very important occasion. To straight away respond to the question that has been put forward, I would like to first provide a background of organic agriculture in Bhutan. As Chair has mentioned, just like India has been practicing organic agriculture since ancient times, Bhutan too has been practicing organic agriculture since time immemorial. And it was only in the mid-1980s that chemical fertilizers and pesticides have been introduced into the country. And at the moment, the country does not have a chemical fertilizer processing plant, and that necessitates us to import chemical fertilizers and pesticides. And the government strongly regulates the import of such agricultural inputs, where the National Plant Protection Center regulates, and the sale of pesticides and chemical fertilizers is allowed to be done only by the approved distributors in the country. So that puts Bhutan in a situation where the use of chemical fertilizers and pesticides are highly regulated. And then because to keep up with the changing requirements of the changing times, the concept of organic agriculture was actually, the formal concept was introduced sometime between 2004 and 2005, where the Department of Agriculture, in particular the National Center for Organic Agriculture, was established with the mandate to promote organic agriculture and to promote organic agriculture, and particularly on the training of farmers to keep up with the requirements of the international market. So coming to the certification aspect, in Bhutan, the National Center for Organic Agriculture under the Department of Agriculture, Ministry of Agriculture and Forest, they are the promoter of the organic agriculture, and they are also the standard owner. And under this overall certification framework, the Bhutan Organic Guarantee System has provisions for participatory guarantee system, wherein the farmers do the peer assessment of their farms based on mutual trust and cooperation. And this in practical has not been happening, although there is an existing provision. And then there is something called as the Local Organic Assurance System. So that is done by the National Center. It's implemented by the National Center for Organic Agriculture. And the organization that I work for, the Bhutan Food and Drug Authority, is responsible for the certification of food and agriculture products. I would like to inform that at the moment, we do not, unlike in other countries, we do not have a private certification body that's operating in Bhutan. So the government office has been given the mandate to do the certification of food and agricultural products. So the organization that I work for comes in as a third-party certification body, an independent body that provides certification services for food and agriculture products. And the salient feature of this certification context in Bhutan is that not only is it done by a government agency, but also the farmers, the clients who come availing our certification services, the services are provided on gratis, so the government doesn't charge. That is the situation, Chair. Thank you so much.
Thank you, ma'am, for sharing your insights on the certification system being followed in Bhutan. My next question is to Dr. Suresh Khurana. As you've been associated with FSSAI in the past and were involved in the introduction of the food safety standards, organic food regulations, what in your view is the significance of regulatory system in organic food sector, and how is the FSSAI regulating the production and sale of organic foods in India?
Thank you, sir, for the question. So, as we know, sir, organic food products are niche products and they are marketed at a premium. So, prior to this regulation, there were many products in the market which claimed to be of organic, gone through organic process, but they were not, or they were. So there was no difference between genuine and the non-genuine products in the market. And there was also a request from the APIDA that because of trade negotiations with other countries, they needed a domestic regulation, so that they are at the level playing field. So taking that into consideration, and there was a very, very big problem in the Food Safety and Standards Act, which said that section 18(3), which said that the provisions of the act will not apply to farmers or fishermen or the farming operations. So how to bring in organic food under the ambit of the Food Safety and Standards Act? So the solution was that we had two robust certification systems in our country, which was National Program for Organic Production implemented by APIDA, and second was the PGS India, which was implemented by the National Centers for Organic Farming in the Ministry of Agriculture. So both these systems were adopted to be a certification system, after which, when they are certified, the product, when it comes to the market, the FSSAI takes over. After it leaves the farmer, the FSSAI takes over the system. So when we say of the significance of that, so it's a win-win situation for the farmer and the consumer. Farmer is getting a genuine price, who is genuine farmer, he is producing a organic produce, getting it certified, he is spending some money, he is doing efforts, and he is getting a proper price commensurate to the quality he is producing. And it's also for a consumer, he is getting a genuine product. So it was a win-win situation for both of them. And as you said, sir, the second part of your question, how FSSAI is regulating it. So FSSAI has a system that every food business operator has either to take a registration or a license from the Food Safety and Standards Authority of India. So whether it is a registration or a license, he has to get the organic endorsed into his registration certificate or a license. And what is the requirement? Only requirement more than the conventional is that he has to add the certificate of PGS India or NPOP, that he is, the scope of that for that product he is registered with that agency. So if he gives that, it is an online system, it's a portal, he can do that online and get it endorsed. So there is no problem in getting the organic as far as the food business operator is concerned. Now coming to the enforcement part, it is, as you know, sir, food is a state, it's on the concurrent list, it's covered under state and central also. But generally it is by the food safety commissioners in the state who do. They keep on doing surveillance of these products for the labeling and that Jaivik Bharat logo which FSSAI has notified in addition to the NPOP or PGS logo. So that they keep on doing the surveillance and the enforcement is being done. Thank you, sir.
Thank you for your succinct remarks. My next question is to Ms. Carla Menezes. Do you have any organic certification system or regulation in Mozambique?
First of all, I would like to get some permission of our chairperson to express my deeply gratitude for the invitation as a delegate and a speaker. Go direct to the question. Mozambique doesn't have the regulation approved, but still get it. We think end of this year or next year on the first semester. Give me permission, I can give some background about this regulation. We started to design this in 2021, first month of this. We submitted, after design, we submitted to the legal officer on the Agriculture and Rural Development Minister for technical comments. We received back on the same year. From January last year, we improved this documentation and resubmitted. From August to December 2022, we shared this document for the public and private companies. We also make forums disseminated in all country just to get the comments and improve this document. So after received the comments that we give a deadline in January for this year, we concluded that we still need to improve this document, and we still need contract some expertise in the international expertise to improve the document and submit for approval and under level. But we have a system, certificate system that we use it, the tools from other countries, because we are a big export of organic food. So, thank you very much.
Very thank you for explaining the current process which is taking place for the formulation and finalization of the regulations in Mozambique. My next question is to Ms. Moate Mulenga from Canada. What is the regulatory regime for organic foods in Canada?
Thank you. Canada has regulations around the organic foods, and they're enshrined in the Safe Food for Canadian Regulations, Part 13. So in Canada, the regulation or the implementation of organic requirements, it's a third-party certification regime. We have the Canada Organic Regime, and which is managed by the Canadian Food Inspection Agency. That's the agency I work for, or CFIA. So CFIA is responsible for certifying, for going into agreement with conformity verification bodies. At the moment, we have 2 conformity verification bodies, 2 in Canada, 1 in the US. So the conformity verification bodies can only be in agreement with the CFIA if they meet the ISO 17011. So CFIA will have this agreement with the conformity verification bodies, CVB, and the agreement will be for 5 years. In the 5 years, they'll monitor how the CVBs are performing their duties, and then after 5 years, they can renew. If they meet the requirements, they can renew the agreement. So the CVB, in turn, will recommend to the CFIA certification bodies, or CB. So the certification bodies, in addition to meeting the requirements in the Safe Food for Canadian Regulations, they also have to meet the requirements of the ISO 17065. So these certification bodies, when recommended to the CFIA, after the CVB verification body is happy with the certification body, they'll recommend the certification body to the CFIA. Then the CFIA, if satisfied, they'll accredit the certification body. At the moment, there are 36 accredited certification bodies operating in different countries. 7 are actually operating here in India. Then at the same time, then the certification body, CB, will certify the products that from the producers. So the producers will sign up with a certification body, and for those producers, if the product meet the requirements of the regulations, they meet the requirements of the standards. Or for the Canadian standards, we have 3 Canadian organic standards. The general standard 32310, which will look after the general principles and management standards, and then 32.311 will look after the substances permitted to be used in organic. And then the new one that only came up in 2021, 32.312, it's on aquaculture. Then at the same time, though we have these certification bodies, Canada, under the Safe Food for Canadian Regulations, can also go into equivalency with trading partners. At the moment, we have equivalency with 8 trading partners, and when the trading partners that have equivalency with Canada, with the CFIA, they can certify the product, and that product can be sold in Canada as organic. So what does that mean? For Canada for product to be sold in Canada as organic and have the symbol, like the logo for Canada Organic, they have to meet the requirements, and one of the requirements, they have to be not less than 95% organic for them to use the label. So basically, it's a shared responsibility. And it's not mandatory to use, but as it was earlier mentioned, when it's used, it's higher quality, but they have to meet the requirements. And this organic standards, or the Canada organic regime under the SFCR, only applies to import, export, and trade interprovincial, meaning within Canada from one province to another, or if they are traded intra-provincially and they want to use the Canada organic logo, then they have to meet all the standards and the requirements. Thank you.
Thank you, Madam, for your very brief but comprehensive explanation to the regulatory regime of Canada on organics. My next question is to Dr. Ragnesh Sharma. What is the certification mechanism followed in the participatory guarantee system?
Thank you, sir, and thank you, FSSAI, for inviting me and giving me an opportunity to be here in this panel. So, sir, as you know, sir, this third-party certification is there under APEDA and under your good self. So, as an alternate to this third-party certification system, because since this certification system seems to be a bit lengthy, cumbersome, documentation is very high. So, keeping in view the requirements of small and marginal farmers in our country, Ministry of Agriculture under our National Center for Organic and Natural Farming, Ghaziabad, established a PGS India Secretariat. This is a dedicated PGS India Secretariat which looks after the participatory guarantee system of certification in the country for taking up domestic trading by the small and marginal farmers, even at local level and also in cities and in the entire country. So this system works basically on the, we can say, model of IFOM, that is International Federation for Organic Agriculture Movements. The system is it takes the principles of trust, transparency, and sharing, mutual trust. So these are the principles of this PGS India model. And here the farmers, they in collectives, they inspect, assess, verify each other practices based on the PGS India standards and guidelines. Basically, the PGS India standards are largely, sir, the national standards for organic production, similar kind of standards, slightly modified for the ease of small and marginal farmers in the country. It is also a low-cost certification system, keeping in view the demand of the small and marginal farmers. They are not into the main line of organic farming, so they would like to take up this certification system. Government of India has incentivized this PGS India certification through Paramparagat Krishi Vikas Yojana, where government funds it to the clusters, to the group of clusters, and this way the farmers, they get encouragement and they are being mobilized, collectivized, and they come out for this certification. Since the certification is basically based on the peer inspection, peer reviews, so to handhold the farmers, because farmers, the challenge is that the farmers are small and marginal, sometimes not educated, they don't understand the standards and the certification system. So the facilitators are there, which we called as regional councils, just like the certification bodies. They are called as regional councils in our country. So we have authorized, sir, under our PGS India Secretariat through National Executive Committee, 74 regional councils for the purpose of helping the farmers, small and marginal farmers, to take up this certification system. This is a self kind of certification system, but the facilitators are the regional councils. These regional councils are basically assessed for their competence, and they are largely, sir, certification bodies also under APEDA, and some are the government, Department of Agriculture, Atma agencies, bodies, KVKs also. So we are trying to scale it up, means the regional councils need to be, to scale up our this PGS India certification system. We are trying to authorize more and more regional councils at local level, at district level, so as to scale up this certification system in a big way in our country. The second important aspect which I want to highlight here is under this PGS India certification, that this initiative is the largest initiative in the world itself, we can say. If we compare the world, under IFOM, this PGS, there are 77 countries which have adopted this PGS India certification, but their model is lacking this institutional structure which we have built in our built up in our country. So institutional structure means that regional councils are the facilitators. The Government of India Department of Agriculture is the apex body for taking the decision on defining the standards, modifying it, and including other scopes, adding other scopes of certification. But in other countries, it is farmer-led completely, and it is left to the farmers to decide on each and everything. But here in our country, we have added some kind of institutional structure to this PGS model, and that's why it is unique in our country. As on date, we have about 14 lakh farmers in our country who are practicing this organic farming, and they are getting this PGS India certification also. They are certified. And about 10 lakh hectare area has been covered as on date in our country. And if we compare it with the world, the entire world, if we see the entire world PGS initiative, they have about 10 lakh 70,000 hectare area covered, and about 12 lakh farmers they have. So comparing with entire world, we can say our thing stands on a high side. So this is what is from my side. Thank you.
Thank you. So thank you, Dr. Gagnesh, for your comprehensive explanation of the structure, coverage, and the processes related to the PGS system being followed in India. My next question is to Dr. Shiv Kumar S. Harthi. What kind of potential challenges are you envisaging in promoting consumption and trade of organic Ayurvedic foods, particularly in areas of certification and regulatory approvals?
Thank you, sir. I would like to thank FSSAI for giving an opportunity and for representing our Ministry of Ayush. To answer your question, sir, every country or every region has got their own regulation. They got their own regulations and certifications, which they add complexity and cost to the trade process. So every country has their, as I said, every country has their own regulations, including the labeling, standards for nutraceutical products, safety assessments, and claim substantiation. Ensuring consistent quality and safety of these Ayurveda nutraceuticals is very essential for export purposes. So when a Ayurveda nutraceutical is exported outside, it is exported in the form of nutraceutical rather than Ayurveda medicines. So FSSAI recently, in consultation with Ministry of Ayush, has come up with a new regulations called as an Ayurveda regulations. It's an official gadget which was released last year. So these regulations make it mandatory for all the food prepared and following the ingredients and processes prescribed in the Ayurveda text to be considered as Ayurveda Ahara. So there are various schedules in the regulations A, B, C, D. So the first schedule will describes about the various books that are Ayurveda books that have been included. So any recipes from this Ayurveda classical textbooks can be brought to the market, and there is a huge scope of this these Ayurveda Ahara nutraceutical products in the market globally, especially after the onset of this pandemic. So one thing is very important is that the consistent quality of safety of these Ayurveda nutraceuticals, and all these things are considered in the new Ayurveda regulations. So any product which comes up with the Ayurveda regulations, I will be having a separate logo of Ayurveda Ahar. And we are confident that from the Minister of Ayush, we are confident that these regulations would strengthen Indian positioning as a custodian of Ayush systems too. Thank you, sir.
Very thank you to you for explaining the system of certification of Ayurveda products and the potential challenges and the aspects related to that. My next question is to Mr. Mariano from Argentina. Whether you have any certification system or specific regulation for organic food products in Argentina?
Thank you, Chair. First, namaste, suprabhat, good morning to all. I want to thank FSSAI for the invitation and also congratulate the Minister of sorry, I was participating in another event yesterday. Minister of Health, and congratulate for organizing this in coordination with the Minister of Animal Husbandry and Minister of Agriculture. All of us know how important it is to be these three ministries coordinated when they are working on the regulations on foods. To start with, I will give you a brief why organic production is so important in Argentina. Mainly because it's a need for the country. We export our most of our organic products are designated for export. It's also a federal production. In the entire country, we have organic production, very diversified in different type of crops, livestock, fruits and vegetables. And also is integrated production systems that have been a solution for small farmers, particularly because it helps and push to these farmers to acquire and adopt standards and become more efficient. Apart from the social and economic benefits, also the organic production in Argentina have a lot of positive impact in the reconstruction of the systems. I am talking about the environmental care and putting a lot of attention on the soil, water and air. The agriculture in Argentina we push and work hard to have a sustainable agriculture in Argentina. In that sense, also the organic food systems. As agronomist, I know the importance of biodiversity in the environment, how this contributes. As a fourth generation of farmer, I know the importance why the agriculture and food production must be profitable. As a civil service, I must work to develop and implement a sustainable agriculture system based in science and facts. We are aware about the benefit and also the challenges of organic agriculture. Therefore, in 1999, Argentina created the law for organic production to promote and regulate the organic production in Argentina. After that, the National Advisory Board of Organic was created with a private organization and public organization under the coordination of the Ministry of Agriculture, Livestock and Fishery. In 2012, Argentina created the first organic label stamp for organic products in Argentina, call it Orgánico Argentino. The National Food Safety of Quality Service, SENASA, is the competent authority to regulate. It is a third-party certification, and 4 private companies are authorized to certify with Orgánico Argentina. In 2018, Argentina created the National Strategy Plan for Organic 2030. This was created and it is coordinated by the National Advisory Board of the Organic. As I said, it's a public and private organization, and this was also part of the integrated plan for agriculture and food strategy 2011 and 2020.
So, very thank you for your explanation of the system being followed in Argentina. Before I move on to the next question, general information that due to the paucity of time, we will just have one round of questions. So after the question to Dr. A.K. Yadav, I will be asking all the esteemed panelists to share one key takeaway or food for thought which they would like to express at the conclusion of this panel discussion, like it was done in the last session. So firstly, before that, my question to Dr. A.K. Yadav, that what are the policy initiatives taken by Ministry of Agriculture to promote organic farming in India?
Thank you very much, sir. First, my thanks to the FSSAI for organizing such a wonderful event. And then to the question, Government of India is promoting organic farming since 2004. And the first policy document which was prepared at that time in 2005, it aimed to convert almost about 10% of the total agricultural land of the country to organic. Although no time frame was kept, because we have to keep a balance between the food security and the transition, and to take care of all the issues which do not affect the productivity. So a slow, consistent and steady approach was adopted, and to take the things to the people, two institutional interventions were done at that time. One was the setting up of National Center for Organic Farming, which now Dr. Gagnesh Sharma is representing. Another one was the All India Network Project on Organic Farming Research. So both the things started simultaneously, and over the years, both the institutions have contributed wonderfully. One of the major contribution, if I can say, has come out of this research part. After 15 years of the research, now it is proven beyond doubt that organic systems can yield the same. Only thing is you have to build the soil over a period of time, maybe 3 years, and you'll have to adopt the appropriate package of practices. And these research have also developed many, many models of integrated organic farming systems, where you can obtain optimum productivity without the need of any external inputs. Beside that, NCF has done a lot of extension work. And in this one, how we started from 2004 with just 42,000 hectare area in the country. Now I think we have almost about more than 6 million hectare area. India is the now, in terms of third party area, if we consider, we are the 4th largest. Or if we include the PGS certified area also, then we are the 3rd largest country in the world. And we have almost 6% of our agricultural land under organic, compared to the 1.6% of the world average. If we see how the market has grown, yes, there has been a phenomenal growth. As per some estimates and some extrapolations, we have arrived at, as on today, the market exists at about 15,000 crore rupees, and export account for almost 50% out of that, maybe somewhere about 7,000 to 7,050 crores or like that. 2, 3 things I wanted to specify here. There was a growth. There were a lot of spurt of the organic products into the market. Then the regulations came into the place. Dr. Khurana was one of the key players at that time who helped to frame the documents, to frame the regulation, and also to assist to implement it. Now we have got a good regulation. And world over also a lot of regulation. Every country is coming up their own regulation. Now what is happening? With every country coming up with their own regulations, it is requiring the multiplicity of the certification systems, multiple requirements for the operators and the farmers to obtain the costly certifications. So we need some solution, some deliberation on this. Can't we have a uniform standards can't we have the harmonized methodologies of certification system so that the domestic and the international trade can happen smoothly. Another thing over the years, what has happened especially during the regulation part is, organic certification systems when introduced were process verification based. And organic farming was promoted as a based upon the 4 principles of health, care, ecology and fairness. But over the years, in need of giving more and more tooth to the regulatory system, the present day organic agriculture is shifting from principles to the tests. Processes are being kept beside and everybody is insisting too much of the tests. And that too, when everybody knows that there is no test in the world which can determine whether a product is grown organically or not. It's only the pesticide residue we are referring. And laboratories, we also need to strengthen the laboratories, results of the laboratories, whether Indian or international. I have got very great experiences about them. They vary from laboratory to laboratory. You send one sample to 3 laboratories and you will get 3 results. Now, who suffers after all? It's ultimately the producer and the market, and the trade suffers. So we have to work in this direction. I think Government of India from Ministry of Agriculture side is taking continuous efforts. We are operating 2 dedicated schemes for promotion of organic farming. One we call it as a Paramparagat Krishi Vikas Yojana. It is applicable throughout the country except the northeastern states. And another is the mission value chain. Now, initially our focus was mainly on the bringing the area under organic and facilitating the transformation. Now the Ministry of Agriculture's focus has been shifted from transformation to value addition and creating a from farm to fork value chain. And on an experimental basis, we have already launched a mission value chain in the northeast, which provides an entire end-to-end value chain. Thank you very much, sir.
Thank you, Dr. Yadav, for your thought-provoking insights, both on the initiatives by the Ministry of Agriculture to promote organic farming and what can be done to ease out the international trade in organic products. So, like I said, that due to the constraint of time, we won't go to the next round of questions, but I would request one by one from the panelists to give us one key takeaway or food for thought which they would like to share with the audience as a key takeaway from this panel discussion. So in the same order, I would request Ms. Dechin Choki to share her insights.
Thank you. From my side, the key take-home message would be like, if countries are to institute a certification system for organic and other food products, I would say, like, as much as possible, please try to align the as per the requirements of the international best practice of ISO 17065 standard. For us, like, it was not a piece of cake in the beginning, but ultimately, sooner or later, we reap the benefits in terms of facilitating trade of organic foods. Thank you.
Thank you. Dr. Suresh Khurana.
There is a myth amongst consumers that the organic food in the market is not genuinely organic. It's a conventional product and they don't buy it. So my suggestion or my recommendation is that look for the Jaivik Bharat logo and go for it.
Thank you. Thank you. Ms. Carla.
Briefly, my recommendation is get uniform standardization, because the countries like us, we have to to see each standardization when we want to export. Go with one family for the world, because if you want organic food, should be as a health. It's a health for everybody, because the human is one. So in Europe we have one standard, Asia another. So go together on with same family. Thank you.
Thank you. Ms. Mawate.
Canada's organic regime, or Canada's regulation of organics, is very transparent. I encourage you to go to inspection.gc.ca, tons and tons of information on how Canada regulates and how to be a CVB, how to be a CB. So all the information is available online because we're very transparent. Thank you.
Thank you. Dr. Gagnesh Sharma.
Sir, the challenge is to provide good price to the farmer for their organic certified produce, so that they encourage to produce more and to scale up, so that we get sufficient produce in our country, and it should be affordable to the consumer, and it should be available everywhere. So this is the challenge, and we are trying hard to scale it up, sir. And we need to collaborate with other agencies for ensuring the quality, like FSSAI has to play an important role. They do the surveys for conducting the quality checks and all. So in collaboration, we have to take up the networking with some of the organizations in our country, as well as we have to explore the harmonization, as said by Dr. A.K. Yadav, sir. Third party, it's already there, but we have to take it up for PGS system of certification also. Harmonization with some of the countries like Philippines and Indonesia, they have started this thing. So we have to, sir, this is the takeaway, though it's a lengthy thing, not in single line. I am sorry for that, sir. Thank you.
Thank you. Dr. Shiv Kumar.
Sir, thank you. Being a representative of Indian traditional medicine Ayurveda, I'd like to say that Ayurveda has got a separate vertical called as an Vriksha Ayurveda, a form of ancient Ayurveda organic farming practices, which have shown, where studies have shown that yield and both the quality of the plants have been increased. So by this way we can solve two issues. One, even the food security, and the second is even the quality of the crops can be improved. Thank you.
Thank you. Mr. Mariano.
Yeah, thank you, Chair. Just to add what my colleague from Bhutan said, I think my advice will be to those countries that are working on the control system, on definition of agriculture. They should do it in the international standard, and also base it in science, facts, and information.
Thank you. Dr. A.K. Yadav.
Sir, my 3 points: harmonization internationally, modifying the certification from the present methodology to a more principle-based and process-based, not the test-based. And for the future, we need investment in institutions and research. Thank you.
So I would just like to make a short concluding remarks. I would like to thank all the panelists for their enriching insights. We had a brief but a very enriching discussion on the theme of organics, which definitely will benefit the future organic movements in the respective countries by aligning the possible aligning of the global best practices, and also bilateral negotiations for organic products. Since there is a huge demand for quality organic products, it is imperative to say that stringent monitoring of the value chain and adherence to regulatory mechanism will promote opportunities for export across all destinations. Efficient regulatory mechanism will be the key factor for achieving the goal of healthy and a safe planet. Thank you, everyone. Thank you.
Wonderful.
Thank you so much, sir. Thank you so much, ma'am, for such a wonderful, thought-provoking discussion. I would like to request our moderator, Shri Abhishek Dev, sir, to kindly felicitate our speakers. Ms. Diken Choki. Mr. Mariano Behiren. Ms. Carla Menzies. Dr. A.K. Yadav. Ms. Mawate Mulenge. Dr. S.C. Khurana. Dr. Gagnesh Sharma. And Dr. Shivakumar Harati.
Thanks, ma'am.
Thank you so much, sir. Dr. Shivakumar Harati. Now I'd like to invite Ms. Isabel Laberge, Senior Director and Chief of Canadian Food Inspection Agency, to kindly felicitate our moderator, Shri Abhishek Dev. Thank you so much. So it's time for the lunch break. I know everybody must be having a lot of questions in their head. So I will request to have these sessions to be done during the lunch or the tea break. We will reconvene promptly at 14:30 hours after the lunch for the next session. Thank you so much.
बहुत चीज़ों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस। तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east, and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा. अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन.
India has a staggering 70-100,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है? दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही। खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east, and all the sizzles and drizzles in between,
Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 70 to 100,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा, और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between,
Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 70-100,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, नहीं कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस F और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam. Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the
salmonella, which are present in the foods of animal origin. So while it's a fact that in certain types of foods of animal origin, for example, milk, animal acts as a biological filter. But this is only a possibility which applies only to a limited extent. If the contaminants are present in that food of animal origin or in the feed which is given to the food producing animals beyond a certain threshold, then the contaminant is bound to be getting into the food chain. Therefore, it is very important that we discuss and deliberate on this issue to get better insights of the critical aspects of food safety which are connected with Feed and Food Safety Connect. So this technical session that we have now is, it features an address for context setting, a keynote address, and a panel discussion. To begin with, I would like to request Dr. Manekshaw, Chairman NDDB, and Professor Dr. Andreas Hensel, BFR, President BFR, to come onto the dais, please. You're welcome, sir, please. So Dr. Manekshaw is the Chairman of National Dairy Development Board. He has an illustrious and multifaceted career of more than 37 years in NDDB. Dr. Shah has made immense contributions in the diverse fields of R&D, product and process development, project appraisal and finance, cooperative services, project management, and strategic decision making. A warm welcome to him. Professor Dr. Andreas Hensel has been the president of German Federal Institute of Risk Assessment, Germany, since 2003. He has been the advisor to the Federal Minister of Food and Agriculture, that is BMEL, and the Federal Ministry for Environment, Nature Conservation, Nuclear Safety and Consumer Protection, which is BMUV, and the relevant German ministries in the areas of food, feed, non-food, and veterinary public health. He is an active teacher, professor at several universities, and the German member of advisory board of EFSA. Welcome, sir. May I now request Dr. Shah to give his address for setting the context for this technical session, which starts now. Over to you, sir, please. That's it.
Madam Alka Upadhyay ji, Secretary DHD, Government of India, Professor Andreas Hensel, President BFR Germany, all the distinguished panelists which will follow, food regulators, industry stalwarts, international and national experts, all the stakeholders, invited guests, ladies and gentlemen. I'm really delighted to be part of the Global Food Regulation Summit 23 of FSSAI. I thank the FSSAI for inviting me for setting the context for session on impact of animal feed on food safety and human health. I would also like to compliment all the food regulators from across the globe, including the G20 countries and the stakeholders who have contributed and continue to contribute in strengthening food safety systems, the food regulatory framework across the food value chain, which are of great contemporary relevance in providing safe and nutritious animal origin foods and also foods to the consumers. As we all know, food safety is now universally recognized as a public health priority. And animal feed is an integral part of the food chain. And thus, I think the quality of animal feed must be considered while ensuring the quality of integrated food systems. World over, if you take meat, eggs, or milk from animal origin, they offer crucial sources of much needed nutrients. And these nutrients are vital during the key life stages. We have seen how important they are in pregnancy, in childhood, in adolescence, and also in the old age. So milk and dairy consumption during pregnancy, for example, promotes healthy weight of infants at the birth. We also know that consumption of milk and dairy products by the school-age children and the adolescents increases the height and also reduces the obesity. In adults, if you see milk and also yogurt or the fermented milk products, I think consumption will reduce the risk of hypertension and also maybe type 2 diabetes. The world population is now expected to reach almost 9 billion in 2050, and feeding this population, increasing population, I would say, will require raising overall food production, and in that the developing countries would face more and more pressure. As the livestock sector gears up to meet this objective, I think it has to address a range of challenges also. And this includes issues related to the environment. We have seen the greenhouse gas emissions or sustainable use of water and land. So they are all important issues which need to be addressed going forwards. We also have the challenges of herd management. For example, the low productivity of animal, poor animal welfare, and also the associated issues regard to animal health like antimicrobial resistance, which we all are facing. So both in human and livestock, I think we have seen the related issues, which is also a challenge like zoonotic issues or foodborne diseases. As Dr. Bakshi told, even the various types of contaminants find their way to human food through animal feed. And the best example is the aflatoxin. The contamination of aflatoxin in the animal feeds and the transfer of the same into the milk is one of the major concerns related to the food safety. And as we know, the feed used in the animal feed industry, they are the most susceptible to the aflatoxin, as whether it is maize or cottonseed or groundnut cake or the rice bran. They are all feeds which are directly fed to the animals, or we use them on a large scale in the cattle feed manufacturing industry, and they all are very, very susceptible for the aflatoxin infections. The aflatoxin also actually affect the growth or even cause hepatic toxicity in the animals. We also have to deal with the heavy metals such as cadmium, arsenic, mercury, lead. These are all contaminants which may find their way in the animal source foods. Another important family of contaminant is the pesticides residue, which is discussed quite often with regard to the food safety, and the presence of pesticides in the environment also actually result in contaminating the animal feed, as the crop residues or the grains, we all use them as the animal feed. So it's clear that the contaminated animal products can cause the serious food safety issues for us. Further, the indiscriminate use of veterinary drugs, I think that is one more family which has a very potential risk for food safety, and therefore there should be used according to the good practices recommended. The veterinary drug residues may be found in food products when they are used as growth promoter, for example, or we have seen its use in the poultry feed. So it is important to follow the code of recommendations when feed or food producing animal they are produced. Examples are medicated feeds or the antibiotic growth promoters, etc. So it's also important to restrict the illegal use of drugs in animal feeds, which may result in unsafe residues in the animal source foods. We have also seen the infections of various bacteria or pathogenic bacteria, for example, like Salmonella or Brucella infections in the animal food. And it has a very, very wide implications on the human health also. It's also worth mentioning that the international incidences which triggered some stringent regulatory measures, like incidence of bovine spongiform encephalopathy in UK. It promoted the regulatory authorities to change the animal feed laws. Similar incidents occurred in the case of poultry meat also worldwide, where extensive use of antibiotics as the growth promoter was actually unregulated, and which caused the public health hazards. And therefore, I think the European Union banned the use of antibiotics as growth promoters in food animal farming in 2006. So these adverse impacts of animal feeds on the human health can be mitigated only through food safety risk assessment and also the food safety management, and also the One Health approach, which now both the human and animal industry is talking about. Widespread testing for potential contaminants or tracing of these contaminants, training and capacity building of the field workforce which is involved. I think these are some of the other areas which would help us a lot in this direction. Therefore, I think it is desirable to initiate some measures to ensure good quality feed and regulation of feed and food for quality, not only for the animal health, but also for the welfare and productivity of animal, so that human health point of view is also addressed. Recently, I think in 2019, FSSAI has already issued guidelines requiring commercial feeds and the feed material intended for the food producing animals in India. They need to be complied with the relevant BIS standards. And it can be manufactured and sold only with the BIS certification. So this move can be considered as a milestone in improving the quality of animal feeds which are being manufactured in our country. The another example which we may all have to look for is the use of toxin binders in animal feeding. It has a advantage of reducing the aflatoxin M1 in milk to a great extent. And I'm happy to share that NDDB has recently developed an economical and effective toxin binder for direct supplementation to the animal. I would also like to throw some light on the reduction of antimicrobial residues in milk by using the ethanoveterinary medicines. NDDB has been successfully evaluating and adopting the use of EVM for various ailments, including mastitis and whether other ailments like diarrhea or pyrexia. I also understand the poultry sector also has started using prebiotics and probiotics as a replacement for the antimicrobial growth promoters. So these are, I think, some of the new areas which are coming up. I would conclude by saying that food safety systems also need to be strengthened through the design of appropriate policy regulations, required infrastructure, both the material and manpower needs to be put in place for ensuring effective implementation of the policies, and collaboration among scientists and various policymakers of various countries, I think, is needed for effectively managing such challenges. We have in our mind, I think, the food regulators, both international and national experts, policy makers, as well as stakeholders from various countries who will deliberate further on this today. And I am confident that these deliberations will offer very useful insights for enabling a cohesive network on food safety and regulatory aspects, and also for effectively understanding the compliances which are required, which ultimately help improve the quality of animal feed and thereby also the food safety for the consumers. Thank you very much.
Thank you, Dr. Shah, for setting the context and also highlighting diverse food safety issues that are related to feed and the mitigation approaches for these. Thank you very much. Now it's over to Professor Hensel to deliver the keynote address to the participants. Thank you.
Thank you, Chair. Ladies and gentlemen, dear colleagues, dear friends. When I told my secretary that I will go to India, they said, don't forget your umbrella. And I took a very big one. However, I haven't seen a raindrop till today, although people told me that it's a rainy season. It will start when I leave, I'm sure. Just to tell you what you're confronted with, I will give you an inside view on tracing tools for food and feed, and it's the outcome of the work of the BFR. The German Federal Risk Assessment Institute is the world's largest pure risk assessment body, and we are serving to the German government as well to the European community in the context with all our colleagues from Europe. So we are a scientific institution, including risk communication, for example. We do research, we serve for national reference laboratories. So today I want to focus on feed. I think we have to keep in mind that it's a global market, definitely. One result is that consistently we have new types of feed and related products. Just think about insects as a source of protein for feed. The second is, I just look for the import rates for Germany from India, and you will not believe it, but your frying fat, which you are selling, is going to feed as a feed source to Germany when it's raffinated. In addition, biogas, for example, gains enormously in importance as a source of renewable energy, but this is not per se a problem, but it may become one if the byproduct of biogas production, namely a slurry, ends up as either fertilizer or as feed in animal production. So in Europe, we are well aware that you produce a lot of biogas in the traditional so-called gas-producing GOBA units. However, we have to carefully analyze what ends up in the feed and thus in the animals. India is the world's largest producer of goat milk. In addition, India has a fast-growing poultry industry. But if you look to the world level, the global level, you will see that we have 1.5 billion pieces of cattle in the world, 1 billion pigs, 26 billion chicken, 400 million geese, 1.3 billion sheep. These are data from FAO. And all these animals have to be fed. So the worldwide animal feed production has reached 1 billion tons per year, which is with an annual growth rate of 2%. And it will grow because the consumption of meat is increasing worldwide. So there must be feed, to feed all the animals. And that will also increase our problems. By the way, global aquaculture has grown rapidly over the past 30 years than any other part of the animal protein supply chain, and it is indisputable the segment of world feed production with the largest annual growth rate. And against this background, let us come to important topic of tracing. And I will start now my presentation. A minute ago, I mentioned that we have to be more holistic, and only thinking about tracing in context of food simply miss the point. Feed must be included. Next slide, please. Probably you're not aware that Germans not only build cars. We are quite good in cars, and we also produce a lot of other technical machines. However, we are the third largest importer of food and foodstuff in the world, and the fourth largest exporter. So this may be not in your mind, but this is also gives us a responsibility also to improve new methodologies. And one is traceability. Traceability is a backbone of food safety. If you can remove something from the market, you can find it. People trust the system. It is worldwide a problem, but I'm old enough to say that the first event, which was really in the press, was in 1999 in Belgium, where they found transfer oil in feed, in chicken feed, and thus an elevated concentration of dioxin in eggs. And hence, they have started at the EU level to bring up new systematic laws to avoid the problems in tracing. Next slide, please. The second aspect, which has already mentioned by our chair, is the problem of aflatoxin. So after 20 years, we can say the system is in place and it's working. It's good that we find aflatoxin in milk. You will wonder why it is like this. We had one case in 2013 where in the self-control of a dairy farm, they found an elevated level of aflatoxin. So the tracing was about 8,000 farms which got the feed, and we found out it was a corn from Serbia. So, and that could be removed from the market. So you can see if this feed business is in place and all the operators are aware of the problem, you can solve these problems with tracing. Next slide, please. So traceability has some limitations because, yes, you can have delivery notes, so that would be idle situation electronically, that you know what you get and what you give away. However, the producers don't follow each product. So it's, especially when you look, for example, for eggs, we are producing 19 billion eggs on the global level, and you can see that this is the end of traceability. You cannot find a single egg, but what you can do is to fight against the complexity of the system. Next slide, please. So this is what we call confusogram, but I want to show it to you that you can fight against this complexity. This picture, you will not believe this, is uncomplex, because this is a picture, an electronical digital picture of the outbreak of fipronil in eggs in Europe. It's a biocide which has been found illegally in eggs, and here you can see the source and then the distribution chains, including tracing forward and tracing backwards. And this is a system which we have to develop at the BFR. You can use it for all other chemical contaminants, but also for outbreaks in zoonotic diseases. And it has been now spread all over Europe by EFSA, and we also are proud to say that we also collaborate with our US-American colleagues, because this system enables you to bring order into a complex system. And as you know, German like rules. Yeah? So we also have implemented this kind of tracing tools, which should be, and they are, open to the public, so you can find it on our website, and we are still developing it and open it for some countries, some other countries. Next slide, please. So it's called Food Chain Lab. We are working now on a Feed Chain Lab version as well. So this is an interoperable system where you can bring the operators and the distribution chains, and you within the system you can demonstrate the relation between the people who deliver and who are the operators, who are the retailers. So if you model this, you can also refer to geographical data as well as the production data and other factors like animal keeping conditions, for example, is it organic or not, and so everything could be included. And the sexy aspect of the system is that it can also be used by retailers, for example, or by farmers. So it's an open software, and we can say we are quite proud of it that it's now introduced in Europe, and many people start now to use it. Next slide, please. The second example, what I want to show you is the rapid alert system. This is one aspect, not only the delivery notes, but also the rapid alert, so that you can remove things from the market. It's an old system which is in place at the European community, but maybe you are more familiar with the so-called Infosan system, where it's an intercontinental and interoperable system for the whole world. So how the rapid alert system works, if you want to import something to Europe, wherever you go, to a harbor, airport or whatever, the control system is open, so people, the officers can look into the system, and if there is something wrong, they can reject the import, for example. Next slide, please. Next slide, please. Okay. So you see what you can see here in the structure is not only general information, distribution status, where it is, the product itself. All this system in traceability only works if you have a good description of the product. Yeah? So if it's not clear what you're talking about, you are lacking of definition, and we have learned from our Chinese colleagues, Lao Tse always say, you know, if you don't have the right definitions, chaos will start. And this happens also in tracing. If it's not clear which product or which substance you are tracing, you run into big problems. And so we also have a correction system, for example, built in. So this is in the rapid alert system is in place. It should be notified by all countries now. Next slide, please. And what we have developed now is an extractor. We can read out all these data, and you can see another confusogram on the right side. It also shows you the connection between these products. So for you, it might be not really clear, you know, but for the people who do the tracing and want to find out where is the source of an outbreak, it's a helpful tool, because then you can connect all the tracing forward, tracing backwards channels, and you can find out where the product is. And believe me or not, in almost all crises in the last 20 years, it's not that easy, because very often you have brokers, then you have a trading line over borders, out of the EU, into the EU. So sometimes it's really Mother Nature is a witch, you know, when it comes for tracing. Next slide, please. A last example which I want to show you is something directly to do with the transfer between unwanted substances in feed and what will be in the end in the animal as an food-producing animal, or in the egg, for example. So this is online now since 3 or 4 days. Next slide, please. It's quite easy. The system, when you feed, for example, cows with hemp, you know, you have cannabidiol inside. And it's an experiment we made last year. And there's a special transfer rate. Yeah? So there's a transfer rate into the cow and into the milk. And you might ask me, you know, what's inside the milk? I will tell you, you know, there's an accumulation of THC and cannabidiol in the milk. So it sounds great, but the other aspect is that the cows are completely stoned. So it's an animal welfare problem as well. So we decided also to regulate it. And then we checked it together with some colleagues in Europe, what will be the transfer rate into the blood, into the products, for example, into milk. And next slide, please. This is now an interoperable system where you can see that we have now established it for chicken, for cattle, and for pigs. That, for example, for PFAS, perfluorinated alkyl substances, or dioxin, for example, you can see when you feed them what will be the doses that they have eaten, and then you can see the kinetics. So, for example, as a risk manager, you can calculate when are the animals free that you can trade them again. So that is a very helpful tool to end up crisis, because otherwise you will fill up your livestock farms, you know, with unwanted animals. Next slide, please. Just to show you, we are not alone on this world, and this is another confusogram, my last one, where you can see all interoperational trading lines between countries. This has been established here in 2012, but you can see there are major players in this world, but all countries are involved. So if you have a problem in one country, it could be also a problem in a second one. So I think this is something we have to keep in mind. We have to share the data, yes, it's true, but the data should be correct. And this is the other backbone and the opposite side of tracing. Whenever you measure something, you have to make it good. If the data are not good enough, then because they are a direct function of the risk assessment, you might be misleaded by your findings. So where the problems are. Next slide, please. So this brought us to a situation where we said, okay, let's make an ecosystem for Europe. So we are now developing together with some German countries, with the EFSA, also with the FDA, a system where you can have an interoperable system where you can collect data, where you can evaluate data, you can make it visible in graphs, and to give some reports so that the risk managers can make their own decision. So we are far in this development, and the major aspect is, and this is what I have to remind you, the next 5 to 10 years, IT system will change everything you know about food, because also about distribution of food. So for the risk managers, for the risk assessors, it's so much important to build up databases on one side, and second, to have interoperable formats to exchange data, because this is a prerequisite. If you don't have this, you run into problems. So it's a definition part on one side. The second is you have to be flexible enough, to combine these data to come to a visible visualization and an analysis of the situation. I would say in 5 years we are ready with this system, and it is also open, everybody can take part. Next slide, please. This brings me to an end. I think No New Frontiers, a good title, but what is needed? Locally, we need data exchange, and for example, for your country, also good monitoring plans. Regional basis, you need analytical capacities. Without a good laboratory system, you will not have safe food in future. Traceability as a backbone combined with the exposure, because you have to know what your people are eating. If you don't know this, you cannot calculate residues. So this is something which has to be done in accordance, that you look for the feeding behavior of your population. And at least we have heard the last day standards, and it brings us to one situation. It's a global word. It's one word, and our value is trust. Thank you very much.
Thank you, Professor Hansel, for your keynote address, highlighting significance of traceability in addressing issues of food safety that arise from contaminated feed, and also giving insights of the rapid alert systems that are prevalent in Europe and Germany. Thank you, both the speakers, for their addresses. Now, may I request Ms. Alka Upadhyay, Secretary, Ministry of Fisheries, Animal Husbandry and Dairying, to come onto the dais and felicitate the esteemed speakers, Dr. Shah and Professor Hansel. Thank you, ma'am. Yes, yes. Dr. Shah, please. Ma'am, यहीं पे हो जाएगा. Professor Hansel, please.
Nice to meet you.
Ma'am, may I request you to take the seat on the dais? We are now going to have the panel discussion on the subject matter. So we are now going to have the panel discussion on the subject matter, and this panel discussion will be moderated by Ms. Alka Upadhyay, Secretary, Ministry of Fisheries, Animal Husbandry and Dairying. Ms. Upadhyay is an IAS officer of 1990 batch from Madhya Pradesh. She has attained higher education from Syracuse University. She holds master's degree in organic chemistry, economics, public administration from Maxwell School, Syracuse University. She has a long association with the implementation and policy making of various rural development programs. So a big applause for Ms. Upadhyay, please. I'll now call upon all the panelists and request them to take their seats on the dais. Mr. Negash Simegizau, Mr. Gizau is the Deputy Director General of Ethiopian Food and Drug Authority, EFDA, with around 23 years of experience in different areas of health, food safety, quality, as well as capacity building and research. Dr. J.S. Reddy. Dr. Reddy is the Additional Director, Export Inspection Council under the Ministry of Commerce and Industry, where he renders services in the area of certification of quality of export, commodities, quality control and inspection before exports, and establishment of quality standards for notified commodities of export. May I also call Ms. Anna Lucia Viana. Ms. Viana is the Joint Secretary of the Department of Inspection of Animal Products at the Ministry of Agriculture, Brazil. She is a veterinary doctor, graduated from the Federal Rural University of Rio de Janeiro, and was recently elected one of the 100 most powerful women in Brazilian agriculture by Forbes magazine. Wow. Dr. Raghavendra Bhatt. Dr. Bhatt is an esteemed professional serving as the director of the ICAR, National Institute of Animal Nutrition and Physiology. His expertise lies in understanding the nutritional needs of animals and developing strategies to optimize their health and productivity. You're welcome, sir. Dr. Pankaja Panda. Dr. Panda is the Senior Technical Advisor Food of US Food and Drug Administration. She has 28 years of public health experience and has worked for the US government, both in the US and overseas in Africa and Asia. You're welcome, ma'am. Dr. Joy Krishna Jaina, Deputy Director General, Fisheries, ICAR, New Delhi, possesses over 30 years of research experience in different fields of freshwater aquaculture and conservation genetics. As the DDG Animal Sciences, he steered the programs of Animal Science Division of ICAR for about 3 years. That's from April 2017 to January 2020. You're welcome, sir. Dr. Rajan Sharma. Dr. Sharma is presently working as Head Department of Dairy Chemistry, ICAR, National Dairy Research Institute, Karnal, with around 25 years of experience in the area of milk quality and particularly analytical dairy chemistry. You are welcome, Dr. Sharma. Dr. Eni Bensi Jacob. Dr. Jacob, animal nutritionist in the Ministry of Fisheries, Animal Husbandry and Dairying, Government of India. She is a veterinarian by profession and is specialized in animal nutrition. You're welcome now. Now we have the full panel over here, and may I now give the floor to Ms. Upadhyay for moderating the session. Over to you, madam.
Thank you very much. And as I've been forewarned that the sessions are running a little late and we should try and make up, so it's 3:06. Let's try to wind up, I know realistically by 4:15. Although I was told to wind up in an hour, it doesn't seem like. So a very good afternoon to all of you, and very happy to see very familiar faces, fresh from the G20 and the W20 that we concluded yesterday in Anand, and happy to also see the new faces, and a very warm welcome to all the panelists. So setting the context, of course, we've heard both Mr. Shah and the professor talking about the need for credible or authentic feed and fodder and how it relates both to human and animal health. So the mantra that is being spoken these days is One Health and the zoonotic diseases. I'm sure people in this room are familiar with both the terms by now. And needless to say, there is a lot of seriousness to these two concepts, and we have to work together. I must congratulate Ministry of Health and Family Welfare and FSSAI in particular for organizing this Food Regulators Conference. So today's discussion, panel discussion on impact of animal feed on food safety and human health is basically the ethos. The context has been set. I will not be repeating what has already been spoken about. Just to mention over here that feed today is a loose-ended subject as far as India is concerned, and I think in many other parts of the world. There is a need to regulate, and although certain measures have been taken by the Indian government, there is a lot of room for improvement. The FSSAI had amended the FSS Act 2006 by incorporating a statement, commercial feeds shall comply with the relevant Bureau of Indian Standards and shall carry BI certification mark on the label of the products. Interestingly, the industry itself has been coming to me and saying that we need to regulate this industry and we need to be sure about what goes into the cattle feed. The panelists who are joining us today are experts in the field of animal feed and animal nutrition, dairy sector, food safety and policy. The rich experience that we have on this table and in this room, I'm sure would be able to guide us to tackle this important and yet a rather new dimension of animal health, so to say, and which directly affects the human health as well. So without much further ado, let's move on to the panelists, and in order to keep to the topic, what it has been decided that we will be dishing out, or we will be asking certain questions to the concerned panelists. The questions have been so framed depending upon the areas of expertise. Considering the time, if in the first round of questions we can stick to about 3 to 4 minutes, I think then we will be able to have more discussion and also go on to the second round. So I think let's start with my question to Ethiopia, Mr. Sime over here. So what are the major steps that Ethiopia has implemented to ensure the safety of animal feed in relation to food safety? So over to you, Mr. Sime.
Thank you very much. Today I'm really very glad in getting such opportunity, meaning in participating in this global summit. And I get this opportunity from my friend in India. So I want to thank Indian Food Safety and Standard Authority because they just invite us in this golden summit. So having said this, in Ethiopian context, to give you some information, as one of my brother yesterday stated, the regulatory body in Ethiopian context are many, scattered. But by this year, in order to solve certain issue, the issue of coming together or having coordination have already been started. So having said this, I want to come to the area where we implement just to ensure the safety of animal feed. In Ethiopian context, the most important thing that we do in this area is that the issue of restructuring or reforming the authority or the sector is paramountly important. For this purpose, previously, the Ethiopian regulatory activities pertaining to the animal feed is just coordinating under the Ministry of Agriculture. But to make it more strong or to make it more precise regulations by the proclamation 1263, 2021, Ethiopia has already been given a mandate for Ethiopian Agricultural Authority has been established by House of People Representative. And at the same time, by 509-2021, by the Council of Ministers, regulation has already been established for Ethiopian Agricultural Authority. So the authority become more autonomous now. So because of this, we now, in our setup, we have already prepared of Ethiopian feed standard in more than 20 feed standard that already been prepared in collaboration with Institute of Ethiopian Standard, and at the same time in collaboration with other all regulatory body who has just engaged in food safety activities. And another area is another area that we implement is the registration of commercial feed processing plant has already been started, and at the same time inspection regulation of feed processing plants on a biannual basis via the established system of the Ethiopian Agricultural Authority, which is just managed under the Ministry of Agriculture. And another point is the issue of preparing or preparation of feed product and feed meals registration guidelines and procedures and introduction of feed standards, as I've already stated. And another important point that we implemented in our setup is that the issue of registration and again the competency certification provision, particularly for professionals who are just working in import, export, and wholesale activity of feed and feed supplements. And another important point is the issue of conducting annual survey or monitoring of monitoring on feed for chemical contaminants and residue, and at the same time for microbiological contaminant surveillance. This is, as for example, during this survey is just conducted particularly in order to identify the issue of aflatoxin, the issue of heavy metal residue analysis, the issue of microbial local analysis and the pathogen bacteria isolation and identification, and at the same time the provision, another important area where what we implemented in our setup is provision of training and awareness creation platform on an annual basis for all sectors, particularly for sectors who are really in need, or particularly for our stakeholders who have a strong correlation, a strong relationship with this particular area. Thank you so much.
Thank you very much, Mr. Sime, and that was indeed a very good, I would say, information. Preparing SOPs and guidelines, I think that was something that really struck me. And I think these SOPs, like we have the GMP, good manufacturing practices for medicines and pharmaceuticals, probably something like this should be thought about. Now, moving on, I would now request Dr. Raghavendra Bhatt to highlight on the importance of use of alternative herbal feed additives, probiotics to antibiotic growth promoters in food producing animals. I'll just take a minute to just talk about the new EVM. So we were in this G20 summit, and one of the things that was talked about was the ethno-veterinary medicines and inclusion of Ayush as a medicine, inclusion of these medicines in Ayush for treatment of animals. I think this is just a continuation from what we spoke about in our G20 summit. So over to you, Dr. Bhatt.
Yeah, thank you very much. Thank the organizer for this opportunity. As all of us know that, AGPs are around for decades and believed to improve the nutrient utilization through manipulation of the gut microbes. But as food producing animals are in close proximity of human society, the constant pressure of antibiotics in the gut favors the selection of the antibiotic resistant microbes, which can spread to human population through the excreta or product contamination. Further, the recent evidences of the AMR genes with potential to spread to other microbes, we can call it as an opportunistic and pathogens of more concern, which are otherwise not resistant to these antibiotics, exacerbate the whole problem itself. The alternate strategies, includes improving the hygiene and the biosecurity, optimizing the nutrition feed formulations, using pre and probiotics, and now they are also parabiotics and the postbiotics. Some of them are, as mentioned in the morning, also people are talking about the probiotics and the prebiotics. Now we have the combination of both. They are called the symbiotics. We use the organic acids, essential oils, and the botanical extracts. Morning a mention was also made. We talk about the enzymes, then the immunostimulants. Now, what are the reasons for searching an alternative to the antibiotics? Basically, it is the resistance, and one of the main concerns with the use of AGPs is that the potential and the threatening spread of antibiotic resistance bacteria. And it's a global health issue that can compromise the effectiveness of the antibiotic in human and veterinary medicines. By reducing the use of AGPs, the selective pressure on the bacteria to develop the resistance can be controlled. The second point is the consumer demand. There is an increasing consumer demand for, especially the poultry, to have the product without the use of the antibiotics. Consumers are becoming more conscious about the potential health risks associated with the antibiotic use in animal production, and are seeking poultry products that are raised using the alternative strategies. The regulatory restrictions, and many countries and regions have implemented SOPs and are considering the regulations to restrict ban of the use of AGPs in animal production system. And these regulations aim to mitigate the risk of antibiotic resistance in public health. The other important point is the long-term sustainability, because AGPs are not a long-term sustainable solution in the long run. So the continued use of antibiotic can lead to development of the resistance, so rendering the antibiotics very, very less effective in both veterinary as well as the human medicine. So developing alternative that promote the animal health as well as the growth without relying on the antibiotic is essential for the long-term sustainability of the animal production system. And one of the concerns in the recent year is the animal welfare, which had not been heard before, that improving the animal welfare is an important consideration in the modern animal production system. Alternative to AGPs focus on maintaining the good gut health, enhancing the immune functions, and reducing the occurrence of diseases leading to improved animal welfare as well. Then morning also we are talking about we have like in something like two standards. We have separate standard for the Indian consumers and we have separate standard for the international exposed consumer. So this, some people can take advantage of this particular thing. So the international trade regulations, some of the countries have set maximum reduced limit, that MRLs, which Dr. Rajan was talking about in the morning, for food products, including the poultry. And meeting these challenges can be very strict at times extensively. Therefore, finding effective alternatives allows producers to comply with the international trade regulations. So I'll just take a couple of one more minute on that. For example, in case of poultry, we talk about an aflatoxin. So the maximum limit is 20 ppb. So I have been attending meeting in the Bureau of Indian Standards as well as the Compound Livestock Feed Manufacturer Association. The question always they ask, we have a standard of 20 ppb for the complete feed. What about the raw materials? There is no restriction on the raw materials. So this is the one particular thing. And the second thing is, and industry is also forcing the manufacturer as well as the implementing agency. We are also using a lot of these binders. So what about the role of binders? For example, if you go to 40 ppb in the feed and we add binders, and the binders are highly effective, and they will be, but as far as the rule is concerned, we are not talking about the binders. We are talking about the raw materials that are going into the feed. So, and we know the health hazard of even if you have around 20 ppb in the complete livestock feed, and the effect of this B1 coming into the milk is almost to the, if it crosses 20 ppb, we can expect around actually about 6 to 7 ppb, which is very risky as far as the young infants are concerned, or the old people who are exclusively people who are highly vegetarian, like totally vegetarians, and who consume a lot of milk, and their health hazard is also concerned. So with the looking into all this, the alternatives of the ethno-veterinary medicine is a great challenge and is great opportunity in the days to come. So thank you so much, ma'am.
So thank you very much, Dr. Bhatt, and gut is important for all of us. And in fact, for the Indian audience who's sitting over here, just I came across this gentleman who has worked for years in Gujarat. I don't remember his name now. He said 1 spoon of jeera water takes care of your gut. Now this would be something which many of you as scientists would make no sense out of it, but truly this is something that he has said, and it was endorsed by a lot of the community that side who looks after the animal health welfare. Now we have with us from the US FDA, Dr. Pankaja Panda, to highlight about the awareness programs that are being implemented in the US to ensure feed safety.
Thank you, Chair. Feed safety programs have been in place in the United States for many years, and awareness of feed hazards is fairly good within our industry. Of course, as manufacturing technology changes and new ingredients come along, for example, industry and regulators need to be alert to new issues. The regulatory agencies are able to reach out to university-based programs such as the Cooperative Extension Service, or to other third-party programs and groups such as the National Pork Producers or American Feed Industry Association for help with outreach when necessary. These are some of the programs that create awareness. Some individual US states began regulating animal food as early as 1890, and the Association of American Feed Control Officials, AFCO, was established in 1909. Most AFCO meetings are open to industry and the public, and much communication occurs at those meetings regarding new hazards, regulatory changes, as some of the examples. FDA became the federal feed safety regulator with the adoption of the Food and Drug Cosmetic Act in 1938, and its animal food regulatory program expanded dramatically in the 1960s. FDA has been coordinating and cooperating with state animal food regulatory agencies for more than 50 years now to make sure high priority programs get covered uniformly across the entire country. As the federal authority charged with oversight of US animal food supply, FDA is also in partnership with the 50 individual states and US territories, but it provides oversight across the nation. We are both a regulatory and public health agency and must always keep science as our foundation and risk-based decision-making at our core as we oversee the United States animal food supply, including products made domestically and those we import. Within FDA, the animal food program is primarily administered by two different components: our Center for Veterinary Medicine and our Office of Regulatory Affairs. Animal food is defined in that regulation and is the definition we have been broadly using to be food for animals. Other than man, it includes pet food, animal feed, and the raw materials and ingredients that are used in these feeds. There are several examples of animal food: food for cattle, food for poultry, and aquaculture species. Animal food, as I just mentioned, includes pet food and pet treats. And yes, animal food also includes species such as wild birds, exotic animals, reptiles, and aquarium fish, as well as I mentioned earlier, the materials that are used and ingredients that are used to compose and make them. Thank you.
Thank you very much for being so crisp and being so precise. Pet food industry, including the other varieties that you mentioned, fish, exotic birds, etc., that's a very growing industry. There's a hugely growing industry here in India as well. And this is the industry where both export and import is happening at this moment. And it's a nascent industry, and here in India we are trying to develop it into a big industry, and we are already seeing results. So I guess it will be very important if we, at this point in itself, brought in some regulations for this growing sector also. Moving on, my colleague, Dr. Annie Benzi Jacob is here, and I would request her to speak about the regulatory framework regarding safety of feed globally. Over to you.
Thank you, ma'am. Good afternoon, everyone. If we look into the regulatory framework across the globe, we can appreciate that every country has got their own regulation. And in most of the countries, a single regulator is regulating both food and feed. Coming to the, I'll take few examples. Coming to the western side, in US, my colleague has narrated very well, but just I will add, in US, their Food and Drug Administration regulates feed safety. They have to comply with Food Safety Modernization Act, and so that the entire food supply chain is safe. So all the feed and feed ingredients are to be complied with this Food Safety Modernization Act in USA. All other details have been given by Pankaja. Then coming to Canada. In Canada, the Canadian Food Inspection Agency is implementing their feed acts and regulation. So it mentioned about the feeding standards, registration of feed business operators, then labeling, punishment, and other liabilities. Coming to the European Union, they have got very good regulation. And there are mainly three main areas of legislation in European Union. That one is European Union Regulation 178/2002. It deals with general principles of feed and food. And it is a milestone in the development of legislation in European Union, and under which European Food Safety Authority was created. Then another law is European Union Regulation 183/2005. It regulates the feed, it specifically mentioned about the feed hygienic rules. And above that, each European Union member has got their own national regulation implementing this European Union regulation. My Ethiopian colleague has already detailed about their feed regulation law in Ethiopia. Then coming to the eastern side, in Japan, their Ministry of Agriculture, Fisheries and Forestry, they are implementing a law named Act on Safety Assurance and Quality Improvement of Feed, so that it is ensured that feed and food from farmer to consumer is safe in all the aspects. In New Zealand, they have got a very good regulation, that is Agricultural Compounds and Veterinary Medicine Act of 1997. Their oral nutritional compounds and feed additives are well regulated by their act. Coming to India, so far we have a standard set up by Bureau of Indian Standards that is voluntary in nature. So I should say our feed industry is self-regulated in India, and we are moving towards a creation of or establishment of a central feed law shortly. And in some other countries where there are no law, they are following the voluntary international standards set up by Codex Alimentarius. So I think we will hear about Brazilian feed regulation soon. So that's about this global, there's a few gist of global feed regulation. Thank you.
Thank you so much, Annie. I didn't know your repository of such knowledge. She works with me, and I've now found a star in the department who should be looking after this particular aspect. Thank you very much, Annie. And now moving to the superwoman from Brazil, Forbes 100. Let's hear from her. How does the country address the transmission of animal feed contaminants in food producing animals and foods of animal origin? Over to you.
First of all, I would like to thank FSSAI for the invitation to participate in such an important event that brings together food regulators to discuss strategies to strengthen food safety. It is an honor to be part of this. Thank you, Dr. Alka, for your question. In Brazil, the area of inspection of products of animal origin and animal feed are in the same department, so the actions are integrated. But Brazil has legislation regulating animal feed activities focused on good manufacturing practices and inspection based on the management of the estimated risk associated with the establishment, to determine the minimum frequency of inspection in establishments. All procedures are described in manuals, guidelines that explain how to evaluate the production controls performed by the companies, mainly in relation to the control of the production process, include the control of residues and contaminants. In addition, it has specific rules related to the control and maximum limits of some contaminants in products for feed animal, include production animals using in animal food, such as there are rules that prohibit in national territory the production, selling, and use of animal products intended for ruminant feeds that contain in their composition proteins and fats of animal origins. It prohibits the manufacturing in the same plant of products intended to the feeds of ruminants and non-ruminants. Rules approving the technical regulation on additives for products intended to animal feed according to good practices, good manufacturing practices, contain the producer procedures for evaluating of safety use, legislation, and sale. establish the maximum limit for dioxins and PCBs in products intended for use in animal feeds. Establish the minimum criterion for the produce and use the products for animal feeds with veterinary medical products. In addition, for the standards with substance of prohibit use touching animal feed like organochlorines, chlorophenicol, nitrofuranes. In addition, the DPOA, Department of Animal Products Inspection, has an annual program of sampling in companies that manufacture and import products intended for animal feed. This program is carried out by the inspection in each state that collects of the samplings in the establishment and forward then the official MAPA laboratories and public or private laboratories accredited by MAPA that proceed the official analysis. Currently, the scope of these analyses are applied to verify not only physical chemical aspects, but also to monitor the presence of the residues in the animal feeds and establishing in standards, national standards, like drug residues, microscopy for detection of the prohibited ingredients in ruminant feed, determine the presence of genetically modified organisms, as well as explore analysis to ascertain inorganic contaminants, heavy metals like cadmium, arsenic, pesticides, mycotoxins, and salmonella. The collections are distributed throughout in the country in the random draws by the central authority.
Thank you so much. That was a lot of information, and one could make a sense how disciplined the sector is, or the kind of policy formulations that you have bring in discipline in the sector. Now, moving quickly to the the question on the role of Export Inspection Council in regulating feed additives for export, I would invite Dr. J.S. Reddy to give his views.
Thank you, Madam Chair. Firstly, let me take this opportunity to congratulate FSSAI for organizing such an important summit in the hour of need, and I am indeed privileged to be among the panelists. The Export Inspection Council, that is EIC in short, set up by the Government of India through an Act of Parliament in the year 1963, with the basic objective to ensure sound development of export trade of India through quality control and inspection. EIC is the official certification body and competent authority for certifying the notified food products, that is notification done by Government of India from time to time for export to different countries across the world. When we look at the major role, it is to ensure the quality and safety of the food products that are being exported, and basically they have to meet importing country standards. The export certification is based on certain principles like good hygiene practices, good manufacturing practices, good agricultural and good veterinary practices, and HACCP principles, as well as specific requirements of the importing country. If any specific requirements are mentioned by particular country, where EIC will ensure that it meets those requirements before being allowed for exports. The delegations from regulatory authorities of different countries, like for example, DG Sante of European Union, Ministry of Health, Labor and Welfare of Japan, General Administration of Customs of People's Republic of China, GACC China, MFDS, that is Ministry of Food and Drug Safety of Korea, DEFRA of UK, Department of Veterinary Services Malaysia. In fact, the DVS team is in India since last 10 days. And these teams regularly visit India to evaluate the risk management mechanisms as well as official controls being exercised by the Export Inspection Council, based on which they readily accept the food products imported into their countries with EAC certification, which basically will reduce the transaction cost for the Indian exporters. Coming back to the specific question of regulation of food additives for export, when we look at what goes into feed to make a complete feed, it is obvious that the major raw materials are agricultural produce or agricultural byproducts like cereal grains or oil seed extractions or oil seed cakes, and feed additives and premixtures are becoming one of the important components to improve the performance of the animals. Quite a few types and quantity of the feed additives and premixtures are being exported from India. So in order to ensure the safety of feed, it is better to use the safer feed additives. It become imperative. Hence, the legislation has brought about a decade back, that is in the year 2003 by Government of India. And Government of India has notified feed additives and premixtures. That means mandatory pre-shipment of the certification before being allowed for the export. The legislation laid down the requirements of the feed hygiene, which encourages the adoption of good hygiene practices. EIC, being the competent authority, approved the feed additive producing establishment which adopt the HACCP-based process control checks. Once approved, these establishments are under surveillance through official controls and are subjected to periodical safety audits. Thank you, Chair.
Thank you very much, Dr. Reddy, very succinct. And the takeaway, I guess, is we've been speaking about SOPs for good SOPs for manufacturing, the GMP, but one key takeaway from this is good veterinary practices, and I think that's very, very important. And not only in terms of the purity of the product, but also for the animal health. So I think that's a very key takeaway from here. Now I would request Dr. Rajan Sharma from NDRI to talk about how mycotoxins in feed is an issue that gets transferred into milk, and how can we stop this problem, or rather tackle this problem.
Thank you, Madam Chair, and I also take this opportunity to thank FSSAI also. Ladies and gentlemen, good afternoon. So we know that aflatoxin M1 presence in milk is a problem, not in India, but also across the globe. So that's why my colleague has said that the legislation is there across the countries. Since aflatoxin M1 comes from the, when the animal takes aflatoxin B1 contaminated feed, which is particularly contaminated with the 3 various types of fungi, that is aspergillus species. Then B1 is converted into M1 and then it comes into the milk. So if you want to practically stop the, the presence of contamination of aflatoxin M1 in milk, probably best is to stop the growth of these fungi in the feed itself. So farmers in this context needs to be made aware that they should store the feed properly. So I think the first step is to make the, as it has been said, that SOP and we need to do training. So probably that is the first step. We need to make aware the farmers that feed should be stored. One more striking point here is that when the aflatoxin M1 appears in the milk, actually most of the literature suggests that it is less than 6% of the ingested feed, which is ingested aflatoxin B1, which appears in the milk. So that means if animal has taken, if the 1 unit of aflatoxin M1 is coming in the milk, that means animal has taken 16 units of B1. So that means if the aflatoxin M1 at all is coming in the milk, that means the feed must have been heavily contaminated with aflatoxin B1. So one thing is, of course, the feed. The second is regulation. Although we have that regulation in place, BIS regulations are there. FSSAI has endorsed it, but I think it is better that FSSAI adopt its own regulation, then it will have a more effect across the system. Thirdly, probably we need affordable test, both for checking the quality of feed as well as the appearance of aflatoxin M1 in the milk. If the tests are affordable, tests are rapid, probably it will be self-regulated, and I mean the system will be geared up to stop the entry of aflatoxin M1 in the milk. One more point that when we store the feed, probably temperature and humidity are the two critical factors when these fungi grow. So the literature says that the typical critical temperature is 25 degrees centigrade, and humidity in the moisture content in the feed is around 13%. So although temperature we cannot control, but yes, the moisture content in the feed can be controlled. The farmers can be made aware that you store the feed in a dry place. Particularly this type of season, this monsoon season, this is more vulnerable, which make the growth of these fungi, they proliferate very well during this particular season. Lastly, the composition of raw material. So Dr. Bhatt has said that raw material quality is also not enforced. So particularly if the feed is, compound feed is made up of groundnut cake, cottonseed cake, coconut copra, maize, gluten meal, it is destined to, it is more vulnerable to the aflatoxin B1 contamination. The fungi will grow on these type of material very well. On the other side, soybean meal, rapeseed meal, de-oiled rice bran, wheat bran, hay, these are, on these, the aflatoxin B1 producing fungi, they grow less. So the type of ingredient also makes the difference. So the take-home point is that the moisture and humidity and temperature plus the type of raw material, this should be taken care when somebody wants to control the entry of aflatoxin B1 into the animal feed. Thank you.
Thank you very much. A very practical tip, and I think this is how it should be promoted by way of extension in the rural areas or our dairy farmers, so to say. India's position in milk production is #1. Fish production, I was just checking, it shows 2nd or 3rd, poultry 3rd, and also in meat exports we are 5th. 4th position we have left for some other country. But successively these are sectors where India is growing very fast. And India as such, and I speak over here because we are all over here in India today, but it's with a global perspective that when nations produce these kind of surpluses, there is also a huge scope of export, imports to keep the prices down, exports for value addition, so on and so forth. But the question of traceability then becomes very, very important, and we heard the professor from Germany speak about how the software can take care of the traceability aspect. Now, I would direct this question with this background to Dr. Jaina as to how to ensure safety of poultry and aqua feed in the country.
Thank you, Madam. First of all, I would like to thank Chair, co-panel members, audience, and in particular FSSAI. I think I need not answer much because most of the things has been told by Dr. Panda, Dr. Bhatta, and Sharma. The very necessity of ensuring safety of feed, whether it is poultry or fish. Coming to the sector, for example, poultry, we produce about a 4 million ton of poultry meat. Fish, maybe 70 years back, we did not have anything coming from farming. Today, we produce about 10 million ton of fish. When you look beyond another 25 years ahead, the target is too much. We need to add another 18 to 20 million ton of fish. Similarly, I am sure in the poultry sector also there is huge demand will be coming. So when we talk of again in the future years, today whatever amount of feed we do produce in the poultry sector or fish sector, maybe 7 to 8 million ton we do produce from the industry itself. But we do use a huge amount of feed as a mixture, as a dough form, or so and so forth, where we do not have any regulation, definitely at this point of time. In spite of the fact that we have all those standards in place, for example, Bureau of Indian Standard, we have set whether what should be nutritional requirement, what should be the prohibitory substance, whether it is antibiotics, whether it is pharmacologically active compounds, and so forth. We have also prescribed what are the other anti-nutritional factors, what should be the limit, whether it is gossipal in case of when we use so much of cottonseed cake in fisheries, so much of cottonseed cake are being used at this point of time. So when we talk of ensuring safety standard of whether poultry or fish feed, we know the whatever the protocol we need to be using, but at this point of time, as has been told, still we are following the BIS guidelines, which is voluntary at this point of time, and it is more of a self-regulated, as has been told by Madam Jacob also, self-regulated mostly industry, but in coming days probably, as I learned, all those BSI standards what we have been following will be coming under the jurisdiction of FSSAI. If it happens, probably we will have a regulatory mechanism in place, more of a monitoring, how do you do check and balance, that is so important at this point of time. When you are looking for more of industrial feed coming in coming days, how do you ensure that quality is important? Do we have enough laboratories to do that? Or if we need to have a regional sort of laboratory, state level laboratory or region level laboratory, that is so important. One is feed, second is feed ingredients, sourcing of ingredients, as has been told also. We must have followed all standard protocol. We must have followed all good management practices, all HACCP guidelines, which we say hazard analysis critical control points. But at the end of the day, if our storage is not proper, if our packaging is not proper, our transport condition is not proper, whatever we have done has gone waste. That is what I was telling about the other anti-nutritional factors or whatever, rancidity and so forth. So how do we take this message to every level, not only to the industry, but also the consumers, the marketing, whoever does, the storage, because everybody tend to purchase the feed in bulk. We know the godowns, whether the godowns has an adequate, not only space, the condition, where there may not be any contamination, whether there is a air exchange at all. So all these factors are so important at this point of time. I sincerely believe in coming days also the country will come out with some national policy on the certification of feed for safety standard. I'm sure Madam will must be working on those. Probably it is time for us, all the ministries should come together to have some sort of a national policy at place at this point of time. Probably more awareness, more monitoring and all are so important at this point of time to have ensuring the quality. Thank you so much.
Thank you so much. I must compliment the panelists for doing a very quick job. Unfortunately, because of time, we might not have, the second round of questions might not see 3 or 4 minutes each, but we definitely want to our panelists to speak a little bit, maybe in a minute or so, about certain other questions which have just come up. Specifically over to Ms. Viana, regarding the issue that Mr. Jinnah just left over here. How do we ensure feed testing at the doorstep? Is there anything that's happening in Brazil, or are there any global lessons? May I request you to please speak on this for a minute?
In Brazil, to the application of the feed safety rules and regulation is essential to ensure the health and safety of animals and humans. who consume the animal products. Constant updates of the regulations make the rules clear, objective, and have tools for the compliance by the inspect and of the monitoring of the authorities. And monetizations of the official laboratories to expand the scope of the laboratories, implement the traceability. Yes, how the tool in the regulatory framework is the most important, because this has the guarantee that we know the samples are collected by the service from the beds of the animals and the products of the sample origin, with allow the traceability of the rural farms of the origin of the animal. If you have some violation in this sampling, we can promote an investigation. It can include an inspection in the rural farm, and can identify the cause of the violation and apply the possible administrative sanctions and the control of the risk of the new violations.
So thank you so much. I think I have to rudely kind of interfere over here, but for paucity of time. So just one question more. This is on microplastics and the growing threat in aquaculture. Would you just be able to throw a very little, I mean, something very succinct and quick over here?
Thank you very much, madam. At this point of time, this has been a talk everywhere, because people say in our oceans probably there is more plastic than the fish. This is growing and growing. If we see the production of plastic in the last 3 decades has grown at least 3-fold. And most of this goes through water, river, and finally goes to sea. If you see wild stock of fish, yes, there are issues. We have seen some study. I don't say that we have done extensive study, but whatever study we have done by some of our institute, both in rivers as well as the coastal waters, we have seen there has been small fish, mainly the pelagic fishes, are taking microplastics, and in the those fishes which are at the bottom of the food chain. Maybe small crustacean fish which are consumed by the carnivorous fish, carnivorous are consumed by the bigger fish. Probably there is more accumulation. But at this point of time, yes, the digestive system is found to be affected. There are some plastics are found in the guts and all. But telling at this point of time how does it affect the muscle tissue and all, whether there is a genotoxic effect, whether there is the synthetic toxins which are available in the plastics are going to contaminate the fish, wild fish or not, still there are studies going on here and there all over the world. But coming to the aquaculture, probably at this point of time there is not much threat as we perceive, because it is in mostly our production system. Out of 10 million ton what we produce, all 10 million tons, 9 million ton comes from the pond system, where the risk scope is quite low. Only when we are looking for production, mariculture and all, probably this...
so that comes in as a big relief for all those who consume fish, that the threat is not so big over here. One last, and this is, I think, essential, because this is a very pertinent question, a very pertinent way forward. I would request Dr. Pankaja Panda to talk about how collaborations and partnerships should be taken forward, so that we get everybody here in the room, the stakeholders, to come on a common platform of food safety.
Thank you, Chair. For FDA, the longest and most overarching collaboration between FDA and the Association of American Feed Control Officials, I mentioned them in my first response. They have been our partners for many years, and have been using, FDA has used this relationship to facilitate both formal and informal communication between FDA, the state agencies, as well as promoting uniform policies across the country. This partnership has proven to be an excellent venue for communication on various animal food topics over the years. There have been other efforts of shorter duration targeted to specific goals. Two examples are significant reductions in animals with detectable drug residues in animal tissue due to medicated feed in the 1990s, and the quick response to BSE in the late 1990s. So these are two examples where we worked with AFCO in reducing animal disease. In both cases, FDA, the US Department of Agriculture, AFCO and its individual state agency members, and other groups such as the Cooperative Extension Service of the universities have all worked together to implement regulations and a regulatory approach, training and outreach to industry in a manner that was very effective.
Thank you very much. I think this is the key takeaway, that we need to educate and we need to create awareness, and I think FSSAI has a big role to play over here in setting up standards. We have seen a massive improvement as far as human food chain is concerned, and I wish that FSSAI, which has embarked on this journey, to very quickly come up with such regulations. So thank you very much, and I must thank the panelists who did a brilliant job in the given time to talk about what they had to talk about. And in fact, we did quite good. We started at 3:06 and it's 4:01. Of course, my batchmate Kamal was giving me those indications that we need to wind up, but I guess we've given an opportunity to everybody. So thank you very much.
I would like to thank the esteemed panel coordinator and all the panelists for this rich and informative discussion, bringing forth issues and solutions in relation to feed and food safety connect. So may I now request the panel coordinator, Ms. Upadhyay, to felicitate the panelists, please. You can. So, Mr. Negash Sime, please. Dr. J.S. Reddy, please. Miss Anna Lucia Viana, please. Dr. Raghavendra Bhatt, please. Dr. Pankaja Panda, please. Dr. Joy Krishna Jena, please. Dr. Rajan Sharma, please. Dr. Annie Bensi Jacob, please. I would now like to request CEO Sir Shri Kamala Vardhan Rao to felicitate the panel moderator Ms. Alka Upadhyay, please. Sir. for a good group photograph, please. Come over here. Group photograph, please. So we'll have a group photograph of the panelists over here. And with this, the technical session has come to an end. And then we'll be going for a tea break of 10 minutes. 10 minutes only, please. And I request all the delegates and participants to be back in this auditorium in time for the next technical session.
Thank you, sir. Thank you, sir, so much.
God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा, और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस है और थोड़ा कम है ना, सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam.
Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east, and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 70-100,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with a focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
तंदुरुस्ती बहुत चीजों पे डिपेंड करती है, पर खाने के मामले में एक सिंपल फॉर्मूला है। बस यूं समझिए कि प्लस और माइनस का खेल है। देखिए, आटा, चावल, तेल, दूध और नमक खरीदते समय प्लस F के निशान को चुनिए। ये फोर्टिफाइड फूड्स हैं जिनसे आपको संपूर्ण पोषण मिलेगा। और खाने में घी, तेल, नमक और चीनी को कीजिए थोड़ा माइनस, तो प्लस है और थोड़ा कम, है ना सिंपल। ईट राइट, स्टे फिट, तभी इंडिया सुपर हिट।
Annam Parabrahma Swarupam.
Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east, and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 70-100,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the
दे दियो रिसीवर इसी साइड में है बस
एक बार बताइएगा थोड़ा टाइम लगे
कितने कितने हैं इसमें
Ladies and gentlemen, welcome back. We are starting our final session now, one of the most important sessions. So we would love to have your presence for this session. If you wish to have an early dinner, come back early so that you can catch your flight as well. I know most of you have got your flights in the evening. If you don't want to miss the dinner and the flight, please be on the seats as early as possible. Requesting all the LOs and the volunteers to get all the delegates in. We are going to start this session in another couple of minutes. When I say couple, I mean just 2 minutes, not beyond that.
So welcome to all of you to the final technical session on innovation in food emergency response, recall and analysis. So as all of you know that food testing is the core of any food regulatory framework, and emergency response system is a significant pillar of any FSMS system. So we cannot be far away from this reality that we must change with the changing paradigm of food safety. So when the world is shifting from MRPL to RPA, the people in the food testing will understand this. When the world is shifting from minimum required performance limit to reference point for action, and decision limit from LOQ to decision limit, we cannot be far away, or we cannot be far behind. So the technological advancement happening in this field, miniaturization of the platforms, increased integration of artificial intelligence and machine learning tools, so this will be the key to our success in the coming days. So without wasting much time, I request Dr. Lalita Gowda to come over the stage and deliver the context setting and special address. Dr. Lalita Gowda retired as a chief scientist from CSIR Central Food Technological Research Institute, Mysore. Her professional experience as a research scientist with specialization in areas of structural biology, plant proteins, protein engineering, analytical biochemistry, and food safety, including grassroots work, academic activities, consultation, and position of institutional leadership, has spanned over 3.5 decades. She has immensely contributed. In fact, I can say nurtured FSSAI in the initial days, and till now she has been doing that in formulation of various standards, preparation of methods manuals, interpretation of test reports, and any regulation wherever we are stuck up. So I am very thankful to Madam for gracing this occasion, and I request Madam to deliver her address.
Good evening, everyone, and I thank FSSAI, which is like family to me, for having me once again to speak to you all. So I'm just going to take a few minutes because I know we are running late to tell you what are the innovations in food emergency response, recall, and analysis. Being partial to analytical methods, as I am an analytical chemist, I think my talk would be more related to analysis, but I will try to touch upon what are the innovations in recall. Next slide, please. We all know, and we've been hearing since yesterday morning about food safety and how important it is for all of us and there. But to have a robust system, we have to have monitoring and surveillance. And monitoring and surveillance has to start, as we have heard from every session, has to start from the ingredients, the raw materials, right through the production chain. But what is more important is that we have to actually build the trust in the consumer that the food we are giving or food that is presented to them on the table is safe. And we have heard speakers like Professor Hansel, who says that without laboratories and analysis, you cannot assure food safety. And so that is what I'm going to tell you about, what are the innovations in the testing methodology. Next slide. We have heard this. What are the challenges? Challenges are, I don't want to just repeat it because we have been hearing this from yesterday, that globalization of food going from one country to another. You get a plate with food which is ingredients from 5 different continents or 10 different nations, and then we have the contamination coming from the environment. As one of the panelists said, that when we were kids, we never bothered. We drank directly out of the tap, or we pulled a carrot from, because I'm from a farmer's family, we pulled the carrot out of the ground, washed it and ate it and never got sick. But however, things have changed, and food safety has come into play, and we need, because there are different consumer presence. Next. So the first question comes because of this type of developments is, can we trust what we see? Food adulteration is not new. It's been known, and as you can see, there was a book which was published in 1821 about food adulteration. And you look at the commodities that are adulterated, several of them which are shown over here, mainly the high-priced oils, milk, etc. And then we have the adulteration. We think that we have a method to detect the adulterants, but then we have innovators who make adulterants who are much more innovative than us. For example, for oil, we have what is known as the RM value or the Reiter-Michel value, which tells you about the purity of the oil. But now you have people who are producing something called an RM adjuster. So you can add that to the oil and you can adjust the RM value to come within the standard that is specified. Or if you look at honey, which is adulterated with sugar syrups and things, we have been hearing of that. Now you have an adulterant which is produced which says that no regulator can identify that you have added this syrup. It's called a non-identifiable sugar syrup which you can add to adulterate honey. So consumers, read all this, and so we have to build their trust. Next. And then you have increasing consumer demands. Earlier consumer demands, as we see, because we set regulations, we set standards, it may have been only heavy metals, contaminants, veterinary drug residues, which I have shown. But the consumer has gone beyond. So now they are asking, if you have a meat thing, is it cloned? Does it contain any added gelatin? If you have added gelatin, which is the animal species that gelatin has come from? If it is a meat, what is the age of the meat? Is it from commute meat? Is it restructured meat? So a lot of questions because of the internet and thing. All these questions have come, especially now that Singapore has allowed cultured meat in their standards. There are standards for that. Questions arise. So what is our role in answering this and providing trust to the consumer? Next, please. And then you have these marketing gimmicks, which advertising. So you have, as it says, ghee, pure buffalo ghee or pure sheep ghee, free-range eggs. How do we convince the consumer that what they are getting and what these labels are saying? So do we have techniques and do we have methodologies to enhance the trust? Again, organic, we had a session on organic and things. So you see these type of labels where you say 100% organic. And yesterday we heard the guru telling us that unless the soil, the carbon content of the soil is higher than 3% or 6%, no product can be considered as organic. So can we find out whether they have added fertilizer? So then we have to use a range of high-end techniques such as isotopic ratio to see the N14 or the N15 ratio there. Next. And this is consumer, because we have to actually make the consumer trust in us and to give them confidence, because they might not think what is shown on the left hand side, but while eating they say we want to eat only authentic. Next. And so this is when we look at the analysis and what we are talking about innovations. If you look at food is a very, very complex matrix. It is not like a physiological analysis of the urine or blood where the composition is the same. Here you have high water containing products, you have high fat, low fat, high starch, high fiber cellulose. So how do you do sample preparation? How do you do the analysis? But the development and application of the analytical methods has grown parallelly with the consumer's concern. And I think we do have, I mean, I would not say 100% that we are able to address the consumer's concern, but we do have techniques, methodologies, and innovations to address the concerns. Next, please. And we have, as you see, a whole toolbox of analytical techniques, which all those who are analysts over here, we use any regulatory system, we will use robust, validated, fit-for-purpose methods. They can be simple methods such as gravimetric or volumetric titration, raising all the way to LC, mass spec, or a new technique called REAMS, where you don't need a sample preparation to do mass spectrometry. You can use a knife to heat it and electron ionization, especially for meat. So techniques have developed. But what do we know about these techniques? These are all techniques where you need competence. You need to know how to use it, how to interpret it, and things. So where does that innovation come? Can we change or adapt these techniques so that we have easier ways, we have innovative ways? And yesterday Professor Susan said that they use next generation sequencing, to look at, product recall for the chocolate of the, which was contaminated with salmonella. Yes, we do need to use the omics, whether we are using, genomics, metabolomics, or the proteomics to do the assays. Next, I think. Yeah. So now the innovation comes is, can we do it where we don't have to have these high-end, but yet we fulfill the task of the required analysis. Like, could we detect, especially for the food business operators who are responsible, and they responsibly source their raw materials, can we have techniques, where they can identify the mycotoxins, or if the milk, we heard a lot about the milk in the previous session about aflatoxin M1. There are tests such as the rapid analytical test, the lateral flow strip test, which are there. But I have to caution you that although these are there, we have to see that these methods are validated and they meet the, Dr. Panda talked about the LOD, LOQ, and the MRP. So these have to meet the regulations. So any kit or any rapid kit like a lateral flow strip that is used should detect aflatoxin M1 in milk at less than 0.05 ppb to be in line with the regulations. Or do we have, where it is, especially in terms of an emergency? And this reminds me of when we had in India the emergency of formaldehyde being used to keep the fish fresh in the market. So we didn't have any method to actually test it. And thanks to Dr. Panda and his team, who very quickly developed a very rapid kit which could, detect formaldehyde based on a color reaction, and they could tell the presence of this. So this is innovation where, you want to do it at the point of use. It's like a bedside test. So could we have that? Freshness, how does the fish spoil? So innovations on methods which can be there. And some of them are there and being, used, as I see from the literature, that such type of methods are available. Next. And under FSSAI, we have actually approved, rapid analytical food testing kits, which have been validated, which have undergone third-party validation for use of this. And then, as in the morning we heard, Professor Susan Jebb said the one thing in one sentence, she said, it's invest in science. So I think that is what is it. We have to invest in science. And this was a paper that I read about how you can detect foodborne pathogens. It's a very, I mean, to me, maybe it seems simple, where you have two carbon molecules, one fluorohydrocarbon and the other is a hydrocarbon. And since the fluorohydrocarbon is heavier, it will be below. And on it, you have the proteins or the lectins, which will recognize the E. coli. So if there is E. coli in the food extract that you make, as you will see a clumping of the cells, what you see in the second panel. And that can be just, looked at, a photograph taken by your smartphone, and on the cloud, you send it and you're able. So, we have to build on such science and such innovations that we read in literature. And I think that is what the manufacturers are, doing. They do read these and they build on it. Next thing. And then this new era of digital transformation, in whether it is food recall, emergency, or analysis, is unfolding right before our eyes. And I'm not a computer expert, but if I have to do this, I must collaborate with somebody, who is very good, especially in machine learning, deep learning. And then we have seen blockchain technology, how it is used for, food recall and things. And then we have artificial intelligence. And our intelligence of the methods that I showed you, where we have the core methods of simple scanning, hyperspectral scanning, UV visible thing, which is coupled with artificial intelligence to give you innovative methods, techniques, and instruments for that. And then we have the satellite imaging, where if you are looking at product recall or products moving from one place to another, you use sensors and the RFID radio frequency tags on it, and you can look at them. And now we have wide area networks, we have Bluetooth, we have Wi-Fi, and so it is very easy to actually trace any of these, especially for recall, and also in analysis you will just see. Next, please. And this digital transformation in food analysis draws upon techniques and the physical state of the food that we are consuming. So it could be a liquid form, it could be a gaseous form, or it could be the solid form. And we use techniques, such as odor, and as I said, spectral scanning, vibrational spectroscopy, mass spectroscopy, or taste, and all this we put together, and then we collect data. So what you will hear in computer science as big data or data analytics. So to do or couple use digital thing, we need data. If I'm going to talk about scanning to tell whether I have insect infestation, my data should be about 14,000 times I should have, I should have analyzed 14,000 to 15,000 samples to be used in the artificial intelligence. The next thing. Yeah. So I said it is just using common, very simple techniques like what we have, e-nose or the e-tongue, which are there, and then using all the data. Coupling artificial intelligence or using digital transformation doesn't come with having, a set of data of 200 samples or 250 samples. We need to have large thing to be sure that what we are doing is correct. Next, please. So this artificial intelligence or digitization depends on the data processing and the pattern recognition, which is then used. Next, please. So you have, as I said, yes, the Internet of Things based detection methods, where we can put sensors or the tags in the sample, analyze them, data goes to the cloud, the opinion or results come back to your phone, and then you can take a decision on whether it is safe, unsafe, or it meets the limits. Next. And so this coupling of artificial intelligence with instrument analysis, if you look at the number of publications that have appeared in various peer-reviewed journals, right now you will see that in 2020 it has gone up to about 660 to 700 publications. And all these devices have been there. You have sniffers. The sniffer can sniff whether your meat is fresh or not, because it sniffs whether histamine is there. You have sniffers if you're sitting in a restaurant and you're allergic to peanuts. You can use the sniffer or technique where it will tell you whether there is any peanut in this. So all these actually, it is I would not, just like we talk about collaboration between people, it is collaborating with, with computer science. So we have to go beyond being in the lab or beyond being analytical chemists to do innovate in the field of analysis. And I would like to, I think this is my last slide, I would like to conclude that whatever said and done and whatever innovations we do for testing or for recall or for emergency, they have to be robust, they have to be reproducible, they have to be repeatable, and they have to be fit for the purpose. And with this, I think I have set the context for the panel discussion. Thank you.
Thank you, madam. Thank you for your insightful words. We have now a audiovisual presentation from Samuel Godfrey. Samuel Godfrey is the professor of from Canada, and he is the president of Global Food Regulatory Society. So, as he could not attend this session, so he has given a small talk on this. Please.
Ladies and gentlemen, dear colleagues, I would like to start by thanking the organizers of the Global Food Regulators Summit in India for giving the Global Food Regulatory Science Society and giving me personally the opportunity to be part of this event and to share with you this presentation aiming to emphasize the importance of enhancing the investment in capacity development in food regulatory science and in food laboratory science in particular. Now, I'm sure that you have been hearing this throughout the summit about the importance of food safety and how the food safety agenda represents a connector of so many policy agendas. The agriculture agenda, the health agenda, and the trade agenda, to cite a few. And also, we all know, and we have been working towards the characterization of the impacts of food safety or the lack thereof, and particularly on human health, with about 1 in 10 people getting sick as a result of improper food or unsafe food. And also the input of the World Health Organization characterizing about 420,000 deaths that are attributed to foodborne illnesses. This brings us to the imperative for us to continue to invest in enhancing food safety around the globe, including the ability to enhance the capacity that food regulatory systems are contributing to food safety by providing the environment and the level of oversight for food industries to develop and to thrive, enabling the production of nutritious and safe food products that contribute positively to the health of consumers. And this is one of the areas that our organization has identified, and that is the need to continue to invest in capacity development of food regulatory science. Now, how do we define food regulatory science? These are in fact all the various scientific disciplines, whether be it experimental science, social science, economic science, that are applied in the context of developing and understanding food regulatory decisions. And this is, of course, including, but not limited to, the foundations of food risk analysis and the various associated disciplines. The collaboration of partners and stakeholders is critical in this context, and that's why we are hoping to create a sustainable initiative with a sound operational model that would allow to multiply the collaboration with these technology providers, but also to create the relevant linkages with food regulatory organization. At the end of the day, one of our main objectives is to contribute to the robustness of food regulatory systems and to enable the application of the food risk analysis principles. Finally, I would like to use this opportunity to reiterate our commitment to supporting efforts of data generation and dissemination, data that supports food risk analysis and ultimately food regulatory decision making. We are also aiming to continue our efforts towards the development of training and capacity building program to enhance competencies in food risk assessments. Of course, maintaining and sustaining what was achieved in the investments related to food laboratory science will be critical, and we are hoping that by doing so, we will be contributing to the promotion of the development of international standards, international food standards that are representative of the global environment and that are aiming to protect consumers' health and to create a favorable environment for the trade of food and agri-food commodities. We are very much open to the collaboration with all partners and stakeholders. We are also aiming to do our modest contribution in the various efforts of capacity building in food laboratory science and in food regulatory science overall. And I invite you to visit our website at gforce.org to learn more about our initiatives, but also to reach out to us should you be interested in developing collaborations with our organizations and with our network. Once again, I would like to thank the organizers for giving us the opportunity to be part of this event. I wish great success to the development of this forum. And again, congratulations to the government of India for the leadership exercised in the development of this Global Food Regulators Forum.
Sir, I now request our CEO, Dr. Kamalabardhan Rao, to come up to the stage and felicitate Dr. Lalita Gowda. Yeah, now we have the panel discussion, and I request Dr. Isabel Lavaz to come up the stage. Isabel is the Chief Food Safety Officer for Canada and Senior Director of Food Safety Division at the Canadian Food Inspection Agency. She has wide experience in the key leadership as well as advisory roles in developing regulatory programs, advancing a number of international standards and guidelines as well as national responses to food safety and recall incidents. In the panel we have Mr. Rui Aldino Francisco Mapatse, then Professor Giovanni Antioni from University of Rome, Italy, Professor Susan Jep, Chair, Food Standards Agency, UK, Dr. S.N. Jha, Deputy Director General, Agricultural Engineering, Indian Council of Agricultural Research, New Delhi, Dr. Anu Appaya, Retired Senior Principal Scientist, CFTRI, and Dr. Kaushik Banerjee, Director, ICR, National Research Center for Grapes. I welcome all of you to this panel discussion. Now we request Dr. Isabel to continue.
Good afternoon. The last session. So we're going to be managing the time a little more tightly as a request from the organizers, but also we've had quite a full 2 days, and I'm sure you're going to appreciate the break and socializing a little bit just after this session. So thank you. We're going to go through the panel on innovation in food emergency response, recall, and analysis. And just before we get going, I'd like to put some contextual comments. We've heard over the past 2 days the importance of robust food safety standards and robust and agile regulations. I've also shared, the Canadian experience where we put a lot of emphasis on preventing risks. And that's, I hope, and I think it's shared by the community, the regulators, the regulator community, that prevention is the best approach, right? But you all know that despite the best food safety system, despite the best good practices in place by the industry, incidents can happen. There are new emerging risks, new hazards, new situations that people would not even have envisioned. And it's very important that in a food safety control system, we also have the response element that is robust as well. So maybe I'd like to share, like innovation and technology has been extremely helpful, of course, to develop that side of the food safety system, the response. And I'd like to share a little bit of my experience in the food safety investigation and recall stream at the CFIA, which actually I led the Office of Food Safety and Recall for 5 years before my role. So I was on the front seat to witnessing how innovation and technologies can actually make amazing progress and can actually resolve issues that you would not have been possible to resolve like several years ago. One, in my view, is the introduction of whole genome sequencing by many countries. By now in Canada, we introduced the systematic characterization of human isolates by the Public Health Agency of Canada. So they actually, when people get sick, the samples, they detect, for example, salmonellosis. They will actually run through the isolate and obtain the full genome sequencing. And this is a very powerful way of connecting similar illnesses, that we suspect from the same source. Dr. Jeb actually mentioned something on that. Alluded to that actually yesterday. So whole genome sequencing, from my experience, has been something quite provoking new solutions to issues. But here today we have many experts, not only in the food safety investigation, but also many experts in chemistry, food authenticity, food fraud, and I'm very eager to hear the perspective of other application of new technology, new methods, new analytics, how it applies actually to other types of purpose. So without further delay, I'll go through, I'm going to engage with the panel and with a series of questions. So panelists, we will probably only have time for one set of questions, and it would be very much appreciated if you can go like straight to the answer as much as possible. And then again, with the spirit of managing time, we're going to close as well with some key remarks. So, but I will get back to you. So I'm just telling you ahead of time, you can think of your takeaway as well. Okay, so let me start with Professor Giovanni Antonini from Italy. Yeah. I'd like to hear from you how the DNA sequencing and molecular analysis provided significant contribution to the identification of contaminants and the authenticity in food products.
Okay. Yes, thank you. Well, I must say that DNA sequencing and molecular analysis can solve several problems, but not all. There are, for sure, you can find exactly what are you looking for, but providing that you need sample pretreatment, you need expert technicians working in fully equipped laboratory. There is no possibility of on-site analysis. You can detect live bacteria, but also dead bacteria, which can be present. It's not really quantitative. And lastly, it is very expensive for machine and reagents. So in recent years, there was a lot of molecular analysis for microbiological analysis of food safety, but none of them has solved all the problems. At least in Europe, there is no need of official methods. You can use a proprietary method, given that has been proved to be reliable for the required analysis. And so there are several features that you can see for a method. First of all, of course, sensitivity and selectivity, or true positive rate and true negative rate that is required for the receiver operating characteristic curve. But then there is quantification. How many bacteria are present in the sample? You need to know exactly. The accuracy, you have to distinguish between pathogens and non-pathogens. For example, for E. coli, there are pathogens and non-pathogens E. coli, as you know. The reliability, to distinguish between live and death bacteria. The quickness, how many time is required for the analysis? Minutes, hours, days? It depends. And sample, what kind of sample are you treating? And not all the methods can analyze all kind of samples. Easy of use. You need expert technicians or not. Then automation. And last but not least, the cost of the analysis, of course. So my take-home message is that you have to see in detail the feature of the analysis method, and you have to choose the analytical method that best fit your needs. Okay, thank you.
Thank you. It somewhat reinforces the closing remarks from Dr. Gouda just earlier, where she said the method needs to be robust, repeatable, reproducible and fit for purpose. So you're bringing good points that DNA-based methods, they can be fit for purpose depending on the purpose. And yes, you can actually detect dead cells, etc. So thank you so much. Yeah. I'm going to turn to Dr. Jha from India. Okay, good. I'd like to hear your perspective on what are the innovative technologies that can be used in support of the food recall systems in India, which actually ensures rapid response and removal of unsafe food.
Thank you, Dr. Ishwale. I'm happy to see this kind of conference is happening, and participants from throughout the world are participating, and all worlds are having this kind of problems, food safety problems, food quality problems. I remember in 2000 when I had written first research paper and sent for publication into some European journals, and at that time it was told that this kind of things are not happening in this part of the world. Kindly publish this paper where it is happening. So I see that this part, the things which are happening here, that is happening in all our world now, and people should realize that. And similar things that India says that one earth, one health, one food, and we are now becoming the food suppliers to many countries, particularly when they need the most. So this kind of seminar, conference is very useful for not only for the country, for the whole world. I also congratulate the FSSAI, particularly for a software, for a app they have developed, having all the kinds of regulations and standards of different countries of the world. I remember when I had published a book on this aspect, it was a Herculean task to collect the standards of all the world's leading countries. So now it is at one place, and it will be very useful not only for the students, for the regulatory authority, for the food suppliers, even for the manufacturers. Now come to the topic. Few speakers have already told in the beginning that raw materials, any food safety and quality depends that how raw materials you are having. The root is the most important for driving the food quality or safety. So I say the good manufacturing practices are there, of course, in many countries and India too. So we should have a good harvesting practices also, good harvesting practices, so that the food-borne diseases are due to defects, due to some kind of injury to any food materials, should have as less as possible. Then as good as possible, the technology, I personally believe that IR spectroscopy, infrared spectroscopy in general, and then near infrared spectroscopy in particular is the most important science, which is the reply of all kind of food adulterants and contaminants at one place. Whatever techniques, as Professor Gowani told, that all those techniques, laboratory-based techniques, are very, very lengthy, and also the costly affairs. So this IR technology is so cheap and so handy that you can test the food safety factors at one place, on site itself. There is no need to bring the sample to the laboratory and then you give the report in 3 days or 5 days or sometimes in a month. By that time, many people might have consumed and have gone to sick. So there is a need of development of that IR type of handheld equipment instrument, and those instrument equipment can be kept in the supermarket, in the market, and the consumer can themselves test the food, whether it is safe, whether it is good quality or not. And accordingly, pricing can also be done. Then the RFID system, food recall, recall is important. RFID system coupled with the blockchain technology, during transportations, it's very important to know that where from this particular type of foods, whether it is fruits, whether it is vegetable, whether it is grain, anything has been originated and how many hands. So RFID tags for all the parameters during the supply chain, and also from the source it should be tagged there, and then blockchain technology should be applied for recalling the things. Then color detection, our friends in the country already have developed many kinds of color detection kits for most of the foods which are very, very small life or shelf life, and we are coupled up. We have many, those are already being marketed in India, but it requires much more efforts to reach to the most common people. Then electronic nose. We are successful to develop electronic nose, which are based on the flavors or smell of the foods with the spoilage. But again, its manufacturing is at commercial level is minimal, and we have to give more and more attention toward that, how those electronic nose for a particular foods have to be manufactured in India. Non-contact type, many instruments, many technology are available, and that also requires to be developed and employed at the field levels. And those gadgets are actually will reduce the foodborne diseases drastically. I can say that many times those simple techniques based handheld instrument is kept in the market, food market, then people will test there itself. I have seen some of the country that particularly in case of egg that such kind of instrument is kept, and consumer buy only they are satisfied with using that instrument. So it will be not only minimize, it will almost make the absent the foodborne diseases. So for the initial discussion, this much I will tell Dr. Ismail. If you will give another chance, I will speak later on. Thank you.
Thank you. I'll turn to Mr. Francisco Mapace from Mozambique. Yeah? I'd like to hear about your perspective on what you see as the emerging trends in traceability and recall management in Mozambique.
Thank you, Madam Chair. First of all, good afternoon, everyone. First of all, allow me to thank the Indian government for the invitation to attend this important event. It be a great honor not only for me, but for my country. About the emerging trends in food traceability, I can say what globally we can see. Firstly, there is a preference for online shopping by the consumer. It's what we can see currently. We can also say there is increasing the consumer concerns about the food safety. It also increases the producers' awareness. All of this issue is leading with the shopping online. Those trends, they are generating the demand of information. So we can see the consumer coming to demand more information, and the consumer also wants to know who produced, how it was produced, and how it was transported. And so I can say there is a relation with the new trends and the demanding of information. In case of the Mozambique, I can say we are facing the same situation, but mainly in the big cities. What is different in the rural areas? So we have adopted the traceability system through inspection and the supervision of the food from the origin until the final destination. So Mozambique has carried out traceability also of imported products, because mainly we more imported than exporting these products. In Mozambique, the traceability is taken by different ministries. The Ministry of Agriculture and Rural Development has the role of inspecting and supervising the points of entry, mainly by the borders. Also, they are dealing with the production and the transportation of plant and animal products. We have also involved the Ministry of Industry and Commerce that supervise the internal market. We have also involved the Ministry of Health. So those three ministries, they are doing the traceability process in Mozambique. We still have some challenge to put in place the legal framework dealing specifically with food safety regulations. We don't have, but we have in place a technical committees that is working in issue. But the main goal, I can say, is to have the legal framework in place. Just to emphasize that the technical committee is coordinating by the Ministry of Health. Thank you.
Thank you. It's interesting that you raised the change in consumer interest, and there are a lot, we see that also in Canada, there's a lot more engagement and more interest in knowing methods of production, where food comes from. So like definitely we see that all around the globe, right? Thank you so much. Professor Jeb, I know yesterday you hinted on some innovative analytics, and I'm sure you have many other examples in your bag. So I'd like, would you have any insight to offer in terms of what are the key innovation in lab testing that have enhanced the food safety investigation and recall processes?
Thank you. Fortunately, I can be quite brief because Dr. Gowda did such a fantastic presentation previously, and really, I think, set out some of the opportunities really very well. I think when it comes to keeping food safe, we need new methods for new issues of concern, so things like PFAS and so forth. But we shouldn't forget that we could also do with new methods for some old problems, so that new methods that are in some way easier or better than the ones we've already got. I was really impressed by the mobile testing unit that FSSAI have on display here, which is able to go out into the community and do very rapid tests. I think that's incredibly helpful for community sampling. But these rapid tests can also be helpful in the laboratory, where we can then prioritize samples which might need more complex or more expensive tests to really verify it. So I think, new methods for new issues and better methods for old issues. I think where we're going to see real advances is in relation to artificial intelligence, and it's been referred to a few times during this meeting. But I think when we meet again, that will be an area which has developed very fast. We're already seeing, I was at one of our big sandwich producers in the UK, and they're using AI to be able to predict when there are critical moments where there's likely to be an increase in pathogenic organisms in their foods. And I was, astonished actually at the level of technological innovation that they have. I think the other place where innovation is really needed is around greater data sharing. So greater data sharing between academia, industry and regulators. None of us can do enough sampling, and our knowledge will be better if we share what we're doing. And that will give us a much better map of where the risk occurs in the food system. But it will also give us better databases, and those databases will be absolutely vital, particularly for things like authenticity testing, where we really need a good reference data set. So I think for me, those are probably some of the key things: new method development, greater use of artificial intelligence, and much better sharing of data, and the bioinformatics really that goes around interrogating that data so that we actually draw out the insights from it. Thank you.
Thank you. I like how you portray like new method for new problems, but there's so much that we can do with our old problems in, reducing cost, improving, the speediness of results. And so thank you so much for this insightful. And I think it's a very good segue to my next question that I'd like to address to Dr. Banerjee. And Professor Jeb mentioned, the advancement of rapid test kits, but it comes with some challenge. They need to be validated method, otherwise they're not meaningful to the food industry or for regulators. And I'd like to see your perspective. There are international organizations like AOAC, AFNOR, that actually provide validation standards for such kits. And I'd like to hear your perspective on this in India, how you go about ensuring that the methods are harmonized and actually reliable for those rapid and innovative techniques.
Thank you. Good evening to all. I really appreciate this opportunity to contribute to this important session. And many thanks to FSSAI for inviting me to be a part of this program. We have a committee called RAPT, R-A-F-T, Rapid Analytical Food Testing under FSSAI. And this committee has already developed lots of regulations, procedures by which we evaluate various rapid test kits that are regarding which application is received by FSSAI. Now, thing is that, as you rightly mentioned, that there are certain international guidelines, international regulations, or standard method performance requirements by organizations like FSSAI, like AOAC International, etc. So, if a rapid test kit is already having validated with certification in relation to any of such international organization, then our RAPT committee, we usually accept it,
and we ask them for certain verification. So there are 2 points here. One is method validation, another is method verification. So as in the beginning Professor Giovanni mentioned, there are certain key points. So we talk about selectivity, we talk about sensitivity, accuracy, precision. So these are the main things based on which any rapid test kit is evaluated. So if someone says that I have a rapid test kit for aflatoxin B1 analysis, so in that case we just say first check that whether the kit is validated as per the AOSE or similar kind of bodies norms, and then if we find that that kind of certification is there, then in the next phase we expect that they should verify the application of the technique for the matrices which are planned for or which are targeted. So if once that is done, then the report is submitted to the RAPT committee. RAPT committee evaluates that, and if everything is satisfactory, then that is accepted. So we have a very well managed procedure in FSSAI for evaluating rapid test kit, and we have already evaluated and approved a large number of test kits. I think the first test kit was on Raman spectrometry based handheld device, and then now in every meeting we receive several such applications, and we provide the conclusion based on the criteria that I have already mentioned. Thank you very much.
Thank you. I don't know if I'm allowed to ask another follow-up question. When the kits are approved, do you provide them? Do you communicate them publicly? Do you have a web page? How do you
yeah,
keep
so
record
that is
of it?
basically before the government system works. I think once the kit is approved, they themselves provide lots of publicity because they receive FSSAI's approval. So that's a big recognition, and that has a splendid acceptance in the Indian community, consumers especially. Indian consumers have a lot of confidence on the FSSAI logo now, so they appreciate that.
Let me then turn to Dr. Appaya. Yes, I'd like to hear you talk about innovations in food packaging and labeling and how it contributes to traceability and recalls.
First of all, congratulations to FSSAI for organizing this event, and then a big thanks for each and everyone from FSSAI for making a stay and looking after us as a great host. Thank you. So, yes, probably we had one of the largest food recalls. I think every one of us remember the noodle recall. I come from an area where coffee is grown, and geotagging and a single estate or a single point or single origin coffee is today a very, very unified and a tradable commodity. It started off with 2 countries, South Korea and Australia, I'm sorry. But now there are plenty of countries who are interested in buying a single origin coffee. And for that, they do a geotagging, which actually takes them to exactly the same estate. In fact, many of the buyers can even see the estate owner, the laborers, working in that estate. To that extent, the systems, AI systems has gone in. Yes, Dr. Lalita Gowda was talking about the AI systems, and earlier also some of the panelists did talk about the AI systems. Today we have a number of, Dr. Banerjee was talking about how FSSAI has become a facilitator for simple devices, cost-effective devices, handheld devices, non-destructive method of estimations. One of the important things that has happened in the recent times, as our panelist from Mozambique was telling, that we are now ordering quite a lot of things online. So there are many young companies who have brought in traceability for vegetables and for what is that called as smart packaging systems and minimally processed foods. But when it comes to a cooked food, this becomes a little more complicated. That's because the number of ingredients, especially in the Indian cuisine, is extremely large. So tracing each one of them becomes quite difficult, yes. But then the spoilage systems and the freshness of the products, there are a number of startup companies which started off with nanoparticles. They started off with carbon nanotubes, and now they have plenty of nanoparticles. And it is amazing that some of those ancient techniques have been taken up to get the results. Things like the amount of respiration, the amount of glucose being utilized, the carbon dioxide being produced, or the simple methylene blue test. But then what they have done is, because whenever you have a AI-based system, you need a huge data. And these ancient methods, already there is a huge existing data. So they are data mining it and using it for the present applications. And the interesting part of using these nanotubules and nanoparticle material is some of these tests can be done, even though we say that, yes, methylene blue test takes around 24 hours or 16 hours and all that. But here, they do it within a very short period of time. Within 10 minutes, they can get the results. So, thank you.
Thank you. I'm looking at Dr. Oberoi. Need to wrap up, yes? A quick, okay, takeaway messages. I think we need to finish up soon. So who would like to volunteer for a quick takeaway?
Yeah, I'll tell something. Thank you, Dr. Iswale. Yeah, I wanted to say something which actually India and other parts of the world should do as quickly as possible for better implementation of digital technology in food safety and standards. Whatever you think that AI, sensors, all those things, as you know, that require the data. And then all speakers have already told that the food safety or quality aspect requires a huge number of data. And huge number of data, huge number of tests. It is very difficult. You will go for testing for E. coli, then you have to also test for the salmonella. Then you have to test for some other kinds of things which may come just like coronavirus, some new things. So what to be done? So I personally suggest that you must have heard about quantitative microbiology. And very little or almost no research is being done. So we should have we should develop our all safety index in quantitative form, digital form or numerical form. We have worked for quality index. We have worked for the quality index. For example, take a mango. Indian mango is the most best quality mango of the world, I can tell you, in all point of view. So we have the freshness index. Our quality index of mango, we have the overall quality index of apple also. So similarly for all the food, we have to develop one overall quality index, overall food safety index, and those indexes, I have some research, preliminary research published work that can be trained using the spectrometry. And then once it is done, then there is no need of so many tests. We can say that this food is 90% safe, or this food is 100% safe, or this food is 50% safe. That kind of quantitative food safety and quality has to be developed and to be done. Then also cold plasma system. The cold plasma system is a system which can decontaminate even if you have the, for example, milk or some other foods, juices. Very little research has been done. So we have to develop our technology at a faster rate quickly to decontaminate once the lot of foods are done. This is only one example. Then, but there are so many challenges of manufacturing those kind of instrument, and at indigenous level in India. So there is an opportunity also for many countries. For example, I know the Germany and the USA are very good in spectrometry. Their companies are supplying very good spectrometer throughout the world. So they have the opportunity to collaborate in India and make in India, as our Honorable Prime Minister always say, come with the technology, make in India, market throughout the world. Thank you very much.
Thank you. I'd like to invite other short takeaways. You do your sales pitch, so one sentence. Over to you, Professor Jeb.
So I would just say share knowledge and share data. In a global food system, very few issues are going to stay local, so we need to share and help each other. And I'd just add that this summit, I think, has been a great contribution to that knowledge sharing, not just learning new things, but meeting new people. And I'm incredibly grateful to FSSAI for bringing us all together. Thank you.
Thank you. Yeah, okay. Any last takeaway? And then we need to wrap up. Any volunteers? Okay. Yeah. Okay.
Thank you. What we feel that a comprehensive food safety program, the kind of thing what FSSAI promotes, that demands integration of multiple techniques to complement and supplement the analytical outputs. Instead of looking for specifying a method of analysis or technique, I think this is the high time that we need to emphasize more on the performance of the method in terms of accuracy and precision to comply with the dynamic regulation. I think the way this particular session was set up by Dr. Lalita Gora, that is the key message which we should take forward. Thank you.
Thank you very much. So thanks a lot for having given me the opportunity to moderate this session. My takeaway is let's share knowledge. I agree with Professor Jeb. I forgot what I wanted to say, but yeah, like continue the good work to keep the consumers' trust. At the end of the day, we're doing this for consumer safety, but to build consumer trust in authentical, wholesome food, but above and beyond safe food. Thank you so much. Thank you, panelists.
Thank you, madam, and we had a wonderful discussion. I call upon our Honorable Minister of State, Baghel Saab, to come up on the stage and felicitate all the panelists and the moderators. Yes. So, Dr. Anu Apai. Mr. Rui Aldino Francisco Maparse. Professor Susan Jeb. Our moderator of this session, Ms. Isabel Labach. Dr. S.N. Jha. Professor Giovanni Antonini. Dr. Kaushik Banerjee. Sir, on group photograph.
Thank you all the panelists and thank you to Honorable MOS sir. Now we are going to watch a short video on FSSAI initiatives and then we'll start our formal valedictory program.
Annam Parabrahma Swarupam.
Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा. अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन.
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale, and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler. Spearheading the evolution of India's food safety landscape, FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
Food safety. A genuine human concern for centuries. Kautilya, ancient India's most original thinker, described food adulteration, making it a punishable act. Other civilizations, the Egyptians, Babylonians, and Greeks, developed techniques that prevented spoilage and contamination. For 13 centuries, food safety meant preventing adulteration. A law promulgated by King John of England in 1202 AD is the first recorded instance of regulations on price, weight, and quality of bread and beer. With industrialization, food production scaled up, moved out of the home, became a tradable commodity, and therefore required regulation. In some countries, landmark legislations made food safer, addressed food adulteration and misbranding. In the 1900s, nations began to realize the link between foodborne diseases and mortality rates. In the aftermath of World War II, global cooperation became the buzzword, and soon food safety was a part of this conversation. NASA, the US Army labs, and some private players developed the HACCP in the 1960s. It was to become the pivotal food safety preventive tool worldwide. Food and Agriculture Organization and World Health Organization led to the creation of the Codex Alimentarius Commission, or simply Codex, in 1963. Codex was designed to protect public health and ensure fair practices in the international food trade. India has a long history of Codex involvement. One of the first to sign up, India's engagement with Codex has only grown. India's food safety journey reflects both national and international concerns and her response to changing times. In line with emerging complexities, consolidation of laws became the motto for nations across the globe. From prevention to a risk-based approach on food safety. In India, the Food Safety and Standards Act 2006 repealed all previous laws. In 2008, the Food Safety and Standard Authority of India, or FSSAI, was established, swiftly becoming the single reference point for all food safety related issues. FSSAI has consistently modernized and adapted its approach to global standards, keeping national requirements in mind. Today, India can proudly say that it has pioneered and paved the way for the world in evolving global food safety ecosystems.
आज आपकी जिंदगी में कौन जीत रहा है, दिल या दिमाग? अच्छा, मजे की बात यह है कि दिल और दिमाग की इस कुश्ती की जरूरत ही नहीं है, क्योंकि अगर दिमाग चाहे तो ऐसे ऐसे सिंपल तरीके निकाल सकता है जिससे दिल भी खुश और तंदुरुस्ती भी बरकरार। अगर रोज के खाने में तेल का इस्तेमाल कम करना है तो जितना तेल अभी आप डालते हैं उससे धीरे धीरे कम कीजिए, और फिर कुछ दिनों बाद और थोड़ा कम। और अगर नमक कम करना है तो भी यही, खाना पकाते समय नमक की मात्रा आप धीरे धीरे कम करते जाइए, और ऊपर से सैलेड, दही या फल पे नमक मत छिड़किए। चाय में चीनी लेते हैं, यानी कोई नहीं, लीजिए लीजिए, बस आधा चम्मच कम कर दीजिए, और कुछ दिन बाद समझ गया ना, क्योंकि तंदुरुस्ती दिल से ज्यादा दिमाग का खेल है। Start reducing your intake of sugar, salt and fat from today.
Annam Parabrahma Swarupam.
Food is God's gift to us, reflecting the richness of its diversity. India's culinary traditions carry an opulent cultural heritage.
From aromatic spices of the south
to fresh mist of the east and all the sizzles and drizzles in between, Indian cuisine is truly a rainbow on the platter. According to ancient Indian philosophy, we are what we eat. Prime Minister Modi, in the 51st edition of his address to the people, Man Ki Baat, highlighted that a strong nation is built on the foundation of healthy and hygienic food.
जब भारत स्वच्छ होगा, स्वस्थ होगा, तभी भारत समृद्ध भी होगा। अच्छे स्वास्थ्य के लिए सबसे आवश्यक है पौष्टिक भोजन।
India has a staggering 7,200,000 FPOs dotting its sprawling landscape, including large operating chains to street vendors. Ensuring food safety at this scale is a Herculean task. To tackle this massive challenge head-on, the Indian government introduced the Food Safety and Standards Act 2006. This landmark legislation gave rise to the Food Safety and Standards Authority of India, also known as FSSAI, an apex body entrusted with the responsibility of establishing science-based standards for food items and overseeing their production, storage, distribution, sale and importation. Under the watchful wings of the FSSAI, a remarkable alliance thrives. A scientific committee and 21 panels comprised of over 200 experts from prestigious scientific institutions. These brilliant minds, guided by the Food Authority, tirelessly set new standards that strengthen the nation's food safety ecosystem. At the core of this comprehensive system lies the strength of 246 state-of-the-art food testing laboratories. Constantly vigilant, they form a bulwark against the perils of foodborne illnesses, ensuring the safety and well-being of the people. India proudly houses the world's largest network of mobile food testing laboratories, Food Safety on Wheels, which brings food testing facilities to the nation's remotest corners. FSSAI conducts regular surveillance drives through random sampling, with the focus on preventive healthcare and the vision of bringing about changes that are large-scale and sustained. The Eat Right India movement was launched in 2018. The transformative nationwide campaign seeks to educate consumers, revolutionize the conversation surrounding food safety and standards, and pave the way towards a healthier nation through initiatives like Eat Right Campus, Eat Right Schools, Eat Right Places of Worship, Eat Right Stations, Eat Right Street Food Hubs, Eat Right Fruit and Vegetable Markets. In less than a decade, FSSAI has embarked on a remarkable journey of transformation, transitioning from an enforcer to an enabler, spearheading the evolution of India's food safety landscape. FSSAI has played a pivotal role in fulfilling the pledge of Swasth Bharat.
Food safety. A genuine human concern for centuries. Kautilya, ancient India's most original thinker,
Ladies and gentlemen, we are going to be just starting with our last session, the valedictory session. Just waiting for our respected Secretary Health joining us. He's going to be joining any time now. We already have our Honorable Chief Guest for the session, Shri Suman Beriji, a very eminent policy economist and a research administrator present with us. We have, of course, our Professor S.B. Singh Baghel, sir, the Honorable Minister of State for Health and Family Welfare. And also joining us will be our respected Secretary Health, Shri Rajesh Bhushanji. As soon as he's here, we are going to be then starting with the valedictory session. And though this is a concluding session, the last session, but I think all of you agree that this marks the beginning of drafting a very compliant and a implementable way forward so that we can ensure more safe, sufficient, good quality, healthy food and more sustainably food for our people, and that's going to be ensuring more good health of our people and our planet. So we thank you all for to all of you for sharing your experiences, your expertise, your knowledge. And as the food regulators from more than 40 plus countries are present with us, these discussions and deliberations were more aimed towards strengthening of our food regulatory and the food safety environment, setting up a framework towards that. And all of yours contribution is going to be helping a lot all the countries in achieving their sustainable development goals, and more also towards the targets which each of the countries have set towards the climate change and the net zero targets which countries are approaching. So thank you for that. And as we just wait for respected Secretary Sir also, in case any of you want to extend some feedback, share your experiences, kindly feel free. We would love to hear from you. We'll just pass on the mic to you. If you wish to share anything which you want or you feel should have also been discussed, we have not covered that. Probably your suggestions is going to be helping us a lot in taking it later. Yes, sir. So we have, can you just pass the mic, please?
In today's discussion, we learnt about the contaminants and the pesticide residue also. But the question comes, pesticides will be applied in the case of rice when the plant is growing. At that time, they are going to apply the pesticide, and the paddy grains will receive the pesticides. But these pesticides will go out when you dehusk it. Paddy, when you remove the husk, is a dehusked rice. And that dehusked rice is polished to remove the bran. Then you are going to get the milled rice. Now, this milled rice, before cooking, we try to wash once. Now the question comes, where the pesticide residues left over, because as per the literature and what we are finding, this is somewhat different it is. The data, how far it is correct, what is the pesticide residue measured in the rice? There is a question mark. That is one point. Now, we were informed that we have to follow Codex Committee for all this. Now, Codex Committee, whatever they have made rules and regulation in the world, what it will be, it is not possible to apply to our country in all respects. Wherever required, we can take the Codex Committee information. But in all respects, Codex Committee information cannot be taken. For example, they ask us to store a grain at a higher moisture content, but our country it is not possible. We have to keep the moisture content less. In other aspects also, everywhere following Codex Committee is not at all correct. Because wherever you go, for example, different countries, the population is hardly 3 crores, 4 crores, 6 crores, the whole country. Australia hardly 4 crores. UK hardly some 8 crores, something. But our country population, to that country, whatever we have to do something, we have to make our own standards before copying something from the Codex. Like BAS, they are making some arrangements in BAS, and that we are trying to follow. That's what is made by us, whatever possible. In that way, directly following Codex, how far it is correct. These are some 2 points I want to share. Thank you.
Thank you, sir. So your suggestion, more specific country-wise standard formulations. Any observations or experience sharing of these 2 days? If I can request especially our international delegates, your experience of India, anything you wish to, have you been able to go around and visit some of the places or something, whatever you wish to share? And yes, of course, very specific to the conference. So, but we'll definitely request that once we close here, if you can extend your feedback regarding the conference, you can please share it later with our representatives. Thank you. So, ladies and gentlemen, the information which we just got was the respected Secretary, sir, is slightly stuck in the traffic. He's going to be taking some time. So, we'll begin with our valedictory session. And I would like to invite... Oh, he's here. So let me invite our distinguished speakers of the valedictory session, the concluding session, the last session. And at the very onset, in fact, would like to thank you all, as our Honorable Minister of Health and Family Welfare in the inaugural session had mentioned that we need to take a more holistic view and a more balanced approach towards, as we talk about strengthening these standards and ensuring more safe and sustainably produced food for all. So throughout these 2 days, the views which have been expressed, the very constructive suggestions and recommendations which have been extended by all of you, it is time now to connect these dots and plan a more constructive way forward. So I invite our distinguished eminent speakers of the valedictory session, inviting Shri Suman Beriji, the Vice Chairman of Niti Aayog, Professor S.P. Singh Baghel, sir, the Honorable Minister of State for Health and Family Welfare, our respected Secretary Health, Shri Rajesh Bhushanji, and Shri G. Kamala Vardhana Raoji, the Chief Executive Officer of the Food Standards and Safety Authority of India, Ms. Inoshi Sharma, the Executive Director of FSSAI. Ladies and gentlemen, as we now look forward to drafting this way forward, once again we have our very eminent leaders, visionary leaders who have joined us, who have much experience and expertise in the realm of public administration and policy formulation. Shri Suman Beriji is an eminent policy economist, a research administrator, currently holding the position of Vice Chairman in Niti Aayog with the rank and the status of a Cabinet Minister after having served the World Bank for more than 28 years. His professional writings have focused on various important areas such as political economy, development economics, financial sector, banking reforms, energy trends, and policy. And as Vice Chairman of Niti Aayog, he is playing a very crucial role in shaping the policies and strategies to drive sustainable economic growth and development in India. We thank you, sir. And I would like to request Ms. Inoshi Sharma, the Executive Director, FSSAI, to please accord a very healthy welcome with this special bouquet we have of millets. India and the world is celebrating this year as the year of the International Year of the Millets. We would also like to welcome Professor S.V. Singh Baghel, sir, the Honorable Minister of State for Health and Family Welfare. With a very strong background in public health and a deep commitment to the well-being of citizens, he's been playing a very pivotal role in shaping and implementing the policies to improve the healthcare services across the nation. And we've also been joined by our respected Secretary, sir, Shri Rajesh Bhushanji, respected Secretary Health. His experience and expertise, ladies and gentlemen, has contributed immensely to the strengthening of the healthcare system, promoting more healthcare access, affordability, and addressing critical health challenges. So the views, their expressions today is going to be really leading us towards strengthening and building a more robust and efficient food regulatory environment and framework. So at the very onset now, I would like to request and invite Shri G. Kamala Vardhana Raoji, our Chief Executive Officer of FSSAI, to kindly present an overview of these 2 days of extensive discussions and deliberations which we have had. Inviting you for your address.
Namaskar and good evening. I really don't want to take much of your time because we are already running late by almost all 20 minutes. And many of you are catching your flight in the evening. Respected Secretary, Minister of Health and Family Welfare, Government of India, Sri Rajesh Bhushanji. Honorable Minister of State for Health and Family Welfare, Government of India, Professor S.P. Singh Baghel, sir. Sri Suman Beri, Honorable Vice Chairman, Niti Aayog, my colleague Hinoshi Sharma, and all the delegates, dignitaries who came from various parts of the world and within in India, research professors, doctors, ladies and gentlemen. All of us have witnessed many international events earlier in our lives. I also participated in many of the international events, but the kind of involvement with which you people have attended since 9 o'clock yesterday morning till 6 o'clock today, all the 2 days, it is something astounding, and it's very, very significant. I congratulate all of you for participating, coming from all over the world. I thank you profusely on behalf of Ministry of Health and Family Welfare, Government of India, that all of you have come here to participate. Various sessions with intent, so much of intent you have participated here. Yesterday, while inaugurating the conference, our Honorable Minister for Health, he has already mentioned that it's so important for setting standards for the food, and he mentioned that we should think about the crops and the crop pattern and the DNA of the crops, and how we should set the standards from country to country, from within the country, from place to place. Re-emphasizing the same, our Agriculture Minister, Sri Tomarji, he also mentioned about the cultivation patterns and the vagaries of monsoons, and the kind of insecticides that can enter the crops. Various aspects he covered, and shown us the vision about how to conduct this conference for 2 days. India is presiding over G20, as all of you know, and the Sherpa of G20 has mentioned about the international collaboration, and it's an opportune time that all of us come together and try to set standards which is easily accessible to each other by harmonizing one set of standards with other countries. The way the session started, it started with a global regulatory framework, and how you participated like students. All of you are professors and doctors, but the way you are attending are like students in the classroom with so much of dedication and intense participation. I really like to see, I liked watching all of you participating like that, like students. Giving us the international picture, Mr. Raj Rajshekhar, the Codex Alimentarius Commission, who just left, he had to catch a flight there. He has given a global picture of how every country is coming out with the standards and trying to harmonize with the Codex Alimentarius. And Dr. V.K. Paul is a member of Niti Aayog, has also spoken extensively about the setting of the standards and the quality of the food that is eaten. Isabella Labaj, the Chief Food Safety Officer of Canada, she spoke. And Rajesh Kumar Singh, the Secretary from DPIT. You must have seen many secretaries have participated. They chaired some of the sessions, moderators like Secretary Minister of Food Processing, Secretary Animal Husbandry, and Secretary DPIIT, that is Department of Promotion of the Industry and the Internal Trade. He mentioned about the tariff barriers. He mentioned about the ease of doing business. And Mr. Gopalakrishnan, who was ex-CEO of FSSAI, he mentioned about how Food Safety and Standards Authority of India functions, and what is the kind of how many standards that we have set in, and all that you mentioned, and how many people have participated in this session. Bhutan, Mozambique, New Zealand, Mauritius, USFDA, Brazil representatives have participated. The session moderated by Mr. Sanjeev Chopra. Next was antimicrobial resistance challenges and solution of the global food safety. Was a special session was addressed by Mr. Love Agarwal and Mr. Sridhar Dharmapuri from FAO regional office, and the session was participated by Latvia, Bangkok, the National Center for Disease Control, and Australian High Commission here in the parallel session. Next session was the best practice and robust standards of setting framework, and there you spoke about the food chain. The special address was given by Anita Praveen, who is the Minister of Food Processing, and she mentioned about various aspects about the food process, new food items which is coming up in the market. And next was Ayush Secretary I think perhaps India is the only country in the world which has got an exclusive ministry for promoting these traditional medicine, traditional knowledge systems in the medical field. Like Ayush is Ayurveda, Unani, Siddha, and homeopathy. He spoke up extensively about the strengths of the knowledge systems here. Then the panel discussion was on health and supplement nutraceuticals. Codex spoke about officials from Codex. They spoke about prebiotic and probiotic. The next session was on contaminants and risk mitigating regulatory interventions. People spoke about the spices, how 40% of the 47% of spices in the world produced in this country, and 10 million tons of spices are produced in this country and exported. And we have seen the presence of, again, Bhutan, Mozambique, and on organic foods. There was active discussion about the organic foods because everybody is talking about organic food. Yesterday I've seen Sadhguru, Mr. Sadhguruji also spoke about organic food. He said everything is organic, right? There's nothing called inorganic. Then we had a very vibrant session on animal feed. Animal feed is very, very important now because it is part of the food value chain, and the feed which is eaten by the poultry, the buffaloes, the cows, fish, they have their direct impact on the human health. Then last session was on innovation in food emergency response and recall analysis. Testing methodology were discussed, and they said that what we see, whether it is true or not, whatever food that we are seeing. There's somebody mentioned about the honey, which is a non-identifiable sugar syrups. So then along with this, we also had a session on a session with the CEOs of multinational companies and the national companies, national manufacturing companies. We spoke about extensively on health nutraceuticals and health supplements. Now the point is that is after organizing 2 days of international conference, this will definitely pave way for further negotiation, further deliberations on setting standards. We are learning from you and you are learning from us. And as Honorable, I would like to repeat this, that as Honorable Prime Minister Narendra Modi ji said, this is one earth and one family, and it is definitely one food, because American food is eaten in Australia, Australian food, Japanese food is eaten in Middle East food is eaten in Russia. So let us go ahead with this and let us listen more from the dignitaries today who have come here for the valedictory session. And I thank you once again profusely from the Ministry of Health and Family Welfare, Government of India, for participating this 2-day session. Thank you.
Thank you, sir, for sharing your observations and the key takeaways of these 2 days. And now I request our respected Secretary Health, Shri Rajesh Bhushan ji, for his special address.
Honorable Vice Chairman Niti Ayog, Shri Suman Beri ji, Honorable Minister of State for Health and Family Welfare, Professor S.P. Singh Baghel ji, my colleague Shri G. Kamalvardhan Rao, Chief Executive Officer of Food Safety and Standards Authority of India, Ms. Inoshi Sharma, Executive Director, Food Safety and Standards Authority of India, multiple food regulators representing different countries who've been part of this 2-day deliberation, some of whom are still physically present in this room, distinguished delegates, members from the industry and the corporates, ladies and gentlemen. I am indeed pleased to be part of this closing function of this 2-day forum, and I've been briefed of the deliberations on day 1 and today, day 2. I'm glad that in this summit we've been able to stimulate mutually productive and very fruitful discussions over 2 days. There has been a very active engagement of global experts, national experts, policymakers, industry members, and all other relevant stakeholders. The discussions have also covered a wide range of subjects from food safety, antimicrobial resistance, animal feed, its safety, contaminants, residues, best practices, organic food, so on and so forth. So what is important is the fact that we have underlined the need for a continuous and a comprehensive collaboration between national agencies and global agencies. What we have tried to underline over these 2 days is the fact that food standards and food safety are not the exclusive domain of those entities that actually set or prescribe these standards. It is a multi-stakeholder exercise. The farmers are involved, the food chain managers are involved, the manufacturers are involved, people who process the food are involved, the food industry in its various aspects is involved. So therefore, whenever we deliberate on these matters, we need to hear all these voices. We also discussed the various aspects of food handling, food storage, food preparation, how to prevent foodborne illnesses, and then in that wider context, understand the role of regulatory agencies in ensuring that our food safety standards are not only robust, but they are also dynamic. They evolve with the times as our agricultural practices change, as our technology changes, our regulatory system has to keep pace with it. We have also discussed the sustainability aspect of this entire exercise, issues relating to food waste, issues relating to adoption of environmentally friendly packaging and processing methods. So these are elements going ahead that will continue to engage the attention of global regulators, national industry, global industry, consumer organizations, so on and so forth. So therefore, a comprehensive and multifaceted approach. Our focus at the end of the day should be on responsible use of the limited resources that we have, good agricultural practices, good manufacturing practices, very robust surveillance systems, a focus on research and innovation and international cooperation. I am sure that tackling these challenges collectively will help us to ensure safety and security of the food that we all eat. And I also hope that your presence over 2 days would give necessary fillip to this process of national collaboration between different stakeholders and international collaboration, and we will move continuously towards improvement in food safety and food quality standards within our country and globally. I once again thank the Food Safety and Standards Authority of India for this initiative of bringing all the stakeholders together, and I hope that this triggers a process which will then become an institutionalized process of ensuring that all of us gather at regular intervals to exchange thoughts, practices, and the way ahead. So once again, my best wishes are to all of you. Thank you. Namaste.
Thank you very much, sir, for your very constructive suggestions and recommendations towards building a more robust and dynamic regulatory framework with due respect and voice of all stakeholders. Thank you. And I now request our Honorable Minister of State for Health and Family Welfare, Professor S.V. Singh Baghel ji, for his address.
मंच पर बैठे हुए योजना आयोग के वाइस चेयरमैन श्री सुमन बेरी जी, श्री राजेश भूषण, सेक्रेटरी मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर, श्री जी कमला वर्धना राव, चीफ एजुकेटिव ऑफिसर FSSAI, मिसेज जानवी शर्मा, एजुकेटिव डायरेक्टर FSSAI, FSSAI के सभी अधिकारी और कर्मचारी, delegates from countries world over, industries friends, friends from media, ladies and gentlemen. मैं इस अवसर पर इस 2 दिवसीय वैश्विक खाद्य नियामक शिखर सम्मेलन 2023 के दौरान विश्व भर से आए हुए सभी प्रतिभागियों, कोडेक्स एलिमेंटेरियस और विश्व खाद्य संगठन जैसे अंतर्राष्ट्रीय संगठनों के प्रतिनिधियों, राष्ट्रीय और अंतर्राष्ट्रीय अनुसंधान संस्थानों और विश्वविद्यालय के वैज्ञानिक समुदाय की भागीदारी और योगदान की सराहना करना चाहूँगा। मैं वैश्विक खाद्य नियामकों को एक मंच पर लाने वाले इस अनूठे शिखर सम्मेलन की मेज़बानी करने के लिए भारतीय खाद्य सुरक्षा और मानक प्राधिकरण को विशेष रूप से बधाई देना चाहूँगा। भारत की G20 अध्यक्षता के संदर्भ में इस शिखर सम्मेलन ने वैश्विक स्तर पर खाद्य सुरक्षा के विषय को प्रकाशित करने का एक अनूठा अवसर प्रदान किया है। भारत न केवल विश्व के सबसे बड़े खाद्य उत्पादकों में से एक है, बल्कि इसके पास विविध पाकशाला की विरासत भी मौजूद है। अतः यह हमारी जिम्मेदारी है कि हम सतत और सुरक्षित खाद्य सुरक्षा प्रणालियों की रक्षा करें एवं इसे आगे लेकर जाएं। G20 संवादों में खाद्य सुरक्षा संबंधी चर्चाओं को एकीकृत करते हुए हम अंतर्राष्ट्रीय सहभागिता को बढ़ावा दे सकते हैं, सर्वोत्तम अभ्यासों के साझा कर सकते हैं और पूरे विश्व में हमारी खाद्य श्रृंखलाओं की सुरक्षा सुनिश्चित करने के लिए हम मजबूत रूपरेखा का विकास कर सकते हैं। भारत इस वर्ष की G20 की अध्यक्षता कर रहा है। इस अवसर पर हजारों वर्षों पहले लिखे गए महोपनिषद से एक श्लोक आपको सुनाना चाहूँगा। अयम निजा पारो वेति गणना लघु चेतसाम उदार चरितानाम तु वसुदेव कुटुंबक। इसका अर्थ है कि दिस इज माइन, दैट इज हिज, से द स्मॉल माइंडेड, द वाइज बिलीव दैट द इंटायर वर्ल्ड इज ए फैमिली। अर्थात ये मेरा है, ये पराया है, ऐसे छोटे विचार के व्यक्ति करते हैं। उच्च चरित्र वाले लोग समस्त संसार को एक ही परिवार मानते हैं। भारत इसी सिद्धांत पर चलता है और अपने साथ साथ पूरे विश्व के कल्याण के लिए काम करता है। हमारे आदरणीय प्रधानमंत्री जी के मार्गदर्शन में G20 की थीम जो इसी आशय पर केंद्रित है, वन फैमिली, वन अर्थ, वन फैमिली, इवन वन हेल्थ आल्सो। ऐसे ही एक और श्लोक है जिसे लोक क्षेम मंत्र कहते हैं। ये विश्व के लोगों को बहुत आश्चर्य लगेगा कि हजारों साल पहले हमारे वेदों में, उपनिषदों में, ऋचाओं में, बल्कि रामायण में, रामचरितमानस में, भागवतों में ऐसी चीज़ें लिखी गई हैं जो दुनिया जिन पर आज बहस कर रही है। ये दुनिया के दूसरे देश के लोगों के लिए बहुत ही ये एक समझने वाली बात होगी। हम तो रोज कहते हैं कि ओम सर्वे भवन्तु सुखना, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु मां कश्चित् दुख भाग भवेत्। It means may everybody be happy, may everybody be free from disease, may everybody see only the good and may no one suffer. अर्थात संसार के सभी प्राणी सुखी रहें। मुझे लगा इसी अवधारणा पर हम आज यहाँ पर बैठे हुए हैं। सभी प्राणी रोग आदि कष्टों से मुक्त हों, संसार के सभी प्राणी सुखी रहें, संसार के सभी प्राणियों का जीवन मंगलमय हो और संसार का कोई प्राणी दुखी न रहे। भारत सरकार के स्वास्थ्य मंत्रालय का भी मूल मंत्र यही है, अपने हर कार्य में यह सुनिश्चित करती है कि बिना भेदभाव के पूरी जनता को उत्कृष्ट स्वास्थ्य सुविधा मिले और हमारे साथ साथ दुनिया के अन्य देशों से भी हम इस दिशा में सहयोग करें। अच्छा भोजन निरोगी काया के लिए सर्वप्रथम आवश्यकता है। भारत सरकार लोगों के लिए सुरक्षित और गुणवत्तापूर्ण भोजन सुनिश्चित करने के लिए प्रतिबद्ध है। नई फूड टेक्नोलॉजी और उत्पादों के आगमन से खाद्य सुरक्षा चुनौतियों का भी विस्तार हो रहा है, इसलिए यह आवश्यक है कि रेगुलेटर्स को और भी अधिक प्रासंगिक बने रहने की आवश्यकता है। प्राचीन काल से भारत के लोगों की खान पान की रीति सात्विक और स्वस्थ रही है और खाद्य पदार्थों में मिलावट नहीं की जाती थी। आधुनिक युग में सब व्यवस्थाएं कमर्शलाइज होने के कारण मिलावट और असुरक्षित खाद्य पदार्थ बाजार में आ गए हैं। आपको मैं अवगत करना चाहूँगा कि प्राचीन भारत में जिस भोजन से आपका शरीर स्वस्थ रहता है उस भोजन को ईश्वर मानते थे। भोजन से पहले एक मंत्र का उच्चारण किया जाता है जिसे भोजन मंत्र कहते हैं। मुझे लगता है दुनिया में केवल भारत ही ऐसा देश है जहाँ भोजन की थाली आने पर हम पद्मासन में बैठ करके हाथ जोड़ करके, और कई बार तो मैं देखता हूँ एक छोटा सा टुकड़ा उस भोजन में से निकाल करके उसको हम पृथ्वी को अर्पित करते हुए और जल हाथ में लेकर के चारों तरफ घुमाते हुए और अपनी कृतज्ञता को ज्ञापित करते हैं। तो ये इसकी अनुवाद ठीक से अगर कर दें, ब्रह्मार्पण ब्रह्म महर ब्रह्माग्नोम ब्रह्मणाहुतम ब्रह्म्यो तेन गंतव्यम ब्रह्म कर्म समाधिना। मुझे लगता है 5000 साल पुराना ये लिखा गया है। ओम शांति शांति शांति। मीनिंग, द आइटम वी यूज टू फीड अवर सेल्फ आर पार्ट ऑफ गॉड। द फूड itself is God. The fire of hunger we feel is God. We are part of God, and the process of eating and digesting the food is the action of God. Finally, the result we obtain is God. मुझे नहीं लगता है कि दुनिया की किसी सभ्यता संस्कृति में ये कहा जाता होगा। अतः यह मंत्र गीता में 4th अध्याय का 24वां श्लोक है, जिसका अर्थ है यज्ञ में अर्पण अर्थात शुरुआत भी ब्रह्म है और हवन किए जाने योग्य द्रव्य भी ब्रह्म है। ब्रह्म रूप कर्ता के द्वारा ब्रह्म रूप अग्नि में आहुति देने की क्रिया भी ब्रह्म है। इस ब्रह्म कर्म में स्थित रहने वाला योगी द्वारा प्राप्त किए जाने वाला योग्य फल भी ब्रह्म है। ये भोजन मंत्र था कि ओम सह नाव वस्तु सहनो भुनक्तु सह वीर करवाहे तेजस्वनाधीतम वस्तु माँ विद्विषाव। ओम शांति शांति शांति। मीनिंग, ओम मे ही प्रोटेक्ट अस बोथ टुगेदर, may he nourish us both together, may we create energy together, may our study be vigorous and effective, may we not hate any। ये गुरु शिष्य परंपरा है। अर्थात ये बहुत प्रसिद्ध मंत्र जैसे स्कूलों में, विद्यालयों में, गुरुकुलों में सिखाया जाता है। ये कठोपनिषद का श्लोक है। इस मंत्र का अर्थ है कि सर्वे हे सर्व रक्षक परमेश्वर, हम दोनों माने गुरु और शिष्य की साथ साथ रक्षा कीजिए, हम दोनों का साथ साथ पालन कीजिए, हम दोनों साथ साथ शक्ति प्राप्त करें, हम दोनों की शिक्षा ओजमयी हो, हम परस्पर कभी द्वेष ना करें। कहा जाता है कि आप जिस भी माहौल में भोजन करते हैं आपके शरीर में उसी माहौल से संबंधित रसायन का निर्माण होता है। यदि आप भोजन करते समय क्रोध करते हैं तो आपके शरीर में हानिकारक रसायन और शांति रहने से लाभकारी रसायन का निर्माण होता है। इसलिए खाने से पूर्व इस मंत्र का उच्चारण किया जाता है ताकि भोजन शांति से किया जाए। ये बफर सिस्टम वगैरह भी आ गया है, वरना हम लकड़ी के पट्टे पर बैठ के ही भोजन किया करते थे और भोजन हमेशा एकांत का हुआ करता था और भोजन करते हुए बात नहीं होती थी क्योंकि श्वास नली में भोजन जा सकता है। इसका वैज्ञानिक कारण यह था। खैर, सही भोजन, स्वस्थ भोजन, स्वच्छ भोजन सही तरीके से ग्रहण करने से हम स्वस्थ जीवन जिएंगे। मुझे लगता है कि हमारी माँ कहा करती है, शायद दुनिया में ना कहा जाता हो, कि एक कौर को 32 बार चबाना है। और मैंने देखा है कि जब जब मैंने भोजन निगला है जल्दी में, जैसे सुबह पोर्टिको में आ गया था, तब मैं कार को साइड में खड़े करके कुछ निगल रहा था, लेकिन जब हम चबाते हैं तो मुझे लगता है कि 10 गुना स्वाद भी बढ़ जाता है। तो बोझ कमने की योगदान दे सकेंगे। निरोगी काया प्राप्त करने के लिए स्वच्छ भोजन के अलावा योग भी एक उत्तम विकल्प है। वर्ष 2015 में हमारे आदरणीय प्रधानमंत्री जी के अनुरोध पर संयुक्त राष्ट्र संघ ने 21 जून को अंतर्राष्ट्रीय योगा दिवस घोषित किया और गत माह संपूर्ण विश्व ने 9वां योग दिवस मनाया था। और संयोग से मेरा बर्थडे उस दिन है, इसलिए उस दिन दुनिया के सभी राष्ट्राध्यक्ष, सैनिक तानाशाह हों या राजा रानियाँ हों या लोकतांत्रिक पद्धति से चुने हुए प्रधानमंत्री हों, भारत के योग को करते हैं। इस 2 दिवसीय बैठक में इस बात पर चर्चा की गई कि व्यापक खाद्य सुरक्षा प्रणाली होना अत्यंत महत्वपूर्ण है और खेत से हमारे खाने की प्लेट तक खाद्य आपूर्ति श्रृंखला के सभी चरणों में खाद्य सुरक्षा का महत्वपूर्ण योगदान है। हम हमारे माननीय स्वास्थ्य और परिवार कल्याण मंत्री जी के दूरदर्शी विजन से खाद्य सुरक्षा निरीक्षण को सुव्यवस्थित करने, निगरानी प्रणालियों को बढ़ाने और मजबूत प्रवर्तन तंत्र स्थापित करने, उसके द्वारा सर्वश्रेष्ठ खाद्य सुरक्षा प्रणाली सुनिश्चित करने की दिशा में आगे बढ़ रहे हैं। हम उपभोक्ताओं को अपने पसंदीदा भोजन के बारे में सूचना उपलब्ध कराकर उसे सशक्त बनाकर खाद्य सुरक्षा प्रदान करने की दिशा में भी काम कर रहे हैं। उत्कृष्ट खाद्य सुरक्षा सुनिश्चित करने के लिए खाद्य पदार्थों के पोषण के बारे में उपभोक्ताओं को सटीक जानकारी देना अनिवार्य है, जिससे वह इस बारे में जागरूक रहें। FSSAI ने सभी के लिए सुरक्षित और स्वस्थ भोजन सुनिश्चित करने और देश की खाद्य प्रणाली को बदलने की दिशा में 2018 में ईट राइट इंडिया मूवमेंट शुरू किया। इसके अलावा उन्होंने फूड सेफ्टी इंडेक्स को भी विकसित किया है, जिससे विभिन्न राज्यों के खाद्य सुरक्षा संबंधी मापदंडों का आकलन किया जा सके। वैश्विक खाद्य सुरक्षा के लिए हमारे आदरणीय प्रधानमंत्री जी ने पोषण और पर्यावरणीय लाभों के लिए श्री अन्न को अपनाने और खाद्य पदार्थों की बर्बादी को रोकने और उर्वरक के वैकल्पिक मॉडल विकसित करने का आह्वान किया है। हम इस पहलों को आगे ले जाने में अवश्य सफल होंगे, ऐसा मेरा विश्वास है। मैं मानता हूं कि खाद्य प्रसंस्करण उद्योग एक बढ़ता हुआ क्षेत्र है और स्वस्थ भोजन के विकल्पों में बदलाव लाने के लिए एक महत्वपूर्ण हिस्सा माना जा रहा है। इसके लिए सघन अभियानों और विज्ञापनों की मदद से देश भर में जागरूकता फैलाने के प्रयास किए जा रहे हैं। मुझे लगता है कि इस 2 दिवसीय समुद्र मंथन से या वैचारिक मंथन से या नॉलेज एक्सचेंज से निश्चित तौर से कुछ ना कुछ अमृत निकलेगा और ये अमृत विश्व के जनता के स्वास्थ्य के जरूर काम आएगा। मैं जब छोटा था, जब मैंने विभाग का लिखा हुआ पढ़ दिया है, लेकिन मैं कुछ बातें आपसे शेयर करना चाहूँगा। जब हम छोटे थे तो मुझे अभी 6 महीने पहले पता चला है कि जिसको हम जिंदगी भर खाते रहे उसको मिलेट्स कहा जाता है, क्योंकि सिंचाई के साधन नहीं थे उन दिनों। रहट से सिंचाई होती थी जो पूरे एक दिन में 1-2 बीघा सिंचाई हो पाती थी। ढेकली होती थी, बेड़ी होती थी। ये शब्द मुझे अब ड्राइंग करके अपने बच्चे को बताने पड़ते हैं। तो जमीन उपजाऊ तो थी, लेकिन जुताई अच्छी नहीं हो पाती थी, क्योंकि मैंने अपने बचपन में 2 बैलों से हल थोड़ा सा चलाया है, जिसको पूरे दिन में 2 बीघे जोत पाते थे। अचानक ट्रैक्टर आ गया, खेत मलाईदार हो गए, ट्यूबवेल आ गया, सिंचाई होने लगी, तो जो मिलेट्स होते हैं उसकी पैदावार समाप्त हो गई। मिलेट्स गरीब इसलिए खाता था कि उन्हीं के खेत ज़्यादा अच्छे नहीं होते थे, क्योंकि उनके पास हैरो नहीं था, उनके पास ट्रैक्टर नहीं था, उनके पास हल था, उनके पास रहट थी, उनके पास ट्यूबवेल नहीं था। तो सिंचाई के साधन कम होते थे, तो बहुत अच्छे खेत जुताई नहीं कर पाते थे और सिंचाई नहीं कर पाते थे। इसलिए वो बाजरा, ज्वार, मक्का आदि, रागी, कोदो, ककनी, ये वाली फसल किया करते थे। तो मुझे याद आ रहा है कि तब हम पैदा कम करते थे, लेकिन अच्छा बहुत पैदा करते थे, क्योंकि कंपोस्ट खाद पड़ा करती थी। कि आप विश्वास कर पाओगे कि 1970 में मैंने पहली बार यूरिया को देखा। तो मुझे नहीं पता था ये यूरिया है, मैंने अपने दूध में चीनी समझ के यूरिया को डाल लिया। तब तक हमारे गांव में कंपोस्ट खाद, गोबर की खाद या सन या ढेंचा, हरी खाद का हम प्रयोग करते थे। पहली बार यूरिया आई, मैं नहीं जान पाया कि ये यूरिया है, और ऐसे जब खेत में डाली गई तो बिल्कुल ऐसे अमृत के रूप में थोड़ी थोड़ी। लेकिन आजकल जब मैं अपनी कॉन्स्टिट्यूंसी में आलू की फसल के समय जाता हूँ तो पूरी ज़मीन सफ़ेद होती है डीएपी से और यूरिया से। मुझे लगता है इस विषय पर भी चर्चा जरूर हुई होगी। मेरे घर में आने वाली, मैं जब बचपन में बैंगन या भिंडी या सब्जी खरीदने जाता था तो बहुत देर बैंगन छांटते थे तो भी कीड़े वाला बैंगन, एक आध छेद वाला जरूर मिलता था। घर में डांट पड़ती थी। पालक आती थी, उसमें कुछ छेद हुआ करते थे। मटर में पूरा कीड़ा निकला करता था। लेकिन पिछले 10 साल से घर में आने वाली सब्जी में एक भी कीड़ा नहीं दिखाई पड़ा है। इसका मतलब है कि पेस्टिसाइड्स का अंधाधुंध प्रयोग हुआ है। तो वो विषय के विशेषज्ञ बताएं कि जो कीड़े को मार सकता है, तो जब हम वो सब्जी खाएंगे, और महिलाएं केवल इतना करती हैं कि उसको एक बार पानी से धो लेती हैं केवल, उस धोने से धूल हटती है, लेकिन मुझे लगता है कीटनाशक नहीं हटता है। तो किसी न किसी रूप में वो हमारे शरीर में आता है और कहीं न कहीं बीमारियों के कारणों में से एक कारण वो होता है। जब हम गरीब थे तब भैंस के बच्चे को हम एक स्तन पूरा पिलाते थे, गाय के बच्चे को पूरा चौथा थन उसका होता था। मेरी माँ कहती थी कि दूध उसी का है, लेकिन चूंकि हम भोजन कराते हैं गाय को, इसलिए हम भी दूहेंगे, लेकिन एक थन तो उसी का है। आजकल वो ना दूध पी जाए इसलिए दूध ना पिला के उसको मार दिया जाता है, और उसके खाल में भूसा भर के भैंस को सुंघाया जाता है। कुछ डफर टाइप की भैंसें 2-4 दिन बेवकूफ़ बन जाती हैं और दूध दे देती हैं। बाद में एंटीटॉक्सिन, यही कहते हैं ना उसको, वो इंजेक्शन लगा करके भैंस को, ऑक्सीटॉक्सिन, हाँ मैं विज्ञान का छात्र नहीं, तो वो इंजेक्शन ऑक्सीटॉक्सिन लगा करके उसको दूध को उतारा जाता है। तो 3.5 कुंटल की भैंस इतनी उत्प्रेरित हो जाती है कि दूध देने पर मजबूर हो जाती है। तो किसी न किसी अंश में वो हमें भी वापस मिलता होगा, वो भी हमारी बीमारी का एक कारण मुझे लगता है कि बनता है। तो खाद्यान्न तो इतना हो गया है कि मुझे लगता है कि 60 के दशक में, और मैं एक अच्छे राज्य से हूँ, उत्तर प्रदेश विकसित राज्य है, होली दिवाली पूड़ी कचौड़ी बनती थी, और रिश्तेदार के आने पर गेहूं की रोटी बनती थी। बाकी जिसको आप श्री अन्न कह रहे हैं वही खाया जाता था। और बुआई के समय लगभग अनाज खत्म हो जाता था। हमारे देश के बहुत ही ईमानदार प्रधानमंत्री लाल बहादुर शास्त्री को ये कहना पड़ा कि हम आपको दोनों टाइम खाना नहीं खिला पाएंगे। PL 480 का एक समझौता हुआ, जो समुद्र में अनाज फेंका जाता था अमेरिका में, वो हमको दिया गया और वो हमने खाया। आज हम 80 करोड़ लोगों को 5 किलो गेहूं और चावल माननीय प्रधानमंत्री जी निःशुल्क दे रहे हैं। तो खाद्य उत्पादन में तो हम बहुत आगे आ गए, लेकिन जो अब उत्पादित हो रहा है वो बीमारी का कारण हो रहा है। और जब हम कम पैदा करते थे, थोड़े भूखे रहते थे, लेकिन एकदम ऑर्गेनिक वो था, वो टोटल, आज ऑर्गेनिक बात हो रही है, 60 के दशक तक टोटल सभी फसलें हिंदुस्तान की ऑर्गेनिक हुआ करती थी, क्योंकि घर में गाय हुआ करती थी। तो गाय इसलिए समाप्त हुई है, गाय और बछड़े, हल आ गया, हल चला गया, ट्रैक्टर आ गया, मेटाडोर आ गई, बैलगाड़ी चली गई, इंजन आ गया, रहंड चला गया, और थ्रेसर आ गया तो दाएं चली गई। इसलिए पशु अनुपयोगी हो गए। जब वो यूजलेस हो गए तो वो प्राइसलेस भी हो गए। ये भी एक बहुत बड़ा कारण है कि हम कंपोस्ट खाद का प्रयोग नहीं कर पा रहे हैं। तो मेरे ऐसे तो अनुभव हजारों हैं जिनको शेयर करूंगा, ज़मीनी बातें बताऊंगा, लेकिन एक बहुत बड़ी जिम्मेदारी हमारे विभाग के पास भी है। लेकिन मैंने बताया ना कि वसुंधो कुटुंबक वाली अवधारणा वाला ये देश है। इसको हमने पेंडेमिक कार्यकाल में मोदी जी ने पड़ोसी देशों को दवाइयाँ दे करके और तमाम चीज़ें दे करके हमने ये केवल वेद वाक्य तक सीमित नहीं रखा है, ज़मीन पे इसको उतारा भी है। तो मैं सभी प्रतिभागियों को, जो सभी के लिए सुरक्षित और पौष्टिक भोजन सुनिश्चित करने की दिशा में आयोजित इस कार्यक्रम में भाग लेने और इस दिशा में उनके समर्पण के लिए धन्यवाद देता हूं और भविष्य में निरंतर सहयोग की आपसे अपेक्षा करता हूं। मैं आई एम मेंबर ऑफ पार्लियामेंट फ्रॉम आगरा, द सिटी ऑफ ताजमहल। तो जो हमारे विदेशी भाई बहनें आई हैं, मैं आगरा के एमपी होने के नाते उनको निमंत्रण देता हूं कि ताजमहल को देखने के लिए आगरा ज़रूर आएँ। उसके लिए मैं कुछ आपकी व्यवस्था कर सकूं, मेज़बानी कर सकूं, तो ये मेरा सौभाग्य हो गया। बहुत बहुत धन्यवाद। जय हिंद, जय भारत।
Thank you very much, Honorable Minister Sir, for this very impressive address and a very thought-provoking address. As you mentioned, there's a lot of science behind our age-old customs and traditions, the way we used to prepare food, consume food, store food, and then how we used to treat our animals. All that has now changed. Probably it is time to revisit it for a more healthy lifestyle. And as you mentioned, food for us is not about just satisfying hunger. Food is a blessing of God. Food itself is God. Thank you, sir, for sharing these experiences. In fact, so many ground realities which you shared with us. Thank you. And now I would like to request Shri Suman Beri ji, the Honorable Vice Chairman of Niti Aayog, requesting you, sir, for your valedictory address.
It's not easy to be the last speaker of a two-day conference, but let me acknowledge the dignitaries on the dais, Honorable Minister of State, Secretary, Health and Family, excuse me, Health and Family Welfare, and most of all the officers of FSSAI for pulling off what I think is an unprecedented gathering and apparently a very fruitful one. I'm here also to acknowledge the leadership of the Minister of Health and Family Welfare, also of Health, and I'm pleased that my senior colleague, Dr. V.K. Paul, who is much more knowledgeable on these matters, was able to be part of the technical sessions. Just a word about Niti Aayog, although the MC did indicate what we do. We are the kind of, we report to the Prime Minister, and on an issue as holistic as food safety, we get pulled in a number of ways, but in particular, what I would say is that we work with the states, and as I will indicate in my prepared remarks, there remains a large domestic agenda for the states. But we are here in the G20 year, and globally, food safety is an issue of utmost importance and urgency because unlike what the Honorable Minister of State had to say, food chains are now global. They're not just national. And in an interconnected world where food supply chains stretch across borders, ensuring the safety and authenticity of our food has become a global challenge, but it has also become an element of branding. Traceability has become extremely important, of course, certification of organic status. So there's an issue of obligations to the consumer, and there's also an issue of meeting the demands of the consumer. But we must not forget that contaminated food poses a grave threat even now, affecting roughly 600 million individuals. I was staggered that that would be the number, and leading to illness in almost 1 in 10 people worldwide, and claiming as much as 420,000 lives a year. So this is not an issue of the past, this is an issue of the present. Adulteration, food fraud, counterfeiting have emerged as significant threats. compromising the health and well-being of individuals, and undermining trust in the food system. And as the Honourable Minister indicated, in all societies, food is the staff of life. It is almost, it is the foundation of life. And to lose trust in the food supply is undercutting the very fabric of a society. Developing stringent yet flexible standards, keeping pace with changing consumer demand is thus the need of the hours. Of course, the Codex Alimentarius Commission plays a central role in establishing international food standards, guidelines, and codes of practice, but while bodies like the Codex contribute significantly to food system transformation and sustainability, the role of bilateral and multilateral collaborations cannot be overstated, and the ongoing G20 process with India as its presidency serves as a platform for achieving this objective. Besides, the G20 can also help to mobilize resources and encourage investment in infrastructure, research, and capacity building initiatives to strengthen food standards globally. And by advancing food standards, the G20 can contribute to sustainable development by encouraging responsible agricultural practices, minimizing food waste, and mitigating the environmental consequences associated with food production, of which the Minister has spoken so eloquently. But I will shift from the G20 and the global context to improving food standards in India. And India has made efforts to align its food standards with international norms, and to my recollection, FSSAI is a relatively young institution, and it's impressive how much it has already changed the domestic landscape and the convening power that is exhibited here. Adherence and I would acknowledge that improvements remain necessary in several areas, and adherence and compliance levels vary among different states and food businesses. Given the rapidly evolving food landscape, proactive measures are required to regulate new food products, technologies, and production processes. The complexity of India's food supply chain poses challenges in ensuring compliance at every stage. Monitoring and enforcing standards and certification across this vast system. We are talking of a country with the largest arable land in the world and a very important animal husbandry, I think the largest producer of milk, and an increasingly substantial horticulture. So it's a big agricultural country, even if not present globally. And monitoring and enforcing standards from small-scale farmers to large-scale processing and distribution is challenging. Strengthening oversight and surveillance mechanisms becomes essential, and consumer awareness and education about food standards needs attention, as many consumers lack a robust understanding of labeling, nutrition, and their rights. In the Indian context, FSSAI has been instrumental in formulating regulations, setting scientific standards, and implementing effective enforcement mechanisms. But governments must also invest in training programs for food safety professionals and equipping them with the necessary skills to detect and prevent food fraud. Strengthening penalties and imposing stricter sanctions involved in adulteration and counterfeiting will act as a deterrent, and I'm pleased to note that FSSAI has taken significant steps to strengthen its regulatory framework. It has implemented a robust food testing and surveillance system involving regular inspections of food businesses, sampling of food products, and laboratory testing to ensure compliance with safety standards. Stringent penalties and legal actions against non-compliant entities have acted as deterrents towards food fraud, but there's still a lot to be done. As the Honourable Minister of State indicated, Our Prime Minister, to whom I report, is a great believer in technology as the solution to many of India's development challenges, and technological developments can greatly aid in combating food fraud. Embracing emerging technologies such as blockchain, DNA testing, spectroscopy can enhance traceability, transparency, and authentication along the food supply chain, and certainly sophisticated consumers in India as much as abroad will demand no less. Identification of ingredients and collaborative efforts between governments, industry stakeholders, and technology innovators are crucial for implementing and scaling up these solutions effectively. FSSAI has established partnerships with international organizations, regulatory bodies, and industry associations, and these have paved the way for the exchange of knowledge, best practice, and expertise, and FSSAI's participation in international forums such as the Codex Commission has further reinforced its commitment to aligning Indian food standards with global norms, promoting harmonization, and ultimately agricultural trade. Consumer awareness and education are, though, also important. Empowering consumers with knowledge about food safety practices and equipping them with the ability to make informed choices is key. Government and industry should work together to promote public campaigns, educate consumers about potential risks, and provide information on how to identify and report food fraud. Excuse me. Additionally, if you don't mind, yeah. Thank you. Enhanced labeling regulations can ensure that consumers have access to accurate information about the contents and origins of the products they produce. The importance of food standards should never be underestimated. They help meet food and nutrition goals under the Sustainable Development Goals agenda and also contribute to broader sustainability incentives. While failure to comply with international standards is an ongoing challenge for developing countries, climate change is making compliance even harder. Rising temperatures are increasing food safety risks and expanding the spread of animal diseases and plant pests. It is important for countries to adopt a standard-driven culture across all sectors and promote responsible agricultural practices. By doing so, we can pave the way for a resilient and thriving global food system that supports both people and the planet. In conclusion, let me just thank the Honourable Minister of State for reminding us how far we have come on the basic issue of food security and food access. That is, of course, primordial and fundamental. But as the world gets richer and as India gets more affluent, we have to raise our sights. FSSAI's creation, the vigorousness of its agenda and its implementation, and its convening power in this G20 area are all signs of the commitment that India has to be a responsible global player. I appreciate the honor of being the last speaker. I'm sorry to have kept you from flights and dinner, but my thanks to the organizers for giving me this opportunity to speak to you.
Thank you very much, sir, for your very intellectually inspiring views towards building more robust, dynamic, effective, compliant food standards and regulatory framework, while striking a balance between the consumer protection, environment protection, good health of the people, and trade facilitation. Thank you, sir. And now I would like to request the Executive Director of FSSAI to kindly propose a formal vote of thanks, inviting Ms. Inoshi Sharma.
Shri Suman Beriji, Vice Chairman Niti Aayog, Professor S.P. Singh Baghel, Minister of State for Health and Family Welfare, Shri Rajesh Bhushan Ji, the Secretary for Ministry for Health and Family Welfare, Shri G. Kamlavardhan Rao, the CEO of FSSAI. इस अवसर पर मैं मंच पर आसीन सभी गणमान्य लोगों का धन्यवाद करना चाहती हूँ। मुझे आशा है कि आप सबके विचार देश और दुनिया में खाद्य सुरक्षा की राह को और आसान करेंगे। Our heartfelt gratitude for the insights and guidance of the dignitaries which will go a long way in paving the future work for regulators enhancing cooperation in this field. I would like to place on record that this event would not have been possible without the approval and the constant guidance of the Honorable Union Minister for Health and Family Welfare, Chemicals and Fertilizers, Dr. Mansukh Mandavia. Also, a heartfelt gratitude to Shri Rajesh Bhushan Ji, who is also the chairperson for FSSAI, for his constant support in the execution of this particular program. I would like to also thank all the food regulators from across the world, the scientists, academia from India and abroad, officials from the ministry and the embassies, representatives from the media and industry, ladies and gentlemen who have been part and parcel of this entire event for the past 2 days. We would like to thank each one of you for your insights and contributions to the deliberations and discourses, to the wide range of topics that we've covered from food safety to sustainability in these past 2 days. ग्लोबल फूड रेगुलेटर समिट के 2 दिनों के इस आयोजन में शामिल होने के लिए आप सबका बहुत बहुत धन्यवाद. I would also like to thank the staff and officials of FSSAI, the industry representatives through CII, FICCI, ITDC and Manekshaw Center for their hard work, perseverance and teamwork, who have worked behind the scene tirelessly for the past few months, in fact, to make this summit a success under the able leadership of the CEO FSSAI, Shri G. Kamlavardhan Rao, who has been at the helm of the execution of this event. Thank you, Dhanyavad, Jai Hind.
Thank you, ma'am. And as you rightly said, सभी के साथ और सभी के प्रयास के साथ बहुत ही healthy discussions और deliberations हुई और बहुत ही successful summit रहा. तो सभी का धन्यवाद. और अब इस कार्यक्रम की और समिट की समाप्ति करते हैं अपने राष्ट्र, अपने देश, अपनी मातृभूमि को शत-शत प्रणाम कर. आप सभी से मैं निवेदन करती हूँ अपने स्थान पर खड़े होने के लिए राष्ट्रगान के लिए. Requesting you all to please rise at your positions for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता. पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा. विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा. तव शुभ नामे जागे तव शुभ आशीष मागे. गाहे तव जय गाथा. जन गण मंगलदायक जय हे भारत भाग्य विधाता. जय हे जय हे जय हे जय 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 हे.
Jai Hind. Thank you once again, ladies and gentlemen, for these collaborations, associations. Thanking Shri Suman Beriji. Many thanks to Professor S.V. Singh Baghel, sir. Thanking Shri Rajesh Bhushan Ji. And each one of you. We now invite you to please join us for dinner. Thank you.